Any time of the day or night, always giving you and your family peace of mind. AAA's legendary roadside assistance is a network with over 50,000 vehicles that respond more than 13 million assistance calls every year. If something happens in your road, there are so many benefits to membership, and AAA is there if you're locked out of your car, need a tow, run out of gas.
I don't see a quorum yet. I don't even see the mayor on yet. Okay. We just need the mayor. Okay, I think he's on now. Okay, Jose.
How you doing today, sir? Say something.
Good morning.
Good morning.
I was muted. I was telling you that your beard looks intellectual.
Oh.
I was able to get a cut too. So,
Don't let it get too white, Sam.
oh, I can't help that.
Good
Been
morning,
working
Mayor.
on that, but it's not going to work. How's your week?
Good morning,
Good.
Mayor. I believe we have a quorum whenever you'd like to begin.
Quite the agenda today, huh?
What's that?
Quite the agenda today.
Yeah. You talking about the work agenda? Yeah.
Work session. Yeah.
Good morning, Mayor. I believe we have a
Laura?
quorum whenever you'd like to begin.
Okay, let's begin.
Okay, good morning. This is a special meeting of the El Paso City Council for Monday, May 11th, 2020. It is 9:02 a.m. And we begin the meeting with roll call. On the agenda this morning is the agenda review for the regular City Council and Mass Transit Department board meetings for May 12th, 2020. And at the conclusion of this meeting, we will be convening a council work session. We begin the meeting with roll call. Mayor Margot,
Here.
Mayor Pro Tem Schwartzbein, Representative Anello,
Present.
Representative Hernandez,
Here.
Representative Morgan,
Here.
Representative Salcido,
Present.
Representative Rodriguez,
Here.
Representative Rivera, Representative Rivera, Representative Lizarraga,
Present.
okay, Mayor Pro Tem Schwartzbein and Representative Rivera will probably join us shortly. I want to remind staff and Mayor and Council to please turn on your cameras and unmute your microphones when you begin speaking. Thank you.
Okay, let's go to 3.1.
3.1, Peter Pasilla Police Department. This is an action to amend the interlocal agreement with the Emergence Healthcare. And basically what we're doing here is the Texas Human and Health Service Commission requires that the vehicles that were obtained through the grant secured by Emergence Healthcare at the end of life for the SUVs, the 8 of them that were purchased through the grant, the title must be turned over to the Texas Health and Human Services Commission upon the end of life of these vehicles.
That's the purpose of the interlocal agreement, just to commit.
The amendment.
Oh,
It's an amendment. To the interlocal.
okay. I remind council, if you have any questions, text me at 258-4874. All right, let's go to 4.1. Thank you, Chief. 4.1 is tax refunds, never mind. 5.1, 5.2.
Mayor, just to let you know that I'm on a.
Okay, thanks. Representative Rivera, thank you. Let's go to 6.1.
Purchasing doesn't appear to be here. Richard Bristol Streets and Maintenance, 6.1 is a procurement item. It's to purchase galvanized signposts. This is what holds up our street signs and our stop signs.
Okay. It's a decrease of 21.6%. Good. 7.1.
Good morning, Raul Garcia, Planning and Inspections. 7.1 is the first reading of an ordinance rezoning property to R4 residential. This is for 4805 Atlas and 4806 Titanic in the Northeast. This will permit a single family and or duplex development. We did receive one email, one phone call in opposition, as well as one email in support. And City Plan Commission did recommend unanimous approval.
Okay. 8.1.
8.1 is a second reading of an ordinance approving a detailed site plan and a planned residential development. This is for property south of Sean Haggerty and east of McCombs. This will permit a development of single-family homes. There is no opposition. City Plan Commission did recommend unanimous approval.
Okay. 8.2.
8.2, second reading of an ordinance rezoning property to C1 commercial. This is for 8149 Alameda. This would permit an existing bar, existing beer depot, and an existing live work flex unit. I will be reading an added condition. The condition was added by Rep. Rivera. I will be reading that into the record tomorrow. We do have one phone call in opposition, and the City Plan Commission did recommend unanimous approval.
Okay. 8.3.
Good morning, Mayor and City Council. Jeff Howell, Capital Improvement Department. Item 8.3 is an ordinance to amend various sections of Title 20 to further regulate personal wireless service facilities within the city of
Hang on a minute, Jeff.
Computer designs.
Hang on a minute. If you're not speaking, please mute your phone. Okay, I'm sorry. We had a voiceover there. Go ahead and start over, please.
Sorry about that. Good morning, Mayor and City Council. Jeff Howell, Capital Improvement Department. Item 8.3 is an ordinance to amend various sections of Title 20 to further regulate personal wireless service facilities within the city of El Paso to require better designs for new facilities and further encourage locating within commercial manufacturing zoning districts. The City Plan Commission recommended approval of these amendments to the personal wireless service facility regulations. This recommendation was presented to the City Council on March 17th, and City Council voted to reintroduce the ordinance that included the amendments found within item 17.1 from the January 7th, 2020 City Council meeting. Item 8.3 is the final reading of the ordinance that contains these amendments.
Okay, 9.1.
Good morning, Mayor and Council. Monica Lombrano, Department of Aviation. This is for the termination of the agreement we have with Kemper Sports for the management of Butterfield Trail Golf Course. This item was postponed from the April 28th meeting.
10.1 will be on site and release. We'll discuss that.
Mayor,
Go ahead.
Mayor, on the Kemper Sports one, we do have an agenda item on the executive session that we're going to go into to discuss Butterfield.
Okay. 10.1 will be the presentation on site and release.
Good morning.
Mr. Mayor, and I'd just like to say we did have several meetings with staff, and then we also had several meetings, or I had several phone calls with Speaker Moody, and that item is ready for presentation next week. I'll let I think it's Chief Zoer present the item.
Okay.
Good morning, Mayor and City Council. Assistant Chief Sarud. Cite and release resolution, goal 2, set the standard for a safe and secure city. Basically, we're updating on the cite and release resolution, discussing the infrastructure and the target date of implementation for September 1st.
Okay, thank you, Chief. 11.1. Is that you, Tommy? It's 11.1? Or Robert, or who?
11.1 is Representative Rivera's item.
Okay.
Mayor, there's a couple of these items. This is Robert Cortinas. There's a couple of these items under the Mayor and Council section that we're going to be addressing in the presentation this morning.
Okay. All right. 11.2, is that part of that too, Robert?
These are all, Mayor, these are all council items.
Okay.
That were placed, resolutions. And so I think 11.1 all the way to 11.8 are all items being placed on the agenda by Representatives Rivera, Representative Rodriguez, Representative Schwartzbach.
Okay.
I don't know what that background noise is. It's not coming from me.
Okay. Please.
Okay, so all these items are items placed on the agenda by the council. Representative Rivera placed some, Representative Rodriguez, Representative Schwartzbein, and then Representative Hernandez, Anello, and Schwartzbein placed the last item on the agenda. So all 11.1 to 11.8 are all council agenda items. And as Robert stated, a lot of this will be covered during today's presentation.
Okay. Mayor Pro Tem?
Yeah, Mayor, I just wanted to make a request that item 11.4, the presentation by Dr. Alozzi, be moved to the forefront of the agenda.
Okay.
We'll add it to the proposed revisions.
Thank you.
Okay. All right, let's go into...
Mass transit.
Yeah, let's go to mass transit.
This is Alan Smythe, Managing Director of Sun Metro. First item, of course, is the approval of the, and then the second item, the third item is purchasing.
Yes. Victor Carabeo with Purchasing and Strategic Sourcing Department. Item number 2 addresses strategic goal number 7, enhance and sustain passive infrastructure network. The linkage to the strategic plan is subsection 7.3, enhance regional comprehensive transportation system. This is a replacement contract for a new flyer, Navi aftermarket parts. The current contract expires on July 10, 2020. So this contract will start on July 11, 2020. This is a sole source requirement, requesting that the Director of the Purchasing and Strategic Sourcing Department be authorized to issue purchase order to Transit Holding Inc., DBA, the Aftermarket Parts Company, LLC. This is the manufacturer, source, and authorized distributor for many customized components such bodies, chassis, suspension, windows, etc., using the Sun Metro fixed route fleet, with the stipulation that the vendor provides an updated sole source letter and affidavit this year.
Okay.
Okay. Item number 4 also addresses strategic goal number 7. Enhance and sustain passive infrastructure network. The linkage to the strategic plan is also subsection 7.3, enhance regional comprehensive transportation system. This is a replacement contract for rebuilt electrical components. The current contract expired in June 11, so this contract will start in June 12, 2020. is a low bid procurement. 22 vendors were solicited, 2 local vendors, 3 bids were received, 0 from local vendors. No protest was received for this requirement. We are recommending to award to Kirk's Automotive Inc., Muncie Transit Supply, and the Aftermarket Parts Company, LLC, the lowest responsible bidders. Also, the Muncie Reclamation and Supply Company, DBA Muncie Transit System, be deemed non-responsive in Group 3 for not bidding in all items in that group. And Transit Holding Inc., DBA the Aftermarket Parts Company, be deemed non-responsive in Group 5 for not bidding in all items in that group.
Okay. Ellen, do you want to add anything? You're muted. Ellen, you're muted.
Okay, sorry about that. Item 5 and 6 are both the quarterly reports for the lift and for the fixed route performance. And that's all we have.
Okay. I don't see any questions. All right. Laura, let's move on to the next one.
Okay, may we have a motion to adjourn the agenda review meeting?
So move.
Second.
There's a motion and a second to adjourn the agenda review meeting. All in favor?
Aye.
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 Yes.
Anyone opposed? And the agenda review meeting for Monday, May 11th, 2020 is adjourned at 9:15 a.m. Good morning. This is a work session of the El Paso City Council for Monday, May 11th, 2020. It is 9:16 a.m. We continue the video conference and telephonic formats due to the pandemic. We begin the meeting with roll call. Mayor Margot?
Here.
Mayor Pro Tem Schwartzbein?
Present.
Representative Anello?
Present.
Representative Hernandez?
Here.
Representative Morgan?
Here.
Representative Salcido?
Present.
Representative Rodriguez?
Here.
Representative Rivera?
Here.
And Representative Lizarraga.
Present.
Thank you. The first item on the agenda is discussion and action with Combined Arms and the Chief Military Officer to update council on the results on the El Paso Veterans Needs Assessment.
Mayor and Council, good morning. My name is Paul Albright. I'm your Chief Military Officer. I pray everyone had a wonderful Mother's Day and a relaxing weekend. This is an informal presentation to inform you of the findings of the El Paso Area Veteran Needs Assessment. This Veteran Needs Assessment was conducted by Combined Arms, an organization that exists to accelerate the transition of our military members to civilian life and to integrate our veterans into the community by connecting them to valuable resources. This survey was conducted for 6 weeks across the El Paso region from February 5th to March 18th of this year. This briefing will be presented by myself, Mr. Lance Lear, the chairman of your Veteran Affairs Advisory Committee, Monique Rodriguez of Combined Arms, and Dr. Eliza Bora, the director for the Institute of Military and Veteran Family Wellness at the University of Texas in Austin. To begin with, I want to address the importance of a formal veteran needs assessment. For years, veteran advocates have been addressing what they felt were the priority needs for our veteran community. We knew the community had employment and educational needs, mental and physical health needs, transportation and financial needs, and affordable housing needs. But we did not have data to back up our claims. Not only do we not have data, but we never formally asked our veterans what they needed on a large scale. We now have the veterans' voice and accurate data to back up the true needs and gaps in services within our veteran community. I'll now turn it over to Mr. Lance Lear, who's going to brief the logistical timeline of our assessment.
Good morning, Mr. Mayor, members of council. I'm Lance Lear, chair of the Veterans Affairs Advisory Committee. The assessment timeline, you can see, looks long for a very good reason. Once we got approval from the supporting entities, we were able to work the survey questions.
Mr. Lear, will you please turn on your camera, sir?
Okay.
Thank you very much.
So continuing, we were able to work the survey questions to get the best possible questions put in to get out for the city's goals. We started with some other city surveys, and we went through a process of combing through them to get a good start point. This took place over numerous meetings with the stakeholders, and we were able to get the survey to reflect what we thought was necessary. Once the agreement on the survey content was made, we quickly got the survey deployed, and again, it ran from the 5th of February to the 18th of March. And we were able to get an absolutely tremendous response, stomping all these other cities out there, which is a testament to El Paso's veteran community. A lot of that response was due to the town halls being done, and I must point out that Mr. Paul Albright did a great job getting those scheduled, advertised, and accomplished. The VAC sees the results tie into our existing plan quite well. With employment and information needs placing at the top areas, we think we've tied the needs assessment into our program well, and we can move forward with our issues confidently. So with that, pending your questions, I'll be followed by the Combined Arms team, who will brief the highlights.
Proceed.
Monique or Dr. Eliza Bora, you're on. Combined Arms teams, are you there?
Hi, everyone. This is Monique Rodriguez with Combined Arms. And so as an executive summary to our report, we had 1,460 respondents to the survey. There were 1,125 veterans that responded, followed by 241 family members and 157 volunteers or employees of veteran serving organizations.
Ms. Rodriguez, may I ask you to turn on your camera, please?
Oh, sorry.
Thank you.
And so the respondents represented really a range of racial and ethnic and economic and years of age, education levels, and household incomes. Both pre and post 9/11 veterans both need the most support in filing claims. There's a large percentage of post 9/11 veterans that need support with mental health care, employment, child care services. And despite the level of need across all of the areas, a very small percentage of pre and post 9/11 veterans are currently receiving services. This is a map of where all of the heat map of how respondents reported. As you can see, the red is where we received the greatest density of respondents. And then it slowly goes down to orange, yellow, and then the blues. As a reference to understand, we did get a wide range of respondents from across the area. As you can see here, the respondents vary. This is kind of a chart that shows who our respondents are. As you can see, also 32% of the respondents were female. The data within the military shows that it's only about 15 to 18% of women who serve in the military. So we got nearly twice that amount as far as respondents goes within the survey. So that really does show that we got a good reflective response with the female representation. Also regarding the age, you can see that it covers a wide range of ages across the spectrum, with the average age being 50.3 years old. So the level of need, there were 5 levels of need that were greatly reported within this. There were claims assistance, by far the highest, employment, followed by mental health, legal, and then locating veteran-centric social groups were identified as the 5 highest needed items within the community. Here we've got a chart that really talks about the level of need by service type. The light gray color really shows that people identified as having a high level of need. The darker blue in the middle line shows the moderate need, and then the lighter kind of royal blue is the low need. This chart is categorized from bottom to top by the gray, really showing that high level of need. And as you can see at the bottom, the claims, the things that we already identified earlier in the slide, those are the top bottom 5 items. Next. The sources of our information about services where people said that they currently go to seek information regarding services, the VA by far is the source that most veterans go to seek information from, followed by friends, other veteran organizations, the internet and social media, and downward. Next slide. Here we find the respondents were asked to identify the gaps in service areas. So at the bottom, each row represents the number of respondents who answered yes and whether they were any gaps in services, while the top bar represents those who indicated no gaps. And so as you see here, once again, benefits being at the very bottom as far as identifying as gaps go, and then followed by employment, healthcare, and education. We also see here that with housing, there is a significant gap as well. I know that there is currently funding regarding CARES Act and some rental and mortgage assistance available through the city, and so really being able to market some of those resources as the community. There seems to be a lack of awareness of those resources currently available within the community. All right, next slide. And then when it comes to gaps in benefits assistance services, as you can see here, just the access to the information is the greatest gap. People simply just do not know where to access that information, don't have information on it, and don't know where to go. Followed by healthcare, veterans access to any kind of care, mental health, family assistance, and then access to the VA. The top gaps in employment include just employment support in general, support for bilingual employees, and then there's just not enough high-paying jobs. Gaps in employment for family members, spouses and children and dependents, things of that nature. Gaps in employment support, as well as the lack of information available. On the employment status side, you can see here that, the bulk of the respondents were employed full-time at 53%. 20% were retired. Another 10% are disabled and not able to work. And then 7% were unemployed and looking for work. Of course, this occurred right before COVID. We actually closed this survey the week of spring break or the week prior to spring break. And so this does not reflect the COVID time period at all. This was really right before that increase in unemployment occurred. So just be mindful of that. And we may need to put a notation of this as well. And then 5% were students that are not looking for work. And then there's an other, as well as those that are 2% that are self-employed. We did ask a couple of El Paso specific questions. And one of those was, are you considering leaving El Paso area to find better employment? Thankfully, only 69% of the respondents said no, that they are going to stay in the community, while 31% reported that they were considering leaving the community to find employment elsewhere. Gaps in education, the lack of information available, once again, is the highest gap as it was in employment, just lack of information. And so marketing a lot of these different resources will be helpful to the community. System barriers and really just the lack of support is followed by next, as well as the lack of transparency and accurate information about what kind of benefits they're eligible for, lack of access and availability, and then there's just not enough support for family and spouses. Gaps in the essential services, childcare accessibility tops the chart here, as followed by, once again, information, lack of gap in accessibility of information. Food, once again, this was prior to COVID. We know that food has been a huge need within the community, and so this information may have shifted versus the current situation now. And then veteran recognition and support of services, as well as the financial aid accessibility. The gaps in legal services, once again, it's about a lack of knowledge and information that's available in the community, as well as the veteran-specific services. There are legal aid services, but then there are also veteran-specific services, including like discharge upgrades, appealing the benefits decision. So there's just a lack of information when it comes to those. Affordable access to legal services. Obviously, legal assistance is expensive for an individual to cover, and so getting access to affordable legal assistance is really necessary. And then they need more access to specific types of legal services. There are so many different types of legal aid or legal services, and not knowing that their situation may fall into one of those brackets. And then once again, just gaining access and navigating existing services. These are what the respondents provided us. When it comes to business development and entrepreneurship services, there's a lack of, once again, information. So I think marketing is going to be a huge key factor for the community and really bringing awareness to what currently exists, and even those that do not exist. Barriers surrounding startup funding resources, financial barriers, and then sometimes there's just too many barriers, and there's a lack of support for some marginalized groups. And then the existing services, it sounds like, are poorly run based on the feedback that we were provided. When it comes to housing, there's the respondents reported that there's lack of options to shelter and affordable housing. Lack of availability and access to veteran-specific resources. They also reported there's too many homeless veterans. There's lack of, once again, information and available resources, and lack of availability to food pantries and affordable food. On this chart, we display the current housing types of the respondents. The bulk of respondents, 70%, did own a residence, and while 23% were renting. Another 3% were sharing their home with someone. We did have a 3% of other type of housing situation, and then a 1% reported that they did not have current stable housing. We also asked respondents, why do you feel that they are at risk at losing their current home? The highest respondent was really just the lack of stable income, coming in at 48% of respondents. And then followed by an other that they had to specify. The details of that other will be in the detailed report. This is just a summary of what that report states. Another, 9% of close to 10% of individuals said that they can't afford their property taxes. 7% said they can't afford the maintenance. And then those also 6% said that they can't afford the utilities of their home, which puts them at risk of losing their current housing situation in the next 6 months. The most common barriers across the service area, once again, as I've reiterated several times in these slides, is really the lack of availability and accessibility. There are systematic barriers when it comes to receiving care. The lack of information, as I've reiterated as well, they just don't know what is available to them. And then the lack of veteran-specific support. Based on the information we gain, veterans really want to continue working or being a part of veteran and military networks, and so they just simply don't know where to go and finding that support. And then the financial barriers, being able to afford the things that they need in order to succeed and thrive. Here are more of the El Paso specific questions that we asked. Do you feel El Paso is a community that respects veterans? A high number reported at 81% yes, and with the 19% saying no. Do you feel El Paso is the #1 place in the nation to live as a veteran? 54% said no, and 46% yes. So there's some growth, so opportunities for growth for the community to continue to improve, how veterans can access and be able to thrive in that community to help increase those numbers.
All right, thank you, Monique. She will be available for more questions here at the end of this. So this is our final slide. And the way ahead is for us to stop doing business as we know it. No longer do we hope the veteran can find an organization to answer their questions. We need to synchronize efforts with the 4 major committees that are displayed here to exercise a unified and collective strategic plan focused on specific lines of effort. We recognize some of our gaps are related to marketing and outreaching program. Actually, the majority of them are. And some of these gaps are going to require more resources provided to available programs. But most importantly, we recognize our identified gaps in services and will implement new processes and procedures to fill the gaps. The county, city, chamber, and your local VA are working together like never before, and we're laser focused on the lines of efforts that you see on these slides. You've selected the right people to represent you on the Veterans Affairs Advisory Committee, and everyone on the committee is excited to finalize our plan of action to support our veterans, and we look forward to discussing with you further during your next presentation on June the 8th. In the interest of time and to protect your extremely valuable schedule, your appointed veteran representatives are available at a time of your choosing to further discuss the entire report in more detail. So subject to your questions, this concludes our presentation.
Paul, this
Mayor and Council, I'd like to make a few comments. This committee has done an incredible job of working this issue with respect to the needs and the assessment that took place. Other cities have done this, but as the board member Lair mentioned, the El Paso community really knocked it out of the park, and it was due in part to the partnership with the county, also with all the folks that are on this call and how much they pushed on this effort. I also want to remind the council that the city has been engaged with the DAG grant and obtaining dollars from the state over the last several years. And this year was no different. We were involved in submitting a grant application for that. And so we've been successful in that, in the work that we've done there. Also, not just the fact that I want to talk about this committee, but before this committee was put in place, the council put the committee in place as a board to look at a lot of issues, not just the needs, but just across the board, just other things where we can have more exposure on our website. And they had several recommendations, several reports that they've made. As a city, we brought forth several initiatives that we did not have before. We have a luncheon for the veterans that have served in our community and that now work for the city of El Paso. We have Mr. Albright as the liaison who's doing a lot of work there. So the city of El Paso has been committed to veteran issues for quite some time now. We don't just say it, we do it. And the partnership with Fort Bliss is getting stronger and stronger. Before COVID-19 pandemic happened, we had Soraya Ayub in communications department under Laura Cruz Acosta's leadership do a segment for Fort Bliss to kind of showcase a lot of the things that they do out there and have a show dedicated just for the efforts out of Fort Bliss, and that's never been done before. So there's a lot of things and a lot of movement afoot in what we're doing in partnership with Fort Bliss and also with the veterans in our community.
Paul, this item is listed as discussion and action. What is there an action item you want the council to approve?
No, sir, not at this time, Mr. Mayor. It actually should have probably been labeled just discussion. We're not going to take any action at this time until we dig through the report a lot further and come up with a solid strategic plan for action.
Okay, well, it was well presented. Thank you, all three of you, for the presentation. As everyone knows, Fort Bliss is our largest employer and always will be. I don't see any questions being asked by other council members. Thank you.
Thank you, sir.
Thank you.
The next item is a presentation on the COVID-19 budget and also discussion and action on a resolution authorizing the City of El Paso to approve the appropriation of the grant funds received from the CARES Act. We do have 12 members that signed up to speak, so I encourage those 12 members, if you're not already in the queue, please dial in now and remain in the queue so you'll be ready when public comment is taken.
Mayor, I'd like to start this presentation. This is Tommy Gonzalez, and kind of give an overview of some of the things that we've done as an organization, if you allow me. So back in mid-March is when this began, and a lot of what our workforce was doing, a lot of the front line of first responders, including police, fire, public health, streets, and maintenance, and environmental services, continue to be physically at work. That's approximately a little bit over 50% of our workforce that was still on the job. And then we had another 35% that we got online very quickly in order to continue the work at hand. So over half of the workforce was always physically still present when this pandemic hit. So I just wanted to share that with the council. There's a lot of work that's been done, a lot of things that you've approved over the course of this last 60 days, because we're on day 60 of the pandemic. Online very quickly. So we've done citywide operational and financial data analysis that continues to be worked, including mobility patterns and economic impacts, workforce protection protocols, employee communication that we've sent out multiple times to our employees to keep them informed. We reworked our public transit plan. We have also worked on a back-to-work phased-in approach for city personnel that are administrative in nature, that we have not gotten physically back to work yet. That's being aligned with the phased-in approach with the COVID-19 testing that's taking place in the expansion of that and the antibody testing. We've also worked with hospitals with regard to the capacity surge and the CARES funding that we're talking about today and what we're recommending. That direction from the federal government came this last Monday. So establishment of a new business resource website has also been stood up. We established a small business loan in connection and in partnership with the county. And so that was $2 million through the LIFT fund. We've also had a partnership with the county for the food bank dollars, where we put $200,000 aside as two organizations came together for our community. We've also developed business site safety protocols for the industry at each different businesses, and that's being worked and shared with the businesses as they are starting to open back up. We also had a partnership with Workforce Solutions for daycare assistance. Our public health department, since the onset of the COVID-19 crisis, has been responsive to our community and followed the practices and the guidelines according to the CDC. These guidelines, as you know, and the supplies that are being provided federally have changed throughout the process. So throughout this crisis, federal regulations have evolved, and public health providers have been required to be flexible and responsive to these programs and regulations. For example, the drive-through testing facility was first only available for individuals over the age of 65 with symptoms and first responders with or without symptoms. This restriction of testing was then relaxed to those over 65 with signs and symptoms and those with underlying health conditions with a fever greater than 99.6. So as this has progressed, the guidelines and the rules have changed as well. We're working with a number of public and private partners throughout the community to ensure the testing is now available to anyone who is symptomatic. Since 20 April, the federally sponsored drive-through has been available free of charge. There's also an additional lane set up for local Quest Lab clients, and there's also a third lane dedicated for public safety personnel. We've also been planning ahead during all the work that's taking place with respect to the pandemic. We have a new partnership with UTEP. The city is expanding the current lab capacity in order to do more testing and to expedite the test results. The UTEP lab is expected to be up and running and supporting the Department of Public Health-led testing by the end of May. Once this is operational and we trained UTEP faculty and trained staff, we'll be able to assess approximately 500 samples in an 8-hour shift, and results will be available in 24 hours. We've looked additionally to increasing our testing capacity. Since early April, we've increased it about 32% with the Department of Health and some of the private labs that have increased as well by 32%. We currently have tested 2% of our population. Next month, we plan to be at 3%, and the following month to be at 5%. The antibody testing that I mentioned earlier, I sent an email to the council, an extensive email on the work that we're doing for the testing of our workforce. So we began a subset of public safety and healthcare workers last week. We're going to continue another subset of essential workers this week, and then the data from these two groups will be compiled and analyzed the week of 18 May. And then that's going to be reviewed, and then prior to expanding testing to the general workforce, we're going to review all that data. We anticipate expanded testing to begin 1 June. We've also increased the number of people we have for contact tracing. We've expanded this program in partnership with the Health Department, Fire Department, and Texas Tech. Our community partners have also been vital. The county, as I mentioned earlier, with the partnerships that we've forged with them, hospitals, higher education institutions like with UTEP, and also school districts. We've worked with them very closely. I'm going to share some of the new things that are coming with our school district and the new testing sites. The cluster management task force has worked in a strike force approach to testing across the community, not waiting for hotspots to flare among our most vulnerable. This means that when cases are diagnosed, all those in direct contact will be tested. This proactive approach is another action we're taking to limit and stop the spread of the virus. We're also helping to support the vulnerable members of our community, including food security, financial support, senior and child care, domestic violence prevention, and assistance in a variety of enhanced services for the homeless community. As you know, we identified 2 shelter sites the city owns for the homeless community, and we continue to do more. We have expanded the drive-through capacity through a partnership with the Walmart with 3 locations. That happened this past Friday. And then we also have a partnership with all the area ISDs, not just the biggest school districts inside the city limits, but also into the county. We forged a partnership with them on Friday to have testing sites in all of the school district locations. So that has just been completed this past Friday, and that'll be up and running by the end of this week. We also are, in terms of planning ahead, we plan on a partnership with the CVS, very similar to the Walmart model. And we also have a surrounding community COVID testing sites that I'll let Mario speak about later and during his part of the presentation. In addition to all of that, we have 2 task forces, additional task forces for education and compliance. Finally, what I'd like to focus on before we get into the meat of this presentation is that there's 3 things associated with this pandemic that, because of the flurry of information that's being shared, I think sometimes is lost because of just the daily situation reports that you receive, the daily press releases that are sent out, and just the press conferences that are had. I mean, the public is just being overwhelmed with a lot of data that they're receiving. But there's 3 main points related to this pandemic that I'd like to get across to the council and to the community. Number 1, this disease isn't just a concern for the elderly. Our largest rate of infection in El Paso are among people in their 20s. So we should not feel like there's an invisible cloak of protection for our young people. We all need to be mindful of that. The second point is that as a community, we have underlying health issues very prevalent here in El Paso that increase our risk regardless of age, and that includes high blood pressure, diabetes, and obesity. That's been something that's been studied in El Paso for a very long time. That should not be news to anyone. But those kinds of underlying health conditions exacerbate the issues once someone contracts COVID-19. And then thirdly, I think that we have gotten this point across, and that is social distancing and wearing a mask, how important that is to protect others, not necessarily protect yourself, as the studies and the data has shown. So those are the 3 points mainly. Again, one, that the young are not invincible to this disease. And secondly, we have underlying health conditions. And thirdly, to social distance and wear a mask. So with that, we'll turn it over to Nicole Cody, who will continue the presentation to speak directly about the budget.
Nicole, you're muted.
Sorry about that. In everything that we do, we always have our mission, vision, and values in mind for our community and the vision that we have for El Paso. And how we're going to explain how we'll be using the coronavirus relief funds is no different. We're always mindful of our strategic plan. Included in that is ensuring our continued financial stability and accountability through sound financial management. Today we will be discussing, as the city manager mentioned, the action that we're going to be asking you all to take, a brief overview of the strategies that we are working on and will be able to deliver with this funding, as well as the recommended uses and strategies that they will detail. So today we're requesting that council take the action below to approve the appropriations of the $118,956,278.90 from the Coronavirus Relief Fund. We are going to ensure that we maintain under the three-pronged measures that are part of this CARES Act legislation, that we are ensuring that all expenditures that incurred during this public health emergency, as well as those that are not accounted for as part of the budget and incurred during the period from March 1st to December 30th. On March 27th, the federal government enacted the CARES Act. As part of the provisions included in the CARES Act, they also approved the Coronavirus Relief Fund. So it's very important that we distinguish that this is just one part of the overall CARES Act that we are looking at, and there are additional provisions that provided additional funding mechanisms as well. But this funding dollars that we're talking about today, the $119 million, is specifically the Coronavirus Relief Fund. $150 billion was appropriated to address the economic fallout throughout the country. On April 22nd, we received the first initial guidance provided by the United States Department of Treasury. And then on the 23rd, shortly after, we received the $119 million. And as the city manager pointed out, the last guidance that we did receive was just last Monday, on May 4th. So we've been working diligently as a team in order to ensure that we are going to meet those three criteria established by the government for the use of this funding, and to ensure that we're meeting and developing the strategies that are needed to make sure that our community is sustainable under this emergency. We've worked with all of the departments, and we've been working closely together to ensure that we are truly addressing the needs and any gaps that we have within services for our community. An important part of this is we will continue to coordinate the process for also tracking all of those expenses to ensure that they're allowable under the provisions provided.
Hey, Nicole,
so what are we doing with this funding?
Nicole, can you go back to that slide real quickly? I just wanted to make another point. This is Robert. So that first bullet point there about utilizing various sources. So as she mentioned, April 22nd, we received the initial guidance from the U.S. Department of Treasury. And that initial guidance was 4 pages, and it was very, very broad. There wasn't a whole lot of detail. Not a lot of specifics included in that initial guidance. So between what the city manager did as far as setting up meetings with the other city managers across Texas, CFOs from those same cities were also meeting to try to talk about, our interpretation of that guidance and how those funds could possibly be used. I know the mayor was working on several, different areas as well, working with the other mayors across the United States. And I actually got to sit in on one of those meetings to, see how they were planning to utilize these funds. And then on May 4th, we did receive a little bit more information as far as some additional FAQs as to a little bit more specifics, but still the guidance that's been provided thus far is still pretty broad and vague. And so working through, as Nicole mentioned, ensuring that we're going to make sure that however we expend these funds, even with the recommendations that we have, we're going to have the processes in place to ensure that all funds prior to any expenses will go through a review process to ensure we meet that 3-prong criteria.
Thank you, Robert. So the use of this funding and the strategies that we're about to talk about today is really preparing for the long-term response, making sure that El Paso is prepared for possible additional waves of outbreaks, the surge at our hospitals or possible surges, as well as potential future shelter in places, and still adapting and ensuring we are able to come out ahead on the continued impact of our financial crisis. What you'll see below are the recommended allocations for this funding, with public health and safety at the majority at $84.2 million, then followed with the community response and recovery programs at 16.4, and then economic development recovery plan and recovery programs at 18.4 million, for the total of $119 million. Next will be Chief D'Agostino, who will be able to discuss the public health and safety response for our community.
Thank you, Nicole. So this presentation is going to go over a few points. If you can flip, there you go. We're going to talk about testing, what we've done, kind of a little overview of what we've done to date, and how we're going to direct some of this funding going forward in what we need to protect our community. So to talk about testing, contact tracing, and epidemiology, as well as our education and prevention programs and compliance. So let's start off with testing. We're gonna talk about PCR, and those are the nasal swab tests that we've all heard about. PCR testing is for those who are symptomatic. It tells you if you currently have the virus. It's for our priority populations such as healthcare workers and first responders, those over 65, those with underlying health conditions, and those with high-risk contacts, so those who've been in close contact with a positive case. Currently, we have our testing through all of our drive-through sites. It's open for anyone with symptoms. 90%, and a point to remember here is 90%, since all of those are open to people with symptoms, 90% of those come back as negative. So we're only seeing 10%. Like I said, it's a snapshot in time, and it's almost a false sense of security when you look at testing the entire population, because it's only for that day. The best use of critical resource is to remain using it on symptomatic. I would like to announce, though, we talked about, Mr. Gonzalez talked about some of those new assets that came in, and we got the mobile testing teams that were sent out from the governor's office and the state of Texas. Well, we opened up 4 additional locations starting today, and we did just get word that those are for anyone who, including people who are asymptomatic. So that allows us to get a sample set of our community of those who with not just symptoms, but others who want to get tested. And I strongly encourage everyone listening to set up an appointment or even go by one of the drive-through sites today and get a test conducted. As resources increase, this asymptomatic approach will continue to build out in our community. We're starting off with first responders, healthcare workers, critical infrastructure, and then persons who work in those vulnerable populations. So those who are working in our dialysis centers or in our senior living facilities. Then we've been talking about antibody testing. Antibody testing tells us if we've had the virus. It's right now it's being used for priority populations. We started last week with, as Mr. Gonzalez was stated, we started out with first responders and frontline healthcare providers. As we go through the next couple of weeks, we're adding in critical infrastructure and essential personnel. That'll be prior to our June timeframe when we're hoping to get some of the general population in. What we're following is we're following the CDC's CASPR method, and that's a community assessment for public health emergency response. That allows us to get that scientific sample set so we can actually determine what our community looks like as far as hot zones and areas of critical need. Right now, we currently have the ability to test 5,000 with antibody testing, and we're expanding that to make that number even higher. We're looking for the visibility of penetration of the virus that we've had within our community. So what we're trying to do is we're trying to stand back and determine now how many people in our community actually had it, were asymptomatic, never knew about it, and hopefully now have moved on and are now it's unknown, but they say there's some type of immunity, but that's some of the study that we're trying to do with that. As we go forward with the asymptomatic testing of those that's going to move into, besides the general, when we move into the general populations, part of the critical infrastructure, I guess what I'm trying to say, is going to be those persons that work with the vulnerable populations. Again, those assisted living centers, nursing homes, and those mobile testing teams I talked about, those 4 locations, Armijo Rec Center, Nations Tobin Park, Esperanza Costa Library, and Memorial Swimming Pool. Those were identified by using our heat maps. So we're constantly looking at heat maps and all of the data we have to determine where's the best place and where do we put the next drive-through or testing location. So we take that in connection with where we have our hospitals, current medical facilities that are already doing testing, where we have our state and our federal drive-through lane, and we're trying to expand on that. So we're following that heat map and making sure we're covering all areas of the community, especially those in highest need. As we go forward with the agreement that we talked about with the school districts and one of the private labs coming in town, or that's in town. As we go forward with that, that'll also help to fill those voids within the those heat maps on our concentration of patients. Those locations are also opening up, and we have those going up in the county. So there's several locations going out there. So we're looking at a county-wide, region-wide approach to it, and those skill districts will mimic that same map. So as we go forward, we'll make sure that it's included in all the identified areas. We also talked about a partnership with UMC for rural testing. So they're going to start doing some of the testing. We'll test the samples out of our public health laboratory, but they'll be collecting those samples out of existing structures that they currently have. This is going to allow us to get more testing out to the community and go forward with our desired goals of where we want to be with testing in our community. We've also partnered with UTEP on the COVID laboratory expansion that Mr. Gonzalez talked about. That's going to increase our numbers of testing capabilities to 1,000 a day. And that private laboratory that we're working with the school districts, that's an additional 1,000 a day. So by adding those two, you can see how we're going to really start to multiply the number of tests going through our locations. We'll also be looking at drive-through. As we go through with this funding, we're looking at drive-through, long-term drive-through locations and private testing locations. How can we make sure that we, as a community, we're prepared not only for this initial onset, but as they say, another wave is to follow in the fall, especially as the flu season comes upon us. We want to make sure that we have plenty of locations to do the immunizations for influenza, and hopefully we'll come through with a sorry, lost my train with that. Hopefully we'll come through with a treatment for the COVID-19 itself and be able to give immunizations for that as well. If we can go on to the next slide. Looking at our contact tracing and epidemiology. So long term, we know that this is going to be with us for months. And we want to look at how can we properly identify and continue to expand our program as it's gone. Well, let me start back with where it started. The staffing for epidemiology within the Department of Public Health is usually at around 7 people. That's, for normal times, that's more than sufficient staff. When you enter a pandemic, you really have to be able to grow and expand largely. So we went in early on and we did an assessment of it, and we kind of built out a 3-phase approach to it. So the first one was where we did the initial analysis. We moved into the integration of what else can we do, what kind of technology is out there, how can we capture that, and then how do we build out the organization without putting a huge demand on the current staff who are busy working this pandemic, so we can get the training and everyone in place. With that, we've been able to take advantage of people from the Department of Public Health who are working in other areas that currently aren't open right now. We are utilizing fire department staff as well. Some of the crews from the airport are assisting. Our training academy and various other divisions within the department are focusing on doing that contact tracing and assisting epidemiology with gathering that data. We partnered with Texas Tech, and I believe we got more than 58 students over there to come on board and help us as well. So they're actually doing some of the contact tracing and some of the investigative work, working remotely from home. That is huge. We've taken that staff now to well over 154, and we've broken it out in a way where we can expand on it as we go and as it's needed. So even though we're built out to 154 and we're fully trained in that aspect of it, we're currently only using about 88. And that's based on daily demand. So as you see, yesterday was a lower number. A couple of days last week, we had some really high numbers. You bring a lot more staff in so you can make sure we're able to contact everybody and start doing that contact tracing so we can identify and hopefully get everyone tested who needs to be tested. So working forward, the state of Texas is coming up with a new contact tracing app. It's also the programming that we currently use. It's a statewide system that public health departments utilize. It's an older system, a little bit antiquated. They're coming up with a newer version. They're working out the bugs right now. They're hoping to go live with that in the next couple of weeks. And we're hoping that will really help streamline some of that. That, in addition to that contact tracing app, is going to allow us to get better data, better calculations on who people have been in contact with, especially those who are at high risk. Some of this, what we're looking at is how can we expand that? Since our epidemiology team and our contact tracers has grown so large, it's also based around a call center, and we're really tying our educational task force, because later slides we'll get into that, on how the educational task force is an extension of contact tracing and epidemiology, so we can get the word out and get the public properly educated as well as isolated, so that we don't continue to spread this disease through our community. As we get into our education and our expanded outreach, we're looking at the continued education session on disinfecting facilities. So what does that mean? We know that this pandemic is going to be with us for a while, and as different businesses, different offices within the city of El Paso itself are opening up, we need to have everyone properly trained on how do you properly disinfect your facility. What's the proper level of protective equipment do people need, whether it's working in a restaurant, working in an office environment, or a fire truck or hospital. We need to make sure we have identified all the proper protective equipment that are needed and make sure we have it so we can get back into an opening phase that's responsible and take into consideration the limitations on our community. With that, the importance of social distancing. So part of that education task force is just reminding everybody how important it is. It's about that close contact. We wear a face mask. Face mask doesn't supersede distance. You need them both. We need to keep that 6 foot distance, and we need the face mask. The way very early on in the pandemic, what we did is we sent those education task frames out, and we sent them out to malls and public areas, trying to educate as many as we could. They had a large effect. They really got a lot of material out. We did a media campaign as well, and you've all seen some of that that's going out. What we're going through now is more of a consolidated approach. And so what I mean by consolidated approach is now our team is going out after clusters. So if we see a nursing facility, we saw a couple of cases rise in one, we sent the task force scout to address all of them. So we went out to evaluate their PPE, their distancing within the center, to offer them both guidance and recommendations so that they could handle it properly. They go out on that task force. They also went into some of the healthcare and some of the different businesses where we've seen clusters of forming, and it's trying to give them that extra knowledge. It's also an extension of epidemiology or contact tracing in the fact that it allows them to report back and give them a better picture of what's going on within that subset of our community. This education and expansion is also, as testing availability comes up, it's going to be critical. We need to push the campaign. As I've stated several times, we've met the demand. And some people think that that's not a true statement. And what I mean by met the demand is early on when we got that federal lane stood up, we were able to test 250 through that lane from day one. We could never get the demand to fill those lanes up. We were averaging 50 to 100 on a daily basis. It wasn't until the last week or so where we've seen those hitting those peak days of 250 testing. So with these new, again, back to those new sites that we opened up today and the availability of testing for those who were asymptomatic, I really hope our community takes advantage of that and gets out and gets tested. It's as we're justifying the need for this testing to the state and to keep their assets here on the ground, we need to make sure that we're utilizing it so we can justify our requests. Employment and training programs for furloughed employees. It's how can we tie in our own staff, to assist us with contact tracing, investigations with educational task force. It's taking a whole look at the whole approach and who can help out in what capacity. And that's one thing we really want to focus on going forward as this pandemic continues. We also added some additional vehicles for the personnel. We have a lot of people. When I talk about the education task force, we have 50 to 100 out at any one time. They're going out throughout the entire community, and we're just trying to have an approach on everybody. Prevention and treatment. So as we go forward, I talked a little bit about the investments we need to do as far as our vaccines, and that includes the flu. When you couple this pandemic on top of the flu season, it's going to be a very difficult time this fall. The symptoms pretty much mimic each other. So it's just one of those difficulties that we're going to have to get through. So we're really going to need to focus on that prevention and treatment aspect of this pandemic with a whole complete social media, public information. It's got to be 100% towards getting everyone immunized this year for the flu. We have some robust programs within the fire department, within healthcare, Walgreens. Everyone's doing flu tests, but we still find our community being underserved. These flu vaccines. We really need to push and get our community on board to make sure we do get that. As COVID-19 vaccine comes out, that'll be the next part as well. And so we're looking at the same as those testing sites. What can we be using for facilities as far as vaccinations as well? So they'll be dual use facilities. I think it's a wise investment going through with this pandemic, because we really are going to need this for the next several months into this time next year. We need to make sure we have the availability of personal protective equipment. And so it's, right now we are working with the state of Texas. We're working across purchasing, set up a very good team, our logistics team within our Office of Emergency Management at the EOC. We are tracking PPE purchases across the city as well as the county, trying to maximize our resources and how we can do that. We're getting a lot of state assets that are coming in. Those state assets are being housed as well. So we're looking for that large warehousing operation. We are starting to build that stockpile, but we need to make sure it's there, because it's still just the beginning of this pandemic. With that, a lot of those state assets, we're supplying hospitals, doctors' offices. We're looking at a whole community approach. We're getting requests from dental facilities. I mean, pretty much everyone who's getting back to business has been reaching out and getting supplies through this system. The compliance aspect, we want to make sure that we are covering existing and future costs for our compliance efforts. We've had teams around the clock since the onset of this, as the directives have been going out, and so we want to make sure that we're taking that into effect. And that's a lot of going forward, is making sure that everyone is in compliance. It's a combination of compliance and go back to education. That education compliance portion. We're also looking to partner up with the Better Business Bureau, with the MCA, and then how can we look at it from a business approach? How do we help them? So we need to get out and help them educate. We need to look at, some businesses are doing it really well. Their social distancing, the marking they put on the floors, the signage they have through their facility, the way they control the flow of customers through their buildings is exceptional. Well, we need to capture that and help all businesses get to that same point so we can continue to open up in a safe and responsible manner. Thank you.
Thank you. Next, we have Community and Economic Development Support.
Good morning, everyone. Good morning, everyone. This is Nicole Farini, Director of Community and Human Development and Chief Resilience Officer. I want to just start by saying how much work our entire team has put into assessing not only the availability of funds in terms of how many dollars there are, but also really trying to assess what the need is. And that's not just the community development team that I'm referring to. I'm referring to this entire organization, economic development, public health, emergency responders, OMB, OTC, all of the folks on the team that have really come together to identify how we can best have an impact in this community. As I mentioned, we knew early on that we were going to be getting some support from the federal government. There was dollars deployed through the CARES Act in the federal entitlement, which is the Community Development Block Grant, and our Emergency Solutions Grant. Those dollars became apparent very early. But as we move forward and we started to see the additional dollars come in that Nicole Cody was talking about at the onset of this presentation, it became increasingly clear that it was important that we get out there in the community and not just make assumptions about what the need is, not be reactive and just push out dollars for the sake of saying that we pushed out dollars, but rather getting out in the community, understanding from the grassroots up, from the people on the ground, what the need was. And so we did several things to create that informed approach to the deployment of funding. We engaged community very broadly, educators, researchers, students, residents. We formed a vulnerable population support task force very, very early on. I want to say that the initial meetings of that task force occurred in late March and early April. And that task force consisted of over 20 different service providers in the social services sectors, a lot of them primarily focused on providing services for those folks that are most vulnerable. One of the key results out of that vulnerable population task force was the standing up of the alternate emergency shelter environment at the Delta site. That was something that we did as a community early. We invested dollars early. And I am very, very proud to say that as of today, and I keep saying this as of today, I've been saying this for a couple of weeks now, but as of today, still, we have 0 confirmed cases of COVID positive in the homeless community. And that is a direct result of our ability to take quick action, understand the issue by engaging our service providers on the ground and getting this stood up. We could not have done that alone. We did that with many, many partners. And that's something that other communities across Texas and across the nation cannot say. And so I'm very, very proud of that. We also engaged with our folks on the Fair Housing Task Force. The Fair Housing Task Force is focused on issues of equity and prevention of discrimination and displacement on a regular basis. This is a task force that is in existence and that we convene regularly around those issues, but it was especially important to convene them in light of the COVID crisis because we understand that there's so many questions in terms of folks that are in need. There are questions about rental assistance. There's questions about utility assistance, mortgage assistance. There's questions about the way that funding will be deployed, the way assistance will be deployed. And so we activated the Fair Housing Task Force, not in its normal capacity, but in its capacity to advise us in terms of serving those most vulnerable of populations and making sure that we are able to provide for their housing needs, their basic needs. We also deployed a community-wide service provider needs assessment. This was in essence a needs survey that went out to the folks that are providing services to individual El Pasoans. These are the people that know best what the need is because they are on the front lines of those needs. We deployed that survey, and then we compared that survey, frankly, to a national survey that went out from the National Community Development Association. So again, not only were we out there asking folks what the need was and deploying surveys, but we were doing the follow-up and making sure that we were using data to back up what we were hearing in terms of community perceptions. I also want to mention that at the time that we engaged with a particular group or task force, focus group, roundtable, needs assessment, whatever we were doing, there was immediate follow-up by staff, one-on-one conversations. And I want to note that in the last 2 weeks alone, 2 to 3 weeks alone, we have had over 200 touch points with service providers and community members informing us and helping us stay abreast of what the very active situation is on the ground. We have talked with folks from nonprofit organizations such as the Hope Border Institute. We have spoken with both the Paso del Norte Community Foundation and the El Paso Community Foundation extensively. We vetted our approach to deploying funds with the Family Resilience Center Steering Committee. If some of you all may not remember, but the Family Resilience Center is something that was stood up following the event of August 3rd and was focused on understanding the needs of individual El Pasoans in the community following that tragedy. And so this is a group of folks that have come together, service providers, mental health clinicians, the city, the county, private philanthropy as well, all in the same room. And so we engaged them, again, to help inform our efforts. We have then vetted our recommendations and our thought process, not only locally, but at a state level with the Texas Housing Network Focus Group. This is a group of my counterparts from across the state of Texas, the big 6 cities in Texas. We are talking with those folks. And so a lot of the feedback we got from our community members was, are you guys looking at what city of San Antonio is doing? Are you looking what the city of Austin is doing? And the answer to that is not only are we looking at it and researching it, but we are talking to the folks that built those programs. And frankly, not only are we collaborating with them, but we are leading those groups as well. They are looking to us for best practice as much as we are looking to them. We then vet our recommendations at the national level, and then finally at the global level, leveraging the Global Resilient City Network that we have been a part of for well over 5 years. And again, collaborating, but also leading in those places. We then come back and again, make sure that we're validating the perceptions, we're validating the research, looking at the information provided through the Federal Reserve. We are working with the University of Texas at El Paso, researchers and graduate students there to, again, fact check and analyze the information that we're getting from the ground. And then finally, we look at what our social service provider trend data has been over the course of the last several years. And this is a point that I think is very, very important for us to make, is that we haven't, the COVID crisis has not created a lot of these challenges that we're seeing, particularly in the vulnerable populations, whether that be in terms of housing or economics or even access to health care. These are issues that existed before, and they are being magnified and exacerbated by the COVID crisis. And so for us to be able to look at the provider trend data from prior to this crisis really gives us a baseline by which to measure what we need to do and how to best deploy the funding. If we can go to the next slide, please. So as a reflection of that engagement, and I'm just going to take a quick second because the city manager has asked me if I would share an example of the kind of engagement that we've done. So I'm just going to share my screen very quickly here, and then I will come back to the presentation. I hope everyone is seeing my spreadsheet right now. When I spoke earlier to the point that we have had over 200 touch points with individuals in the last 2 weeks alone, that multiplies, 4 or 5 fold. You do not have, you cannot see my screen? I'm not sure. I'm sharing. Does anyone see my screen?
I can see it, Nicole.
Yeah, it's showing, Nicole.
Yeah, I see it too.
Okay, good. Representative Rivera, I'm happy to share this with you as a follow-on if you cannot see it.
Thank you.
It's literally just an example of not only the number of touch points that we have had, over the course of the last 2 to 3 weeks, but rather how we are analyzing that. And so you can see the variety. This is a little bit of a beast of a spreadsheet, but you can see that we are engaging across civil society, academia, business, government, all types of partners, private philanthropy as well, looking at the factors that they are bringing to our attention and attaching critical need measurement to that, as well as attaching those to not only how urgent is the need, but what are the primary drivers of that need. For example, as I mentioned, meeting the basic needs of El Pasoans: housing, food, shelter. Some of you all will have seen the headlines regarding the lines at the food bank, for example. And so we have attached all of those needs to drivers and sub-drivers. This is a very, very analytical process that then spits out for us a tool that indicates how and where and with what urgency we need to deploy funds. And so with that, I'm gonna go back to the presentation, and I hope that I haven't gone too far on emphasizing the outreach, but I just think it's so important for everyone to understand that we did not make this up. This is not something that we did in a reactionary posture. We have been very, very, very diligent in terms of reaching out. So as a result of that, you see the wheel there to the right that I just shared with you how that's created. You can see that there is a tremendous amount of urgency in the red in terms of meeting the basic needs of El Pasoans, and only slightly secondary to that, supporting livelihoods and employment for El Pasoans. So this is about how are we meeting our basic survival capacities as a community, and then how are we then supporting livelihood and employment so that El Pasoans can get back to meeting those needs on their own. And so with that, we have identified programs under housing and basic needs to the tune of rental assistance, utility assistance, mortgage assistance, rapid rehousing, which in essence means if you have been displaced, we want to get you housed again as quickly as possible. Food security, again, I mentioned how this was incredibly important. We're seeing the need at the food banks. We're seeing not just at the food bank, but also in terms of the requests that we're getting. So food security being incredibly important in the long run. Finally, the establishing of a community assistance fund. This is something that we know from past experience can be very, very effective. After August 3rd, we set up the One Fund El Paso. Some of you all will remember that. And that was about getting money where it was needed the most, and screening that through our strongest community partners. So the Community Assistance Fund is something that we are very, very much in support of, and we are ready to allocate funding to. Overall, in that category, we have committed to our community, to individual El Pasoans, just over $11 million. And I will tell you that this is a number that we are going to do the most we can, and we're going to have the most impact we can with the limited dollars that we do have. Finally, livelihood and employment, which is the second category that I mentioned to you. This is about getting El Pasoans back on their feet as best as possible, with a focus on the vulnerable populations and the mom and pops, the backbone local businesses, the small micro enterprise folks that are out there, 0 to 5 employees, that again make up the backbone of our community, investing in them and investing in their needs and getting their doors back open. We also have identified a need in terms of independent contractors. These are the painters, the hairstylists, the nail technicians, the landscape folks, the folks that are out there on a day-to-day basis that are self-employed and frankly fall through the cracks of some of the other federal programs that are out there. We know that a large portion of El Paso's business community is and are independent contractors, and so we've identified that as well. And then finally, we would be remiss if we did not address the digital access issue for vulnerable populations. This is an issue that was, the city was addressing previously. We had expanded access to Digital El Paso, and we had also expanded the MiFi program, which is where you could check out the mobile internet at our libraries. This expanded digital access, this funding here, would be specifically for vulnerable populations to expand programs like those, but specifically so that kids can get back to school, and access their lessons online, as well as access telecommuting. Again, as the chief mentioned, we know that this is not the end of things. Even as we get back to work, we are facing wave 2 and 3, and we need to make sure that our small businesses are prepped for that and that our families are prepped for that. So we are proposing an expansion of digital access. That number is just over $5 million. Total investment in our community, in our people, in community response and recovery is just $16.4 million. And I believe that is the end of my time, and I want to turn it over to, oh no, I'm sorry, I have just a little bit more. I almost forgot. How could I forget the entitlement funding? I do want to be very clear here, and it's highlighted. These funds are separate and apart from the relief funds that overall we're talking about in this presentation today. This is the CARES Phase 1 entitlement funding, Community Development Block Grant, and Emergency Solutions Grant funding. Again, we're still addressing those same categories that I mentioned before: rental assistance, rapid rehousing, food security, but what you're seeing added here as direct support is programs that address domestic violence and abuse in our community, as well as shelter and support for the homeless in our community. We have already deployed a significant amount of funding in the homeless support category. We mentioned already at the top of the presentation the emergency shelter that has been stood up. By the time all is said and done, we will likely have invested just over $1 million in supporting shelter and provision of services for the homeless immediately during this crisis. And then also, we mentioned earlier the $100,000 that was deployed to the food bank very early on. These dollars would be supplemental to that. In terms of livelihood and employment, one of the things that we can intervene with the entitlement funding to do is credit counseling and bankability. This may seem like an issue that, Nicole, why is this important during a crisis time? Why are you talking about my credit score during this crisis? Well, I will tell you that what we've seen both nationally at state level and then here locally in the deployment of assistance to small businesses, that a lot of those businesses do not and cannot qualify for the assistance that's being provided to them because they don't have a credit history, they don't have a credit background, or they have a negative credit background, or they have limited bankability, and so they are unable to access those traditional financial institutions to help support accessing those funds. And so this funding would go towards making sure that our community, those moms and pops that I talked about, are positioned well and have the support they need to access the funding that is coming from the federal government. And I believe that is the end of my presentation, and I would like to hand it over, I think, to economic development so that they can talk about the complementary programs in the economic development world.
Good morning, Mayor and Council. Jessica Herrera with Economic Development. I think I just want to reinforce a lot of what Nicole touched on with regards to just mirroring a lot of the data and getting a lot of the response and feedback from the community here regionally has been something that we also in economic development, along with our partners to include the El Paso Chamber, the Hispanic Chamber, the SBA, the SBDC, and so many others from the public and private sectors to include our county as well, have been working very closely on ensuring that we provide a solid program with response and recovery efforts that right now, when you look at just the surveys that we've administered since the onset of this pandemic, really what we're looking at is that these national surveys are also mirroring what the local business response have been. When you look at the number of responses that have been flooding in terms of just the need, the number one most pressing concern is indeed the financial assistance that many of our businesses are needing right now. They're looking for information on resources, on just a clearinghouse for data, understanding, since this shifts on a daily basis, a lot of these businesses, as we start the reopening of these phases throughout our economy, it's very important that businesses have consistent information coming in from the different areas that they're looking towards for support. And then, of course, as we're reopening the economy, I know that our fire chief talked about the health and safety of the employees and as well as the customers that they serve, the public that they serve. That's the number one concern for many of these businesses, and making sure that we provide the number of guidelines. For example, the city manager talked about the WorkSafe guidelines. Those are areas that are very critical. We've been working with the UT Houston of Public Health with Dr. Mena to really help reinforce and work with the MCA, work with the PP collaboration that we're seeing happen just across the region to understand exactly what types of industry-specific guidelines are important to start to get out to those businesses that are starting to reopen. Now, when you look at just the key takeaways, I mentioned that nearly half of those respondents are employing less than 10 people. And that's important because our community is really comprised of a significant number of small businesses. Nearly 2/3, they cannot remain in operation for more than 6 months. So we're all understanding that they are taking advantage of these loan programs, whether it's the federal level or whether it's traditional banking that they're securing here with their respective lenders. However, as this crisis continues and as this impact and concern grows, many of these businesses really don't have a long-term sustainability. About 2/3 have applied for the SBA programs for the economic injury and disaster loans, as well as your payment protection loans as well. But keep in mind that many of those businesses still exist that still have not been able to secure this type of funding or were not eligible for this type of funding. And I think working in conjunction with what Nicole was mentioning with community development, we have a significant number of those vulnerable businesses that still need that assistance. But keep in mind that payroll also was overwhelmingly identified as the primary use of financing. And so when you look at just payroll, there's a lot of other expenses that these businesses just across the board, irrespective of the industry, are having to take on and they were not prepared for. And so that's an area for us that we want to just give you a clear overview of the types of programming that we're planning with this funding. Next slide. Now, when you look at just what we've done on top of the surveys that have been issued out by many of our partner organizations, we've also taken a look at the portfolio that we carry within the city and within the county. And we've understood that, a lot of the pressing concerns too have been the lease or debt payments that many of our businesses have. Of course, making payroll, understanding that there is a demand for product, whether that's the supply chain, there's a significant lag right now with receiving a lot of that product. And then understanding the types of resources that are available at a federal, at a state, and at a local level is really something that many of our businesses have had to dedicate a significant amount of time and employees to really allocate more of this information that's changing on a daily basis. Financial assistance is critical. Many of our businesses are looking for grants, for loan programs, for tax relief. And so this is an area of concern for us as we continue to move forward and as we continue to reopen our economy. We've reached out to our lenders across the region, and we've had significant support from a variety of lenders, as well as the community development financial institutions. They've come in and they've really helped address a lot of their challenges that they're having as they're adhering to local lending to a lot of their businesses and taking a look at their portfolio. They're saying that it's still very difficult for a lot of these micro and small businesses, of those that have less than 10 employees, that are still not able to secure those additional resources. And keep in mind that they view the city, they view the county as an area that we can help address, almost like having a central repository for information, for resources, because there's so much out there that I think in terms of clarity and in terms of understanding and in terms of the outreach that they're going to need support into to their businesses and their clients, it's very important that they see the city take on that role and be able to lead as we move forward. Just to give you an understanding of the need and why we are anticipating the funds to go towards many of our small businesses. When we partnered with the county with the LIFT Fund, and we did that partnership in conjunction to really help serve small businesses. We did a zero interest loan program. We did a grant program. We had an overwhelming need. 618 applications were received, really totaling a little over $178 million. it was requested in financing. And keep in mind that what both the city and county were able to do was really put together a little over 1.2 million once you take a look at what was needed. And we still know that there's a significant number of businesses that still were not able to secure this type of assistance. Nicole brought up the credit counseling and the either lack of credit, no credit, negative credit. There's a lot of concerns out there where we also need to be proactive with those businesses that are still not eligible to receive these types of lending or these types of financing. But it is important that we provide them with the assistance. Next slide. And so what we're looking here in terms of our recommendation from an economic development perspective, there's 3 areas here, right? And I think when you look at just the goals of what we're really trying to do is address the first
Jessica?
most immediate concern. Yes, sir.
I just want to add one thing for the council and for the public to hear, that it's important that the work that you are doing, I know that people probably are thinking that that the economic stimulus package kind of speaks for itself, but I think it's important for the community to understand and the businesses that are listening, as well as the council, that a lot of what you are doing is helping them so that they don't have additional loans out there, because some of this from the federal government, not ours necessarily, but from the federal government, can be forgiven if they follow certain rules. So that's going to be very important so that they don't have additional loans out there, because I'm sure that a lot of these small businesses already had loans. And we just want to make sure everybody who's listening understands that's the reason why we're working so closely with the business community, to help them and educate them so that they can be in the best financial footing possible as they start to recover and their businesses start to recover.
That's correct. I think what we're trying to do is just limit the additional burden that they're already having to face. As I mentioned, a lot of, the concern is really maintaining that cash flow, having that ability to be able to provide for a lot of those expenses and those upcoming expenses that these businesses will have to take on. And so our strategy here is to make sure that we provide a grant program that really could help offset their rent, utilities, their supplies. Keep in mind that a lot of these supplies, we're looking at, the additional PPE, additional equipment, additional retrofits that they need to do to their own respective businesses to be able to provide for that safety and well-being of their employees and customers. And so what we want to do is we're allocating approximately $10 million, and that's really to expand that grant program for these types of small businesses, providing additional information on just available financial assistance. I keep mentioning the clearinghouse and having a central repository for existing and future resources. That's very critical. We've been hearing that over and over from different types of sectors across just here locally, but also when we reach out to our counterparts throughout the state and understanding more or less what they're facing. This is also something that they've stated that many of their businesses are looking for. When you look at invigorating demand, what we mean by that is there's going to be an opportunity to really help expand these businesses, their customer base, right? Many of them are having to go in towards a e-commerce platform, understanding that many of our small businesses don't even have those type of platforms available. Many of them have not received any training with regards to just the basics, whether it's a website development, whether it's just understanding a lot of these other business tools that our chambers and other technical assistance providers can provide assistance towards. It's very important. We're looking at a lot of the targeted affected sectors. We realize that the hospitality, the retail, restaurant, and services industry is one of those sectors that's the most impacted. And we also want to understand that there's going to be a need to be proactive and start providing that training and support so that these businesses can have that ability to be sustainable and to be able to adapt to just the changing conditions between now and the near future. Restarting and continuing operations. I think one of those areas is probably also very, very critical. We've allocated a little over $7.8 million, And again, this is to address a lot of those barriers, whether that's barriers to operation, barriers to expansion. Many of our small businesses don't have those funds now in place, and they won't have that ability to provide, the necessary safety mechanisms and protocols that these businesses will need to have in order to be successful and be able to adapt. And so giving them the ability to increase access to the digital access for remote work opportunities, as well as equipment for PPE supplies, and just the alterations that many of these businesses are having to make. We've taken a look at business licensing and permitting fees. If there's an opportunity there to help provide that relief, many of that is just upfront, right? It's a lot of what our small businesses are needing right now is anything that we could do upfront that we could just decrease that additional burden that they're going to have to face. That's very, very important. And so when you look at just the total investment, that's a little over 18.4 million. But keep in mind, Mayor and Council, there's health and safety first responders, but I think there's also the economic first responders, and there's many folks right now across our community that are really helping to provide that assistance. And keep in mind that our small businesses carry a little over 80% of our jobs here in El Paso. And we really need to do what we can to help them weather this storm. And with that, I believe there's a few other slides. I'm not sure if Nicole wants to go back.
If I can chime in real quickly, Jessica, thank you for all of that. One of the other things you heard in Nicole Farini's part of the presentation, also in Jessica's presentation, is not just using these coronavirus relief funds to address some of these main issues, but so whether it's in the community development portion of using that CDBG and the ESG additional funding to augment and supplement. On the economic development side, thankfully we have the economic development, our impact fund. We have the new auxiliary fund, and then with the El Paso Electric franchise agreement that you all approved, and that was recently passed and approved, we have those additional funds which are restricted for economic development purposes. And so one of the things that Colonel Weston's been talking about is how we go about, utilizing those funds, maybe changing the way that we've done in the past, but utilizing those funds to help augment and supplement what we're doing here with the actions through the coronavirus relief funds.
Before I get
Nicole, before you start, I'm sorry to interrupt, but I know that you're going to start asking council for action items. And before we get into that part of it, I wanted to simply inform the council that, a lot has been thrown your way. I know that's been very difficult to process all this information. I know you've been asked questions by the media, all different kinds of folks in terms of how this information has been fast and furious. Just to put it in perspective, you're not making it up. You're not dreaming it up. I mean, it's really happening. I mean, El Paso 311 and 311 requests, we have over 18,000 of them. Situational reports that you received 95, and we're in day 60 of the pandemic. So that's a lot of reporting, and every situational report that you receive has a summary page and has 6 or 7 documents, and then it's followed by a press release. So there's a lot of information that you have to digest and make sense out of. The press conferences that we've had over 16. There have been 12 virtual. I mentioned the press releases. There's 132 of those. We put out 23 informational videos, 24 if you count the one that was just done for Mother's Day, that was done in English and in Spanish. We have made a tremendous, placed a tremendous emphasis and had a big push during Easter, during Mother's Day, and it was both events were successful in terms of having people stay at home more and not go out and about. In terms of just the types of complaints that we've received. So that's how we monitor that or be able to gauge that. We had 17 emergency alerts. We try not to just place emergency alerts out on a daily basis because then people don't pay attention to them. They just tune it out once they get that emergency alert on their phone. But over 60 days, there's been 17. So Every third day, they've received an emergency alert, if you put it in that type of perspective. Emails and reports internally that have been going back and forth, over 84,000 of those. There's been several thousand emails and reports to the council directly that you've received. Council requests, you've had 275, and we've had 22 presentations, not counting the ones today. That's a lot of information to process. So that's the reason why early in the overview of this presentation we're giving to you, I attempted to place this in the proper perspective, and that there's really three issues that we have to pay attention to, and that is that this isn't just attacking the elderly, attacking a lot of folks in their 20s, especially here in El Paso. I talked about the underlying health conditions that we suffer from here in El Paso with the diabetes, the high blood pressure, things of that nature. And then finally, I talked about how it's important to distance and wear a mask to protect others from you, not the other way around. So it's a lot of information, a lot of things to process. There's a lot of things coming your way and being thrown at you. And I just wanted to give a summary of all of those reports and all that information that is being thrown at you and that you have to process. It is a lot of information. There's a lot of things to sift through. But rest assured, those areas that we reported on today will be given an overview, where we talked about the financial aspects of this pandemic. We talked about the operational aspects of the pandemic. Also, a lot of the stakeholder input that has to happen in order to give the best recommendations in terms of how to spend that CARES funding. That's taken place. You heard that in spades from Nicole Farini. And then finally, the economic work that's being done and all the partnerships that are in place with all the different community partners that have stepped up in a big way to fight this pandemic. So I know that Nicole's now going to talk about some of the action items, and you might have questions about that and things that you might want to discuss when it comes to that. So Nicole, I'll turn it over to you, Nicole Cody.
Before we get into the action items, we have two. Have you finished the presentation, Nicole?
Yes, sir. If I may, Chief D'Agostino wanted to be able to provide the heat map that he was referring to earlier.
Okay, let's do that. And then if council members, I have two council members who signed up to speak, and if they don't mind, we can go to public comment before.
Sounds good.
So looking at this map, I wanted to give everyone an idea of where we have current testing locations. If you can follow the heat map of where we have a trend of
he muted. He's muted. Is he muted? Did he mute himself?
part of another part that I didn't discuss earlier was our plan to get us to more testing. So currently we're right around the 2% range, like Mr. Gonzalez said. We plan on being at 3% by the end of the month and 5% at the end of June. That's going to continue to grow. And as we see these test sites pop up across our community, it's that community-wide approach. It's getting these public-private partnerships as well as the Department of Health to continue this push and this effort to get more testing into our community. A big part of it is that those Texas teams that are on the ground today, those new sites, that's the first time we've been able to test for asymptomatic people. So you do not need a symptom to go through those test sites. I can't stress enough that we need to take advantage of that so we can reach our goal of 5% in June and to continue growing from there. Thank you. That's on the testing plan. As Jessica mentioned, the partnerships with the MCA and the PPE needs for our community. I forgot to bring up earlier the fact that there's a decontamination unit that was brought in from the state level. It's actually a Battelle unit, which we have a partnership with them, and we'll let Dion Mack talk about that in a few minutes. But that unit gives us the ability to reuse, by sanitizing N95 masks, we'll be able to reuse them up to 20 times. That capability allows us to sanitize 80,000 masks per day. That's a huge capability. The best thing about it is it's not just for our immediate community, it's also for the community to the south. So we're going to be able to help our sister city, Juarez, Mexico, in testing, not testing, I apologize, in sanitizing the N95s so we can go farther with the PPE that we currently have. With that, yes, Tian was going to talk a little bit about the Battelle.
Okay, we need to hear that. Thanks.
Yes, sir. Thank you.
Good morning, Dion Mack, Deputy City Manager. I just wanted to take an opportunity to talk just for a few seconds about the relationship that we've developed with Battelle through the MCA. As you've heard through the various presentations, it really has been a community effort to make sure that we have the resources we need to come out of this pandemic as strong as we can. You certainly understand through all of the various things that we've talked about today with the partnerships with people within the community who are experts in the field of understanding the need, to ensuring that our businesses have the resources they need to be able to move through this and move forward, that we really are trying to make sure that we are coordinating well to make sure we have the resources in place to make sure that our community has everything it needs to be able to move through this and also be able to talk about all the steps that need to be addressed throughout the process. We began working with the MCA on this specific initiative in early April. I do have Ms. Emma Swartz, who's on the call, as well as Ms. Nicole Brennan, Dr. Brennan, who is with Battelle. And I want to ask Dr. Brennan to introduce for you just in a few talking points what Battelle is bringing to the table, and also ask Ms. Emma Swartz to talk a little bit about how the funding came together for this, which I think is really important and shows a huge investment in what we're trying to accomplish here. Ms. Brennan? Dr. Brennan, you're going to have to do *6 if you're muted.
All right. Sorry about that. Can you hear me?
Yes, ma'am.
All right. Thank you, Dion, for the introduction, and thank you, everyone, for letting us work in the community. My team and I are very grateful to be working with you and happy to be contributing to this effort. Dion just asked me to do a couple of points around Battelle in general, so wanted to let you know that we are the largest independent not-for-profit research and development organization with a mission just to provide societal benefits based off of research and technology. So that is what we do from day to day as we take scientific advancements. We work to build new scientific advancements to offer benefit to the world. For example, building the decontamination systems in this time of need. I'm so grateful that one was able to come to El Paso recently, and we've been able to extend the use of it across numerous communities. So happy to answer any questions about Battelle in general. I know that we're going to speak more at a later date, but let me know if I can answer any questions for you.
Thank you, ma'am. Ms. Swartz?
Good morning. Yes, thank you so much. We're very excited about this public-private partnership and to help fund the Battelle project. This was funded by the Paso del Norte Health Foundation, the Hunt Family Foundation, the Foster Family Foundation, the Public Service Board, our water company, El Paso Electric, the One Gas Foundation, Westar Bank, and TransTelco. So a great effort from our donors to make sure that we can bring great resources to the community like Battelle.
Thank you, ma'am. So what we're planning to do is, as we talked about today, there are lots of partnerships that are happening throughout the community. We're going to begin to do bi-weekly updates as a part of the regular update for council and all the various partnerships so that council can have a better understanding and the public as to the activities and all the work that really happens throughout the region to help us to move to a better place and out of this pandemic. Thank you.
Okay, Nicole.
real quick, Mayor, while we have the map up, let me just reiterate one of the other points that Mario made just for council and for the public. Mario mentioned the coordination that's been done with the school districts to have testing sites, mobile sites set up within each of the school districts within the next 7 to 10 days. And so one of the things that he's doing now is using the data that comes from this heat map that shows where our most impacted areas are within the community, and then using that as a basis for accessibility to the public. So this map will actually grow to show those very specific sites once those are coordinated, and we believe just a little over a week we'll have additional sites set up within each of the districts. So I just wanted to reiterate that.
Okay, well, if this concludes the presentation under item 2, then I'm going to request Laura if you'll go to public comment.
Yes, sir. This morning we have 12 members of the community that signed up to speak on this item. The first person is Ms. Susan Goodell. She will be followed by Demetrio Jimenez, Carol Bow, and Laura Ponce. Ms. Goodell, if you're on the line, ma'am, *6 to unmute your phone, and you'll have 3 minutes. I don't see Ms. Goodell unmuting her telephone. We'll move to Mr. Demetrio Jimenez. Sir, *6. Good morning, sir. You have 3 minutes.
Good morning. Thank you. Good morning, Mayor, Margo, and Council. My name is Demetrio Jimenez, and I'm the COVID-19 Task Force Chair for the El Paso Apartment Association. Full disclosure, I think my presentation will go just beyond 3 minutes. Our organization is made up of 280 member companies who provide rental housing and the products and services required to operate rental housing, with over 48 rental homes, most of which are in the city of El Paso. Our focus during this crisis has been to work together with our tenants to create a viable solution to keep them in their homes and keep a viable housing supply regardless of the eviction moratorium. And we've not charged late fees, and we've provided payment plans to approximately 6,000 families. That only covers April, and we're now in May's rent that is owed, and many are not able to pay. As an industry and as a society, we must ensure the existence of our community's housing supply and are looking to the city to assist us in providing rental assistance so these families can continue to maintain their home and allow rental industry to continue to provide shelter, the most basic human need. The El Paso Apartment Association has a contractual relationship with over 48,000 plus households, and is the organization who already has identified over 6,000 families. Keep in mind, these 6,000 families have already worked with us. They're under a payment plan, did not pay April. They may not be able, or probably will not be able to pay May's rent and or June's. So we respectfully request an emergency housing assistance plan for $12 million for families who earn at or below 80% of the area median income. We propose $1,000 monthly cap for at least 2 months. The average rents in El Paso range from about $790 for a 1-bedroom to $1,090 for a 3-bedroom, according to the American Community Survey. We propose that these funds be channeled through an affiliate nonprofit, a 501c3 called Under One Roof, whose mission is to provide emergency relief to tenants who have gone through a catastrophic event like a fire, flood, death, and now this pandemic. This nonprofit is now working to be fiscally managed by the El Paso del Norte Community Foundation to help administer these funds. Under One Roof has also recently applied to the Texas Department of Housing and Community Affairs for rental relief and is awaiting word on its status. These funds will be used for the county of El Paso. And keep in mind, these funds, they're only allocated on a regional basis, and it's only going to be $300,000, which is a drop in the bucket. We propose that funds come directly to the property owner or to the property management company, but the tenant would be the one to apply, with our help, of course. Now, this would hit both the city's community response under the Nicole's presentation.
Thank you, Mr. Jimenez. You've reached the 3
economic.
minutes, sir. Mr. Jimenez, you've reached the 3-minute limit, sir.
Because you have a lot to
Does he have a lot more to finish, Mr. Jimenez? Do you have Mr.
I'd like to motion to suspend the rules so the gentleman can finish.
I second.
I do have some.
We
other
don't
questions.
need to make a motion. We just need to let him finish. Let's go.
Thank you. Now, these 6,000 families will apply to under one roof, and PDN via their board will provide oversight to these families applying and forming a review committee to provide transparent rental assistance. This would be a huge step in the right direction. This plan and these funds are critical to help everyone, both the mom and pop industry that's here in El Paso and also the renters. We propose, and it's unfortunate that we weren't part of the discussion as a stakeholder. These are real numbers, guys. This is families that have come to us that have said, I can't pay April's rent. We did address it with them. They're under a payment plan. We're unable as an industry to pay our bills as well. This would kill two birds with one stone. I really thank you for your commitment in helping our community through this difficult time. And although 12 million is a large ask, it's not enough. It's really not enough. We don't know how many more will come out of the woodwork. There are families that we have not, they have not contacted us. We hope that they're not using this as a rental holiday, but we hope that they're just afraid to come out, and we continue to work with these families. Keep in mind the rental eviction moratorium expires on May 18th. We will still continue to work with these families. We hope to mirror this, much like Dallas and Houston have done. We've got a lot of information. The general assistance fund through the county, we would mirror it in the qualification process. There's no need to reinvent the wheel, but we feel that as an industry, because we have a contractual relationship with these families, we're 1 degree removed. We can move quickly to provide funds to help these families get through this rough time. Thank you for your consideration.
Thank you. The next
that concludes
speaker.
my presentation.
Thank you, sir. The next speaker is Ms. Carol Henry Bowl.
I apologize, Laura. I've been asked to respond quickly. I just want to mention to Mr. Jimenez, we have reached out and we're definitely aware of the need, and we received the letter from the Apartment Association, and we are absolutely all over this issue. As I mentioned during my presentation, my portion of the presentation, rental assistance is the primary need that we have identified in the community, and we, under Housing and Basic Needs, had allocated just over the $11 million to a number rental assistance as well as a number of other things. And so we are looking forward to working with all of our stakeholders in terms of building the policy framework that can get the dollars to those folks in need and still adhere to the federal regulations. And so following council action today, we're anxious to get with all of those stakeholders again. And I say again because we have been out there doing that, and we're standing ready to assist those in need.
Mayor and Council, this is Laura Cruz-Acosta, Strategic Communications Director. Just to add to Nicole's commentaries, she is also working in the Public Affairs Office in regards to reaching out to all the stakeholders, as well as reaching out via non-traditional methods.
Thank you, Laura. We'll move on to the next speaker, Ms. Carol Henry Bowl. Ma'am, *6 to unmute your phone, and you may begin speaking for 3 minutes. Good morning.
Okay, good morning. My name is Carol Henry Bowley. I am the Executive Director of the El Paso Coalition for the Homeless. I do want to thank and acknowledge the efforts of city staff involved in creating this distribution recommendation. But just as Mr. Jimenez mentioned, we know there is always a far greater need than the resources available. So this has been a huge undertaking. Thank you. My comments are focusing specifically on the Emergency Solutions Grant, which Nicole Farini described on slide 19. So As she stated, the Emergency Solutions Grant is a standing entitlement fund that the city annually receives. So in addition to supporting shelter and street outreach efforts, this funding has a specific focus to reduce homelessness using a two-pronged approach. Those approaches are to provide rental assistance for those about to lose their housing, so preventing them from becoming homeless, and then rapidly rehousing those who have become homeless by helping them find and stay in housing through rental assistance and case management. Although necessary on a short-term emergency response, emergency shelters are not housing and not the best solution for those experiencing homelessness. You can't shelter in place when you have no housing. Rapid rehousing has so many more positive results for individuals and families, and funding needs to be allocated for this effort. Nicole mentioned that a significant amount has already been deployed to the alternate shelter initiative, but she did mention that this is just the first tranche. So I encourage the city to consider utilizing funds from the second tranche on rapid rehousing, because I don't want us to lose sight of our community-wide goals of helping those who are literally homeless to obtain housing. The second item I wanted to mention is that for all prior allocations of ESG, there's been a competition to award recipients for this funding based on the applicant's capacity, infrastructure, their past performance in managing these grants, and a variety of other factors. And we understand the urgency of deploying these resources as quickly as possible and urge the city to create a streamlined but transparent process regarding potential recipients for this funding. El Paso has always focused on collaborations among all providers, and this is even more important right now during these times. And then the last comment I want to make is that you guys have heard this many times before, that the city of El Paso, through its general operating account, does not financially support the numerous agencies that provide shelter services and housing to those experiencing homelessness. These programs rely on grants, fundraisers, foundations, donations, etc. And so the CARES Act allocation of emergency solutions grant funding really provides a unique opportunity for us to be able to ramp up our efforts and make a significant impact in addressing homelessness.
Thank you,
So
Ms.
that
Foley. You've
homelessness
reached the
is
3
rare,
minutes, ma'am.
brief, and one time only. Thank you very much.
Thank you, ma'am. The next speaker is Ms. Laura Ponce. She will be followed by Ms. Diana Porras, followed by Tracy Yellen. Ms. Ponce, if you'll press *6, you may begin speaking for 3 minutes, ma'am. Laura Ponce, *6. Ms. Laura Ponce, if you'll press *6, ma'am, you can unmute your telephone and begin speaking. We'll come back to Ms. Ponce. Ms. Diana Porras. Ms. Porras, si presiona la estrella y el número 6, puede comenzar a participar. Nomás le pido que pause para que le puedan ayudar con la traducción. Buenos
¿Me pueden
días.
escuchar?
Sí, buenos días.
Buenos días. ¿Empezamos?
Sí, nomás le pido que pause para que le puedan ayudar con la traducción.
Ok, perfecto. Buenos días, mi nombre es Diana Porras. Soy el representante Mexicanos en Exilio, una organización que ayuda a personas vulnerables en la ciudad de El Paso.
Good afternoon. My name is Diana Porras. I'm a representative of a group called Mexicans in Exile. We are a group that represents vulnerable individuals who are from Mexico.
Yo nada más hago esta opinión, esta llamada para que tomemos conciencia de todas las personas que como nuestra familia son vulnerables y tenemos obligaciones en El Paso, en la ciudad del Paso, en Estados Unidos, pero no tenemos, bueno, algunas personas no tienen derecho, nada más por
caso de que no tienen un número de seguro social.
I wanted to give my opinion in terms of all the families that live here in the border region, particularly in El Paso, who do not have the immigration status necessary in order to participate fully in the community.
Mi familia vino hace 8 años, en el 2012. Somos 20 integrantes y ahorita con la pandemia, bueno, pues muchos no pueden recibir ayuda porque no tienen su número de seguro social. Entonces, con la pandemia, pues está siendo muy difícil. Nosotros hacemos todo lo que, todas las obligaciones que pide la ciudad. Somos parte de la comunidad de El Paso, pero no tenemos ningún derecho. Entonces, pido y necesitamos representantes para que tomen conciencia y puedan ayudar a personas que, como nosotros, son muchas.
My family has been here since 2012. We have been here for 8 years. There are approximately 20 of us. We have lived here, but we cannot fully participate in the community, although we are part of the community. We do not have our social security numbers. For that reason, we cannot fully participate. While we live in El Paso, we are asking for you to be conscious and aware that we need assistance in order to appreciate the full capability of the community.
Hay muchas organizaciones que trabajan en nuestra comunidad, como la nuestra, de mexicanos en exilio, que están dispuestos a trabajar con la ciudad para asegurar que el dinero vaya a familias vulnerables que necesitan ayuda.
There are many organizations like ours for Mexicans in exile that are helping those of us who wish to participate in the community.
Entonces, pues si pido a los representantes, bueno, yo soy ahorita una representante de la organización y pido a los representantes de la ciudad del Paso, del condado, que tomen conciencia y ayuden a las familias vulnerables, que como hay muchas en la ciudad, entonces El Paso es una ciudad de inmigrantes y necesita ayuda.
I would ask the representatives of the city that they be aware and conscious of those who are vulnerable, of the immigrant population, that we need your help.
Señora Porres, ¿tiene algunos otros comentarios?
Nada más que tomen conciencia y que si pueden hacer algo por ayudar a esas familias, lo hagan.
Just that, only to be conscious and aware of the need for the immigrant families. Thank you.
Gracias, señora Porras. The next speaker is Ms. Tracy Yellen.
Mayor?
Yes,
I know this is public comment, but this pandemic is such a critical issue for our community that we want to make sure as a staff we're being responsive so that everyone hears what all is being done. I will tell you that as far as I understand it, our staff is not turning anyone away for service. I know that I have personally been assisting people that have reached out to me that were not citizens and did get medical treatment and got tested on COVID-19 and actually have recovered since then. So I just want to make clear that the public hears that the council hears that, and that everyone hears that we are not turning anyone away on these COVID-19 services. So we want to be clear about that.
This is Chief DiAgostino. That's absolutely correct, sir. We are not turning anyone away.
Okay, we continue with Ms. Tracy Yellen. Good morning, Ms. Yellen.
Good morning. Good morning. Good morning, Mayor and Council. My name is Tracy Yellen. I'm the CEO of the Paso del Norte Health Foundation and Paso del Norte Community Foundation. Our foundations have been actively involved in COVID response from the beginning, funding health messaging in partnership with the city, purchasing PPE for frontline workers in El Paso and also in Juarez, making grants to nonprofits serving the most vulnerable in our community, and participating in the partnership that was referenced earlier with the City MCA, UT Houston School of Public Health, and Battelle Memorial Institute. I want to extend my thanks to Mayor and Council and all of the staff, Chief D'Agostino, Jorge Rodriguez, Nicole Farini, for the work that they've done. They have been great partners. I know everyone's working 24/7, and we've had many early, late, and weekend calls, and we appreciate that. Like you, we've seen the great need in our community, responding to grant requests related both to health and the economic crisis. Today, I just wanted to let you know that we are really proud to be part of a broad-based coalition to leverage resources and solutions to serve the most vulnerable, kind of what we've been talking about this morning. We agree that using the CARES Act funding through the city and the county to reach those who have been left out of other federal stimulus and other programs is really important. And to the extent that we can earmark resources, especially for these populations, we believe that that's very important. And we stand here today and going forward to partner with you, multiple stakeholders, to leverage all of the really incredible assets that we have in this community and be in part of this response.
Thank you, Ms. Yellen. The next speaker will be Mr. Dylan Corbett. He will be followed by Bishop Seitz. Mr. Corbett, *6 to unmute your phone, sir. Good morning.
Good morning, Mr. Mayor, members of council. A late happy Mother's Day to all of you. My name is Dylan Corbett. I'm the executive director of the Hope Water Institute. I want to commend you and the city staff, especially the resilience and sustainability folks under Nicole Farini, for the real thoughtful approach to developing a strategy to address the COVID-19 crisis. In your deliberations today, tomorrow, and in the coming weeks, I'd ask you to consider a few things. And I'm going to talk about the tranche of funds to support the community that have been detailed by Ms. Farini. First, there's real need now on behalf of tens of thousands of El Paso residents, like Diana Ponce, who you just heard from, and her family, who are left behind from accessing any of the federal relief funds that came to families, individuals, and small businesses through the CARES Act. Because of the way that the legislation was structured, the individual stimulus checks and the PPP protection loans, for example, that all of you on council and I could take for granted, just never showed up in the mailboxes of tens of thousands of families here in the borderlands. That's meant for them bread lines, it's meant economic insecurity, and it means so many more hoops now that they have to jump through to share in El Paso's economic recovery. Second, the fair thing to do right now, the right and equitable thing to do, the moral thing to do, is to prioritize as we start leveraging the monies the city has received through the CARES Act and the other funds that you have available to you. And I also encourage you to think about the FEMA funds, which I haven't heard from in today's presentation, is to make sure that people have a financial lifeline and have it now. We're going to need you to think big. We're going to need you to be courageous. We need to create, just as communities across the country have, states, counties, cities, including Hidalgo County in South Texas, including Austin with $15 million, including Harris County with $15 million, including Las Cruces in New Mexico. A robust, a strong, a well-resourced fund to support our families now. This fund for the common good for direct cash assistance should be large. It should be in the millions of dollars, as it is in other communities in Texas, and it should be targeted, working with community orgs into those families, to those families who up to this point have been completely excluded from federal aid, including unemployment insurance. And then finally, I'm really excited to announce that a wonderful new coalition has come together to address these great challenges of human need. This coalition includes representatives of the faith community like Bishop Mark Seitz, organizations in the community like Ciudad Nueva Community Center, social service agencies like Project Bravo, immigrants' rights organizations like DMRS and Las Americas Immigrant Advocacy Center, the El Paso Health Sciences and Policy Research Group from UTEP, as well, and I'm very proud of the leadership that they've both shown in stepping up immediately with willingness to partner to address the incredible challenges of the moment. Eric Pearson with the El Paso Community Foundation and Tracy Yellen at El Paso del Norte Community Foundation. Together, all of us right now, we're ready to stand to partner with you, a strong coalition with you and the County of El Paso, to make sure that we leverage resources in the most effective way with a fund for the common good and to discern the path forward together. This is an unprecedented opportunity for all of us, city, county, philanthropy community, to come to the table now to rebuild even stronger. We look forward to collaboration, we look forward to partnership, and to getting our hands dirty with this important work right now. And thank you all again very much for your leadership.
Thank you, Mr. Corbett. The next speaker is Bishop Mark Seitz.
If I can chime in real quickly before the next speaker gets started, this is Robert. So that's correct. We are not discussing the FEMA funding today. This is mainly focusing on the coronavirus relief funds to give us the authority to appropriate those funds. We do have access to that FEMA funding. One of the things that we talked about early on with our cross-functional team was looking at what was available immediately. So we've already, as I mentioned, or Nicole mentioned in the presentation, we have already received these funds that we're discussing today. So taking advantage of what's already available. Not only that, with the FEMA funding, there's a city match that's required when you apply for those funds. And so we're trying to, one, minimize the impact of the city's cost and try to maximize what's available. Another point I wanted to make, and so you're hearing from all of the speakers and in the presentation, there's a lot of need, a lot of different organizations. One of the things I wanted to point out, and I was going to wait until the end, but I think it's important to do it now, is that when we created this cross-functional team and we started to work on these different programs, one of the early concerns, and one of the things that the city manager myself brought up and we discussed was, what if potentially down the road, in a couple of weeks, the federal government comes back and loosens up the flexibility on these funds? And so we talked about that three-pronged approach of the restrictions currently tied to these funds. And so we know there's been a lot of ongoing discussion about another round potentially of additional federal funding that's going to come down the line, but there's no guarantees. And so we've been put in a position where we can't sit back and wait and hope that the federal government releases or changes the restrictions currently tied to these funds. I'll tell you that the city of Phoenix took their appropriation to their council last week, and their recommendation and what they're doing is they received approximately $293 million, and what they're doing is they're actually setting aside $143 million of that for future to preserve impact on city services in hopes that the federal government loosens up the restrictions currently tied to that funding in order to allow it for revenue replacement as one example. And so that's something that we did discuss early on as well, is do we set some of that money aside in hopes that the federal government loosens those restrictions and that flexibility? But based on everything that we've seen and heard, and we know that the community desperately needs these programs, and we need to get moving, and we can't sit back and wait. This was the recommendation. That's really what drove us to come up with the recommendation you have before you.
Thank you, Robert. We'll continue with Bishop Seitz.
So I'd just like to add one more comment. So what he's saying, in other words, we're putting the dollars towards the community needs, and that means there might be additional cuts on the city side. That's what he means by those comments.
Thank you, sir. Bishop Seitz, if you're on the line, sir. Good morning.
I am. Good morning. Good morning, Mayor Margot and City Council members. Thank you for this opportunity. As you've heard, I'm Bishop Mark Seitz, Bishop of the Catholic Diocese of El Paso. Thank you for the good work you have done to reach out to vulnerable populations, such as the homeless, already. I would like to ask you to take a next step that reaches a very vulnerable segment of our community that continues in great need at this time. We're proposing, as you have heard, a community assistance fund, a fund for the common good, a private-public partnership drawing upon a strong coalition of philanthropists, grassroots organizations, and social service providers with deep knowledge and experience. This would require a close collaboration between the city and county, making available funds and leading. This fund would reach out to individuals and families that have not received assistance because they don't make enough money to file taxes, those who are foreign-born, or have a member of the family who is foreign-born. Many don't have unemployment insurance either. They tend to work in the service industry, food service, and construction. In looking at the deeper reasons for doing this, of course, I look to the teachings of Jesus, but I also look to other sources. One can learn a lot from a classic philosophical work such as that written by Dr. Seuss and his work, Horton Hears a Who. I hope you have had the chance to study it. I'll just take my last seconds to summarize for you. An elephant named Horton hears a soft little noise one day, With his big ears, he listens more closely and realizes that it is coming from a flower. He listens more closely and realizes that there is a whole community on the flower that no one else can see or hear. He seeks to announce to the world that the Whos are there and to protect them in their precarious existence. I'm speaking here to a large community among us who are suffering greatly, but their voice is quiet and hard to hear. We need to listen and take bold action to assist them. Thank you very much, and God bless you.
Thank you, Bishop. The next speaker is Mr. Jose Manuel de la Rosa. He will be followed by Bill Schlesinger, Eric Pearson, and Josiah Heyman. Mr. Del Rosa, if you're on the line, star 6 to unmute your phone, and you may begin speaking. Jose Manuel del Rosa, star 6. We'll move on to Mr. Bill Schlesinger. Sir, star 6 to unmute your phone. Bill Schlesinger. Good morning, Mr. Schlesinger. You have 3 minutes,
Hi.
sir.
Thank you. This is Bill Schlesinger. Good morning, Mayor and Council. I'm the CEO of Project Vita Health Center, a federally qualified health center in El Paso, and co-director of Project Vita. We provide a number of services, including a significant component of behavioral health. We have about 30 people working on telephone outreach now. We also work very closely with microenterprise technical assistance programs. I also sit on the Federal Community Advisory Board for the Federal Reserve Bank, and I'm part of the Fair Housing group with Nicole. And I've appreciated very much the outreach and involvement that the Community Development Department and others have done in terms of the analysis. I think it's been very effective. What I'm hoping for is an equally grassroots and complex response through this network as the programs and resources are deployed. Specifically in terms of testing, we've gotten a small grant, about $300,000, dedicated to testing, but it would be much more effective if we could be part of the larger testing, tracing, and tracking response with the program that the city is operating. I'm sure that that's true for all of the FQHCs, that we have resources and we have access, particularly to vulnerable people who find it difficult to get out to drive-through programs because they don't have cars, or because for a lot of our folk, they just don't trust the government. So we want to be part of the solution in healthcare. We also want to be a part of the solution in microenterprise. We have access to people that are specifically the kind of vulnerable folk that we've been talking about. We're part of a larger network that has the same. So it's very understandable that you'd reach out initially to work with the larger organizations. But this network of smaller organizations can provide a more detailed and more appropriate access for case management, for coordination, and we hope you use it. Thank you.
Thank you. The next speaker is Mr. Eric Pearson. He'll be followed by Josiah Heyman, Melissa Lopez, Susan Goodell. Good morning, Mr. Pearson. Good morning, Mr. Pearson. Mr. Pearson, you might be on, I see you unmuted your telephone. Mr. Pearson, we can't hear you.
Can you hear me now?
Yes, sir, we can. Good morning.
Thank you. Good morning, and I'm sorry about that. Good morning, Mayor and Council. This is Eric Pearson. I'm the President and CEO of the El Paso Community Foundation. Just a quick update. The foundation has employed more than $1 million in this community in response to COVID-19, whether it's hiring laid-off restaurant and food service employees to carry out essential jobs at the food bank, purchase of PPE that we provided to doctors' offices and frontline workers, including El Paso Fire Department and El Paso Police Department, helping our military folks who are in quarantine, an emergency loan fund, and $70,000 that we've just put into a fund for the common good, which you have heard described many times here. I think it's very important that we look at how we can collectively and collaboratively address the needs of people who are in their most vulnerable positions. There are a lot of people who are suffering, not only because of the virus, because of the after effects of the virus. And I understand the huge job you have in front of you, and the tension of dealing with how to get the community going from an economic standpoint and how to keep it safe and not overwhelm our healthcare system. So we get it. We're trying to work in all of those fronts. And I think this collaborative, the Fund for the Common Good, is a great example of how we can help you all as a government agency and help our community respond quickly with feet on the ground already that have been doing this kind of work for a long time, whether it's the Bill Schlesingers of the world or the Laura Ponces or the Susan Goodells, who you'll hear from later. This is an opportunity for us all to work together, and I encourage you to fund our most vulnerable. Thank you.
Thank you. The next speaker is Mr. Josiah Heyman, followed by Melissa Lopez and Susan Goodell. Mr. Heyman, star 6, sir.
My name is Josiah Hyman. I'm a representative of the El Paso Health Science and Policy Group, and we're speaking here to endorse strongly the proposal for a fund for the common good. The El Paso Health Science and Policy Group are 5 faculty from UTEP. The institution is not endorsing this. With expertise in health, public health, and in social science. I myself am a scholar of borders and migration with 5 books and over 120 research articles to my name. And here are some important reasons for supporting this proposal. First, the population of El Paso has a large presence of what are called mixed status families. Those mixed status families combine U.S. citizens and people who are foreign-born immigrants of various statuses. The CARES Act substantially bypasses them. Many people cannot get funding from the CARES Act. Most notably children. There's a large number of U.S. citizen children in those mixed status families. 47% of all children in El Paso are children of immigrants. That's a number around somewhat over 100,000 children. And those children are our future. So it's not just something that we're doing for the present moment, but it's an investment in this community, in the economic and social development of this community to take care of those children. Likewise, families that don't have resources are at greater risk of spreading the COVID-19 infection since they have to go out and somehow find ways to survive. We want to enable them to follow social distancing information, which they've heard many times and which is widely known, but they have to be able to follow that advice. And finally, the El Paso Health Science and Policy Group is here offering to support and serve with our skill set in health sciences and public policy. Thank you, and we strongly endorse the Fund for the Common Good.
Thank you. The next speaker is Melissa Lopez. She will be followed by Susan Goodell, Laura Ponce, and Jose Del Rosa. Good morning, Ms. Lopez.
Good morning. Can you hear me?
Yes, ma'am.
Thank you. Good morning, Mr. Mayor and members of the City Council. Thank you so much for taking the time to hear from all of us. My name is Melissa Lopez. I am the Executive Director of Diocesan Migrant and Refugee Services. As our name implies, we represent immigrants who are coming to this country, and we help them legalize their immigration status. I'm here speaking to you today as part of a coalition that strongly supports the creation of this fund for the common good. We are concerned, obviously, to ensure that those El Pasoans who have not been able to receive the federal assistance that has been offered up to this point are able to receive some level of assistance to help them get by, just as everybody else needs that assistance. Again, we are part of a large coalition, and we have been working together. Social service agencies. We have, we are part of the Roman Catholic Church here in El Paso, and work very, work very closely with Bishop Seitz, who is the president of our board. Work with the Hope Border Institute and other agencies. I again am just here to ask you to endorse the creation of this fund and to ensure that we are able to help those vulnerable El Pasoans who unfortunately have been left out of much of the federal assistance that has been provided up to this point. Thank you so much.
Thank you. The next speaker is Ms. Susan Goodell. Good morning, Ms. Goodell.
Good morning. Can you hear me?
Yes, ma'am.
Good morning, everyone. I want to thank you so much for the opportunity to speak this morning, and I wish that on my monitor you could see in the background the National Guard troops, the pallets of food, and the thousands of cars that come through our line every day to get emergency food. I just want to take a moment to advise you of the work of the food bank during the pandemic. The food bank has not been sheltering in place. In fact, we have surged to meet the need. We have increased our distribution of food by 400% over the last 60 days. Many of you have seen the 2 to 3 mile long lines of cars at our 5 drive-through sites, at the Bill Childress Elementary School, Abundant Living Faith Center, Kelly Center for Hunger Relief, Katie's Pantry, and of course here at the food bank, El Pasoans Fighting Hunger. Through these sites, as well as our pantries and mobile pantries, we are feeding people every day. At the 5 sites alone, every day we are seeing between 6,000 and 7,000 families coming through to get emergency food. This represents 140,000 plus people a day that we're feeding. We have been distributing, in a normal month, we typically would distribute 2.5 million pounds. Today, we're distributing 10 million pounds a month. Over the course of the pandemic, the last 60 days, we've distributed 205,000 emergency food boxes. When we annualize the work that we've been doing over the last 2 months, we would be providing 130 million pounds of food for this community. To give you some context, that would be putting us at the size of the largest food bank in the world, and we grew to this size overnight to meet the pandemic need. At the same time, we've been struggling to bring in enough food and to handle the increased workload. Our inventory, typically a food bank would keep between 2 and 3 months food supply on hand at any given time. Our inventory has been reduced and diminished to 1 to 2 days inventory at any given time. We ran out of non-perishables on March 27th, and we have pivoted to handle, to distribute fresh and frozen products almost exclusively. So overnight, we've stretched to meet this need, but we are terribly under-resourced. We need food, we need operating funds, we need more staff, we need incredible amounts of infrastructure, and we're grateful to Nicole Farini and her team for considering helping us with such things as food processing rooms, meat packing rooms, pallet racking, tractor trailers, forklifts, repairs to our parking lot, which is crumbling under the thousands of cars a day that it's seeing in traffic. And perhaps most importantly, as an emergency generator, should we lose power, we cannot afford to lose the food supply for this community in our freezers and refrigerator.
Thank you, Ms. Goodell. You've reached the 3 minutes.
Thank you.
Thank you, ma'am. The next speaker is...
Can we let Ms. Godell finish?
Yes, Ms. Godell.
I just wanted to say how much we appreciate your help and your help in the future to ensure that this food bank continues to be able to serve the people that we're seeing on a daily level who are at such great risk for food insecurity. And I also want to thank Representative Rivera, who came out last week and saw firsthand the work that is being done here. And I would like to invite the mayor and the other city council members and Tommy Gonzalez to please come out and see what's happening here at the food bank. Thank you.
Thank you, Ms. Godell. The next speaker is Ms. Laura Ponce. She will be followed by Jose Manuel del Rosa. Good morning, Ms. Ponce.
Good morning, Mayor Marco and Council. Thank you for the work you've all done to respond to the current crisis. My name is Laura Ponce, and I'm the Executive Director for Project Bravo, your local community action agency. Our mission is to improve the lives of people living in poverty in the county of El Paso. My organization has served this community for over 55 years and continuously strives to connect families to food, housing, utility assistance, healthcare, adult education, workforce training, employment, weatherization to increase home energy efficiency, financial counseling, and other services so families can meet their basic needs and eventually thrive. We continue to provide services to the public during this pandemic through drop boxes, phone appointments, online portals, and other strategies to keep our employees and clients safe. Over the last 10 years, I've served as the Executive Director of Project Bravo, and the hurdles that we climb to provide services with federal funds have gotten higher and higher. In addition, the federal government has lessened access to safety net programs to immigrant families. Some of these families have immigration status and others do not. Either way, these immigrant families fear accessing the few safety net programs available to them because of the national leadership's confusing message around who is affected by the public charge rule and other actions that create fear of deportation. The fear has manifested itself into more hunger, higher rates of homelessness, less access to education, greater exploitation, greater threats of domestic violence, and more suffering for immigrant families in our community. Access to basic needs such as food, housing, and health care should not be denied to any family in El Paso, especially as we're all working to reduce the spread of COVID-19. I'm speaking today in support of item 2 of the agenda, and my request is that the city administers CARES funding in a way that ensures access to everyone in our community. I think that the current allocation for basic needs should be increased so that the CARES Act funds will provide an effective safety net to our community. As city leaders, you should let the public know that you're working to protect everyone, regardless of immigration status. The funds should be provided with the lowest barriers possible to families, since we know the financial impact of COVID-19 is extensive in our community. This is not the time to deny or appear to deny access to anyone as we work together to reduce the spread of COVID-19, a virus that does not discriminate who it affects. Project Bravo stands with other trusted community organizations to be a part of the solution. I want to thank Senator Rodriguez, who actually first organized the coalition that we're part of to help this very vulnerable population. Thank you so much for your time.
Thank you. And the final speaker is Mr. Jose Manuel del Rosa. Good morning, sir. Mr. del Rosa, *6. Good morning.
If I could work the phone, I'd be a genius. Thank you, Mayor Mayor Margo and City Reps. I'm Jose Manuel de la Rosa. In full disclosure, some of you know me from my full-time job at Texas Tech, some service on the boards of United Way, the Catholic Foundation for the Diocese of El Paso, the Medical Center of the Americas, and the Paso del Norte Foundation. However, today I speak to you as a citizen of El Paso and to ask you to support Part 2 of today's recommendation as the Fund for the Common Good. I speak to you as a part of the strong coalition of philanthropists, grassroots organizations, social service providers with deep knowledge and experience, specifically in our El Paso community. We're asking you, our city leaders, to provide direct payments to all the vulnerable local residents and businesses left out of the congressional aid, numbering in tens of thousands. We stand ready to immediately work with the city and the county to leverage community assets as part of a response. I speak for a group of community volunteers, including medical students, nursing students, and other students across the city and county of El Paso. Thank you for your support.
Thank you, Mayor. Everyone that signed up to speak has already addressed council.
Okay, Mayor Pro Tem.
Hi, Mayor. Thanks again, everybody, for giving us. I had a couple of questions, and want to thank staff and everybody for doing this work, and then also for the public that came up to speak. You know, there's a lot of presenters right now, so I have a lot of different questions, kind of from the different parts of this. So I guess the first is for Mario, and I'm just kind of curious, how many tracers do you anticipate needing?
Hello. As I discussed earlier, we've built it up to about 158 right now, and we continue to grow that as we need it. Depending on how it keeps going, and if it keeps going, we could see doubling this. So we've actually set it up so we can build it out into different divisions. So we keep adding to it without putting a burden on the current system. So we are still looking at that. We got some people are assisting with staffing, so we are looking at hiring additionals in, and then continuing to use our resources that we have within the city of El Paso as well.
Is there any preference of looking at any of the furloughed or laid off workers that we have to see if they can fit into those positions?
We've been considering who fits the best description for those. We've been trying to leave it to not trying to leave it to. What we found out is other communities have been very successful by utilizing fire staff as well as police staff, but we have looked at other options to get more people in on the clerical side of it. There's a lot of data entry and stuff like that. So we are looking at all possibilities on how we can take care of those, not just the ones that are furloughed, but those as well who are using their own time at home right now because they cannot work remotely.
Is there a way you can walk us through sort of how the contract tracing actually works that we're doing now? If there's somebody that tests positive.
Right. And I will try and do it justice to the best of my abilities. So as we get notified of a positive test, we have epidemiologists who are doing the initial contact. They're reaching out with the patient, SOPI, and discussing with them about their positive results. They then look into identifying key behaviors. Are they working? Have they been home isolating? When did they start feeling their symptoms? They build up from there. So who they've been in close contact with, if they work, where do they work, how do they interact with their coworkers? Is it working individually in an office as opposed to working in a group setting? Has their company or facility been following safe practices such as social distancing, wearing a mask? And so they try and identify that, and they categorize the risk. So low, medium, high risk. High risk are those ones we're moving to now, where we're just going to go ahead and go in with a strike force approach to get them tested, regardless of symptoms. But that's how it builds out from there. You identify who's the high risk, you handle that population first, you move into the medium risk and low risk. You're basically asking them to isolate, to to self-monitor their symptoms, and there's a communication set up so that they can continue communicating back and forth so they can follow their systems to see if they progress.
Okay. One of the things that talked about was in the education section, expanding outreach. One of the things talking about was education on disinfecting and importance of social distancing. What handouts or information do we have? Maybe you can share us with the council to share with employers about what they need to do to keep their employees and patrons safe. Is there documents or guidelines that are already there that are very clear in Spanish and English?
Yes.
So Mayor Pro Tem, if I may, sorry, Mario, that was part of the presentation that we gave, that
that Jessica early on, I think I assigned that to her and asked Carrie to follow up on that with her about a month ago, way early into this process, to come up with proper protocols so that businesses would have that as they started to come back online. So that has been something that the Economic Development Department has been assigned to do, to work with the big box retailers and all those businesses that were still open, and getting those best practices and getting the best practices we heard from CDC, because there was a lot of innovation and a lot of ingenuity that we found in just how the retailers did the plastic walls at the cashiers, the different things that have been done with the different drive-through restaurants or drive-through fast food places. So a lot of that stuff was combined with each other, and we've been working on that now for over a month.
Yes, sir. And just to reinforce, so the Office of Emergency Management and all the education task forces that have gone out across the city have distributed flyers both in English and in Spanish to all of our employers. We've done it through numerous ways, sir. We've also shared social media kits from our PIO office as well to the employers, but everything has been distributed both in English and in Spanish to as much of a far reach, just not specific to the hospitality services industry, but also to all sectors, manufacturing, call centers, warehouse, logistics, transportation. We've gone out and distributed a significant number of those flyers.
Okay. Can you share those with myself or with the council?
Yes, sir. I'll go ahead and provide you what was shared with the business.
Okay.
Along with that, Mr. Schwartzbein, along with that, we also have on the website, we've listed recommendations for different types of businesses. So they're out there. We're working in conjunction with everyone here on this. It was with Nicole and everyone. We're also partnering up with the Better Business, the restaurant industry. I mean, it's the cooperation and these best practices that Mr. Gonzalez were talking about. It's everywhere. One of the high schools here in town did a proposal for us on how to handle their graduation. It really ties in line with the state, but it's different, and it's a successful model that we can back. So as we're getting those, we're actually posting those on the site, and that's English and Spanish, and it's for an all business type approach on how we can do things better in our own community.
Okay. I guess since you're there, Mario, one of the things you talk about is education, but also compliance. So what is there, or what is the process for ensuring compliance with, without overcrowding of restaurants? I mean, I think probably anybody who was driving around could see that there was, certain restaurants where the parking lots were full yesterday and over the week. So what is the process if somebody stops by a restaurant or sees something that looks like they're not abiding by the 25%, for example?
So Mayor Pro Tem Schwartzbein, we have a compliance task force that I mentioned earlier during my section of the overview of the report. And that task force has been up for quite some time now. And these numbers are as of 6 May, but we've done a total inspections of over 13,000. We have total warnings issued over 1,077 citations. So when we receive complaints, they are sent over to the task force, and the task force is out there monitoring as well. I know that during the Easter break and Mother's Day, we had a lot of our folks out there monitoring not just the task force itself, but other people that are in those departments. We had them monitoring that also so that they could report that to the task force. So that's what we have in place. Again, the limitations, that we were talking about today, and the CARES funding, the budget, the different things that we've discussed, even though we've been cut to the bone with our budget, we still are utilizing our resources the best way we can, in addition to, attending to the community's needs as well. So we have assigned people, have different teams in place, different task forces or cross-functional teams that are addressing these different issues, because a lot of them are popping up, and we need to address them. We need to make sure that we're responsive to it. But we have these task forces in place because of that, because of the numbers of employees that we're limited in using.
Okay. Mario, I'll go back, but I had a couple questions relating to, I guess, some of the stuff that Nicole and Jessica brought up. One of the things that struck me was that with the LIFT fund and some of the funds there was a large majority of people that didn't qualify due to low credit and other things. So how is it that that's going to change with what's being proposed with our community response and this CARES Act dollars?
So, sir, there are guidelines that we can work, whether that's with LIFT Fund or with an entity that you all provide us with the approval to move forward with. But right now, there are guidelines for grants to establish a grant program. So when we looked at what was requested and the need that came in, there was an overwhelming response for grants of up to $10,000. And then with regards to having most of those businesses be eligible or not, we understand that most of those businesses will have issues with credit or lack of credit or have some sort of a negative there, but we can stipulate a lot more flexibility, and LIFT Fund is open to those conversations because we know that they're the entity that's unlike a traditional lender that can provide that flexibility for us.
And if I can add to Jessica's comments, community development is working very closely with economic development to try to understand how we can complement their efforts. And the areas that you saw in my part of the presentation focused on livelihood and employment, particularly the microenterprise and independent contractor components. Those are being framed similarly to the way community development has always deployed any kind of business type assistance, in that they are structured for folks that don't qualify for traditional financial assistance. And so there's a bit more flexibility in terms of those programs because they are targeted at low to moderate income populations. And so we'll be looking at that in the framework of that, making sure that we can reach those businesses. Bill Schlesinger earlier with Project Vida mentioned their extensive network of microenterprise. We've been working with them for over 10 years to support their microenterprise technical assistance program. And those are the folks I think you're talking about, Representative. And so we'll be working with those partners to make sure that we can establish that. The second piece that you'll note from my presentation is in the entitlement portion of the funding, not the relief funds, but the entitlement portion of the funding. We allocated quite a bit of money to get in front of the credit counseling and bankability issues. Again, setting up a structure that can walk these businesses that are unfamiliar with these processes. They're intimidated by those processes. They may not have the records that they need in order to qualify. And so we're going to be setting up a program to assist them and get them funding ready, if you will. And so there's a significant amount of effort and concern, again, in collaboration with economic development to make sure we're reaching those folks that may have been left out of other programs.
Yeah, because I mean, you bring up like independent contractors, and I'm trying to think about the process for actually applying for these micro businesses, micro entrepreneurs, painters, independent contractors. You know, this small thing, this small business owners there, and I'm just thinking about the nuts and bolts about how that gets done. And I'm curious about that, especially, you know, what are those funding distribution points? I mean, who are those partners?
So it would take quite a while to go through the list of all the partners that we've reached out to that address those communities. But what I can say is that it's largely, the touch point is largely going to those folks where they are, not necessarily just opening a program and saying, okay, everybody submit applications and, you know, we're giving out money. No, I think that it's going to be more about leveraging our partners, going to those businesses where they are, and making sure that they understand how to access these funds, and where there are barriers, that we work together to break those barriers down and assist those folks in priority order. And that's the policy framework that I think follows the discussion today.
And just to also let you know, sir, in terms of just some of the guidelines that we look at, we may not have to look at credit. I know that when Lift Fund is administering a grant program, that's one area that we do not have to, take into account. So that would be a huge, lift for a lot of these businesses that really need the assistance. And there's a number of other partner organizations across our community that can also step in and administer that grant program. But we're not going to provide more rigidity as to the use of those dollars. I think there needs to be flexibility there with the businesses.
Well, and lastly, I think what also needs to be said is that, getting the money into the hands of these folks is step one. I think helping them work through utilizing those funds and making sure that they remain in compliance with any regulatory structure that we have. I know that sounds a little bit authoritarian when I say compliance, but I think it's so important that we make sure that we are helping businesses and in the long run, not hurting them, right? And making sure that we're there for them. Our compliance team stands ready to work with those folks, not just the businesses, but the individual recipients, to make sure again, that we are lining up with whatever the federal regulatory structure is, and making sure that we are helping in the long run, to the point Jessica was making, and not hurting.
Okay. One of the things you talk about is developing a central repository. Can you talk a little bit more about that, and who would actually be responsible for developing that?
So right now there is a lot of data out there. We talked about the WorkSafe guidelines. We talked about the number of resources that are available for small business owners. A lot of our partner organizations, to include the chambers, for example, have a lot of information with regards to technical training, and a lot of those free resources in both English and in Spanish that are needed for our businesses. Navigating that, though, online, and then also through other forms, whether that's social media or other just different platforms, it can be really challenging for that business owner. So what we're trying to do is create that central repository. So if the city, essentially, ourselves, have that information from our partner organizations on one site. We've got a significant number of resources already uploaded on epstrong.org. So if we continue to provide that information, both in English and in Spanish, in that one area, that will help streamline the assistance that many of these business owners need. We can essentially be the connector, the advocate, and then also the one who puts them in touch with the specific partner organization that can assist. That's really one of the biggest needs that our business owners have been asking. And then our partners have also said, we have a wealth of resources at our disposal. It'd be great if you guys could also be an extension of our outreach.
So it would be run through the city's economic development department?
Yes, sir. But a lot of that, keep in mind, is just within the city, we have 26 departments that all offer an incredible amount of resources, right? So as I mentioned, that site that the chief even alluded to, epstrong.org, that's really important for these business owners, for their employees, and then just for residents that are needing that information, the public, to understand what their requirements and recommendations are with regards to health and safety, and then also with regards to economic assistance. So it's not just specific to economic development or having it housed in economic development, but I think just continuing with augmenting what's already there, what we're already doing.
Okay. And then on slide 18, there's a graph here. I just wanted, if Nicole could just explain it more, because trying to read it, and I don't really understand what the graph is saying there, because the the different names on there. There's one that says 10 promotes, 1 meets basic needs, 2 supports livelihoods, 3 ensures public. I don't, you know, I don't know.
So
what
if I can, yeah, so if I can walk you through that. So the breadth of the wheel addresses a number of issues that impact community resilience on a regular basis. And the areas that you're seeing, the red and the sort of yellow-green, are the areas that came back to us in terms of our outreach as primary and extraordinarily urgent. The red being the most urgent and the most critical need, and where we heard the most feedback. The yellow being secondary to that. Some of the other areas, you know, for example, you mentioned, you know, empowering a broad range of stakeholders or fostering long-term planning. These are not areas that we were hearing from the community in light of this crisis. And so really we're just focusing on meeting the basic needs of El Pasoans, as well as supporting livelihood and employment, ensuring continuity of critical services, and fostering economic prosperity.
So what does 10 promotes mean?
So what it got cut off there on the graph, but what it is promoting leadership and effective management. And so you're going to see there the sort of teal green color. That means that is an area of strength in our community, and we did hear that from our stakeholders. You'll also see that teal green color in terms of promoting cohesive and engaged communities, and that's just a reflection of the amount of outreach that we did and how folks were really thankful that we did so. And that's why I didn't mention it in the presentation, because those are areas of strength. I apologize that it got cut off in the graphic on the slide.
Okay. And then I guess this is a question for Mario, but I know that there's some others on the phone too. I'm just kind of curious to hear more about this idea of rapid rehousing that was discussed. Maybe
Yes,
you can answer, Nicole.
Mm-hmm. So
And some of the sort of funding programs and stuff. I know that Eric Pearson spoke about what they're working about, and I'm just kind of confused if that's something that with what Eric and Tracy are working, is that something that's included with this, or is that separate from it? And then also this idea of rapid rehousing and looking more strategically about how we use some of our housing and dealing with these vulnerable communities.
So let me take those questions one at a time. So first I want to clarify rapid rehousing. So rapid rehousing is a program that has been supported through the federal entitlement for a long time. And I believe it was Carol Boley on the phone from the El Paso Coalition for the Homeless that brought that up. We are identifying rapid rehousing as a key component to be supported by the block grant part of the entitlement, as well as the relief funds. Rapid rehousing is about taking folks that have been displaced, that are moving into homelessness, and we want to move them out of homeless quickly. We want to get them housed and get them stable and get them in a place where they can shelter in place. So rapid rehousing is different than, say, for example, rental assistance. That's often considered homeless prevention because someone is already housed and we want to keep them in the housing that they already have. And so that's typically financial assistance directly to property owners to keep folks housed where they currently are before they are displaced. And rapid rehousing happens after they are displaced. So that's the difference between the two. We have identified both of those as priority areas to move forward in terms of both pots of money that we have. And if I understand your question about the fund that Mr. Pearson was discussing, he was speaking directly to the opportunity that the Community Foundation has put forward and the funding they've already had in place to assist folks, and we are looking to supplement that. One of the key, I think, benefits of engaging with philanthropy and creating an external fund is that the city has the opportunity to contribute dollars, significant dollars to those funds, but they then get multiplied by what the private sector and philanthropy can contribute. That's the success that we saw with the One Fund, and this would be something similar to that. I think there is a lot of need and a lot of partners out there that are saying rental assistance and housing is primary, and that fund would contribute to that. So we would look to partner with them to make sure that our efforts are lined up. Did I answer your question?
Yeah.
One
Yeah,
last
'cause
thing
there was
that
a-
I do want to
because there was
mention. Oh, go
There was a
ahead.
number, because there was a number of speakers in public comment that have talked about a couple different other projects, and so I'm trying to understand what is what and what are the different ones that we've discussed.
Yes, sir. And two things. So the first really important point to note in terms of the funding that we're talking about is the city itself is not the entity that will deploy these programs. We're not set up to do so. We never have been. Rather, we would propose to deploy these funds in the way that we've always deployed the entitlement, which is to issue a notice of funding availability, make those funds available for specific purposes, contractually obligate the applicants to serve those needs, like rental assistance, and that funding would then be available for nonprofits to apply and then deploy those funds directly. So we would not be doing that directly. We're not set up for that, whereas those other programs already are. And so I think what you're saying is don't reinvent the wheel, and we're not trying to be redundant. Rather, we're trying to support those programs that are in existence. And then the second piece, because you mentioned the vulnerable populations, I want to be clear that even historically with the federal funding that we have, no one is excluded from receiving that assistance. And there's a lot of intricacy in terms of how we can provide this assistance, particularly to folks that may not have documentation. And so we've been working very closely with the organizations that are expert in that space, because we want to make sure, again, that we can provide assistance, but that we are not hurting those folks in the long run in terms of their process to apply for residency and citizenship. And so we're working with those folks, and I'm as we move forward with deploying funding, there's going to be a lot of work for us to do with our legal folks to make sure that we are doing right by that population.
Okay, thanks. Thanks again for all the work that y'all are doing. So.
Okay, next we have Representative Anello, then Representative Rivera, and then Representative Rodriguez.
Hi, thank you guys. So I have quite a few questions, and then I also have a few questions off of what Representative Schwartzbein asked, so forgive me if we go back and forth a little bit. So my first question is, Robert, I know that you had addressed the FEMA question, and you really talked about we're wanting to look at the funds that are available. But when it comes to the public health and safety, have we looked into the COG funds that are available and other ones that are immediately available upon approval? And when those funds do get approved, how does that shift the budget that has been created for public health and safety?
Yes, we have. So we've looked at every grant available out there. So we do have some that are going to address public health staff that we've already addressed. We've got about 1.4 million in grants for public health staffing. On the FEMA side right now, it's about 2.3 million total that we spent, combined mainly police and fire department with their staffing, some of the additional equipment and PPE that they've purchased. So that's an area that we could potentially, if we wanted to move some money to the FEMA, we could. We're spending about $700,000 every 2 weeks right now. Again, there's no telling how long we're going to continue on that trend. As I said, a lot of that's been related to the actual purchase of different equipment and the PPE materials and supplies. So, I mean, that's something that we've been evaluating. And so one of the things that we've done as far as making this recommendation is we know that some of these programs may shift as far as the amounts needed. Using that FEMA funding, I mean, we'd have the ability of, we were able to come up with that city match portion. If, we were able to do that, possibly put some more money towards one of these other programs. But at this time, in order to get started, I mean, one of the things that we're all very sensitive to is, one, getting this in front of you all so that we can start moving. My biggest fear, and everybody's, the city manager's biggest fear, everything that we keep talking about, is we can't continue to sit back and wait. So we've been very proactive. A lot of things that we've talked about. We talked earlier about, addressing some of the budget challenges, and now what are we doing to help our community? So every opportunity that we have, this is obviously the largest, the $119 million, but every opportunity that we have to use various grant funding, we are taking advantage of.
Yeah, I agree. I think we definitely need to be doing this, and these community priorities are very important. So I'm glad that we're addressing them with this money as soon as possible. Sorry, Mr. Gonzalez, did you want to say something?
Yes, ma'am. Yes, ma'am, I did. Thank you. All I was going to say is there is a time limit to spend these funds, and we have to spend them by the end of this calendar year. Is that right, Robert?
That's correct, by December 30th of this year. So we need to have those funds expensed by then. So yes, very, very tight limits. And I want to go back to the point I made, and the city manager did clarify, and I'm glad he did, is that there's obviously a lot of need. And so addressing everything is almost an impossible task. We've put forward a recommendation that's going to address the medical and public health areas, not only for what we're dealing with currently, but also in the future of being proactive. And then the community and economic development. But I mean, I'll go back to it and I'll say it again because it's important that we've talked about the budget impact. And so allocating all of these funds now is the most prudent thing to do because we know the immediate need is there. And we do have time limits right now, but also in the back of my mind, I keep saying it because we're sort of in a state of limbo where the federal government could come back and say, okay, cities, you can use some of this funding to help offset your revenue loss. And we would be at a point where we've already allocated all those funds to other programs.
Well, and I take responsibility for that recommendation because we really feel like the need in the community is so great that we need to give these dollars to that need. And as I said before, I just want to make sure the council understands that means that the things that we've talked about with respect to cuts for the city, those will hold and they might hold longer because of these recommendations. But I think that's the responsible thing to do. I think the council, just in hearing a lot of the feedback and a lot of the discussions that we've had, because we've had a lot of presentations since day one of the pandemic, and then we're in day 60 now. And all of that feedback we've received, I think, aligns with our recommendation.
No, I agree completely, 100%. I guess to ask my question a little bit more specifically, Robert, right? Like I know right now there's a discussion in the COG with about $980,000 that's available to the city and the county. It has not been determined through that committee how that money will be spent. Will it be divided equally through city or county? Will it be used for equipment or overtime? Right. Once that money comes down, whether it's the 450 or the 980, will that then create dollars that can be pushed to economic development or community development, or is the need so high right now for public health and safety that that's just additional dollars?
It would just be additional dollars. And so one of the things that we can do is, and I did it in the last presentation back on April 27th, as I did show a list of some of the different federal funding that we did receive or we have received or in the process of receiving. So a lot of it is still going through the grant application process, but as I mentioned, everywhere from, just across the board, Department of Justice, we've got, Health and Human Services funding, we've got the FTA, the FAA, every potential opportunity we have to free up money that we're recommending through this coronavirus relief funds, everywhere we can identify funding to maximize these resources we've been doing. So our cross-functional team led by Elda and Nicole Cody, who's been critical, she's has a lot of experience on the FEMA reimbursement side, just going through, unfortunately, some of the things we've gone through over the last couple of years. They've done a really good job of making sure we're trying to maximize the resources that are available to us to bring forward the best recommendation for you all.
Sure, absolutely. And so my next question is, how were the numbers determined, right? I think I wrote them down somewhere, I apologize. So it was 84 million for public health and safety, 18 for economic development, and 16 for community development. Where did those numbers come from, or how were they determined?
We've spent a lot of time over the last several weeks going through those numbers, and so working very, very closely with every city department, not just the fire chief and Nicole Farini and economic development, but every department to understand where can we get the biggest bang for the buck. I mean, I think the fire chief did an excellent job of talking about the things that we've done, but how much more we need to do going forward. And so that, obviously, the public health portion, I mean, I'll let Mario come back on to stress the importance of that funding and the impact it's going to have on the community, not only right now, but long term. So going through the list, I think the fire chief identified well in excess of 119 million. And so it's really just about, where can we scale down? Where can we be realistic? As I mentioned earlier, we do have some other funding sources to help augment. So between the ESG and the CDBG to help offset, there's another 4.6, I believe, to get to 21 million for the community development programs. and then identifying the economic development side of what not only we have through the coronavirus, but again, looking at other sources of funding such as our impact fund and our Paso Electric franchise fees to help offset. So it wasn't that we said, here's going to be your allocation, here's your allocation. It's really about where's the need and the number of priority, and you see it in the numbers, the 84.2 million for the public health and safety response.
Sure, and I don't think that I need Chief to come and justify that. I'm not questioning at all. I definitely think, it's not surprising that the public health and safety would get the bulk of that money. Just wanted to understand the process. But you did kind of jump ahead to one of my other questions. So we did see a specific number from Nicole on her fee, her community development fee. The name of the fund is escaping me right now.
Community assistance.
Yes, and you briefly mentioned that there is the possibility of looking at the impact fund and the El Paso Electric Fund. Why hasn't that been done by now, right? Like, so I see that community development has already tied down funds from their department, and I'd like to see that from economic development. Again, not questioning y'all, just understanding how we can stretch our money as much as possible, right?
So some of it's been, and we have, I think when we put the money up for the lift fund to, get moving and be proactive, we did do that early on. I'll also tell you that some of the things that are being recommended is we need to make sure that it falls within the guidance that we have and the FAQs that we received. So make sure that it falls within the three-pronged approach, and then also that it's mentioned in the FAQ. So, I mean, I'll give you an example. One of the things was, and it's actually in the presentation, so we need to actually work on what that program is going to look like, is waiving licenses or permit fees. Well, we can't waive those fees because then we lose on the revenue side, and we can't use the federal funds to replace our revenue. So we need to get creative about how do we go about reimbursing or creating a program to where those small businesses that need that assistance are able to get it. So that's one example, but we're definitely continuing to review. I'll tell you that also at the same time as, we're dealing with this health and financial crisis, we can't forget about the budget impact. And so looking at how can we use those economic development funds to also help potentially, as we're developing this budget for next year. So there's multiple prongs going on. I would tell you that the city manager, myself, the city leadership, we're meeting multiple times throughout the day, all throughout the week, to talk about all of these various, areas going on where it's a lot. I mean, the city manager talked about the amount of communication. That's just the external communication. That's not the number of emails and texts and, the day-to-day conversations that are going on. But I will tell you that absolutely we're looking at how we can best utilize every source of funding, moving forward to address this issue.
Sure, and you brought up
Representative
we
Manello.
have actually tapped into the impact fund when we first brought into the lift fund. That's a great point, and just because that's not presented here today, it has been done.
Right.
And moving forward after today, I'd love if we can just get a refresh for the council on what the balance of the impact fund is and what currently the policies for that and the economic development is, so we can be aware of if there need to be changes in the future. We have that information in front of us already. And I'm sorry, Mr. Gonzalez, again, you were going to say something.
No, don't be sorry. I just wanted to add more context to answer your questions that Robert had already done a really good job of. Just wanted to add one fine point to that. I have asked staff to work on a plan with the small businesses, not only just that $1 million that we've already allocated with the county, which is for a total of $2 million with the LIFT fund, and then the stimulus package that's coming down is going directly to businesses. But in addition to that, what I've told them is how can we, exactly what you're talking about, how can we reassess the impact fund and look at the small businesses and how can we help the small businesses get back up and running sooner rather than later? Because I told them indirectly that will directly help our sales tax, and that'll help get a lot of the funding back in place that we count on the general fund side. So that's our strategy, that we want to look at the macro, and if we help the small businesses, they'll help the general fund. So that's kind of the big picture of what we've been assigning our staff to do. And that's part and parcel of what he's talking about. He didn't want to get into the details of that, but I thought I'd share that with you, that has already been assigned. That was assigned out 3-4 weeks ago, and staff is working on that item. And we should be bringing some more additional data on that to the council soon.
Absolutely, I agree. I think the way that we look at our economic development fund and how we look at economic development in El Paso has changed drastically because of COVID, or should change drastically because of COVID. And so I look forward to those conversations. You did mention, Robert, and I saw in Jessica's presentation, right, so a few things, permit fees, understanding that we put money so we don't lose that revenue, but kind of understanding, I guess at this moment, I don't understand how that's such a big need, and maybe you can help me understand, right? Because if we're looking at helping current businesses, they don't really need any more permit fees, right? So I'm sure you guys have more information than I do.
Just to give you some idea, ma'am, as we're starting to reopen, some of these businesses are actually going in there and doing some structural changes to their, making improvements with, for example, the air filtration systems. They're a really big deal right now, and so a lot of our contractors are being hired by our small businesses to make those retrofits. They have to come in and secure those necessary permits. Many of them are food handler permits related. Many of them are related to occupancy of that business establishment as it goes through, the different, phases of that. There's just a number of needs that we want to be proactive with our businesses now and understand that they're going to have a lot of those upfront, additional financial commitments. And so if we're able to provide some of that relief at that onset, then that'll help them as we get them back in a much more stable place.
Well, thank you for that clarification. That makes a lot of sense. Another thing is, and I know, Mr. Gonzalez, you mentioned this a few meetings ago about sales tax abatement. I know it goes to the state and we pay a portion of it. We also have to pay the state to kind of take in those funds, if that has been a part of the conversation at all.
Yes, that's what I meant when I was referencing the small business work that we're looking at doing and how can we use the impact fund for that. But are you referring to the state sales tax item?
Because a portion of that does come to us, correct?
Yes, ma'am. If you're referring to the legislative email that I sent, that's a separate discussion. But if you were just referring to how we're helping the small businesses and what our plan is to help them get stood back up again, as I said before, we want to use the impact fund, or I've asked staff to research the impact fund on how that can be changed within the guidelines that have been approved in terms of how we receive those funds and how we can stand up the smaller businesses sooner. On the longer term, what I had presented to council via an email and what I said in I think the last council meeting was, can we look at the sales tax in its entirety at the state level? Because there's still a half a penny that we could get to get the 2 pennies or a full penny, and we would be 2.5, and that would be above the limit of the 2 cents that's statutorily in place throughout the state. However, that would be a means from which we could reduce the property tax. We could use those funds that other people come in and spend money on in the region, whether it's Mexico, whether it's New Mexico, whether it's other people visiting El Paso. That is a great way where we can bring in additional dollars and then use those to give a property tax decrease, and then also use a portion of that for public safety. So that would be something that we would need to look at long-term and share with our legislative team at the state level, and something that I would consider the council to look at in January when we go into the legislative cycle. I know that's not going to help us now, but that'll be something that long-term, because this isn't going to go away in 1 year. And so this would be something that can help with our economic recovery. And we could even put a sunset provision on that at the state and tell them, look, we could just have that for 3 or 4 or 5 years. And that could just help during this time. And then we sunset it at the end of that time. And it also has a provision where the community has to vote on it as well. So it would have triggers in place where there's accountability. You could have a sunset provision where it could go away. And then you'd have features where it would reduce the property tax and also go towards public safety. So those are some ideas that we're looking at the long term, to be creative and innovative. Y'all have challenged me to do that. And y'all said, look, when y'all want to do something, y'all come up with great ways of finding solutions. That was just something I wanted to throw out to the entire council, so y'all would kind of be thinking about that in the long term.
No, absolutely. We've talked about that for a long time, that extra penny, and this is definitely the time to do it. Jessica, really quickly, back to the permits. Is there language that makes sure that these abatements on permits are just for structural changes related to COVID?
So some of those, ma'am, are structural changes, but some of them are just annual business licensing renewing fees. So it may not just all be for structural or construction improvements. So there's a number of fees that we would have to take a look at, and then maybe make some modifications to our ordinances or any of the regulatory process, both at the city and the county level, because there's a DBA and there's a number of other license fees that they have to secure. So we want to work in conjunction with both the city and county to figure out what we could do to waive those costs.
Sure, but again, making sure they're just for businesses affected from COVID, I think is the most important. And that kind of goes to my conversation about the LIFT fund that you were having with Representative Schwartzbein. You know, one of the complaints that I had heard about LIFT fund is, you know, people, it's not a complaint, it's a great thing. People applied so quickly that money was kind of gone immediately. And looking at the process to make sure that we are giving people the chance to apply and then choosing the recipients of the money based on the actual need and impact, whether that's the structure and size of their business. Another thing is really making sure that wage relief is in there. I know you did mention how businesses were looking at payroll before, but really focusing on if you're getting relief from the city, you know, proving that your employees got unemployment. If they did not, that you have used some of these dollars to make sure that payroll is being addressed, right? Because again, it was mentioned from a lot of callers that there are large populations in El Paso that do not qualify for unemployment or stimulus. They are employees. If that employer is willing to employ them, they should be willing to make sure that they're using these federal dollars to get them their back pay. So I would like to see some language that is really making sure that the recipients of this money are addressing payroll and can prove that all of their employees have been covered one way or the other.
Yes, ma'am. We have a compliance process that would be set up both regards to the permit fees and then regards to ensuring that the payroll has been met.
Okay, thank you.
And also along those same lines, so one of the things that's obviously very important is one, staying within the guidance and the eligible uses of this funding. So Nicole mentioned it early in the presentation about coordinating processes for expense tracking. So before we actually start expending, we want to make sure that these programs, one, identify exactly how and the criteria it relates and that it meets those criteria. And then two, the reporting piece of it, because we know, so 1, 2, 3 years, maybe 5 years down the road, we will be audited. So creating those processes now so we have all of that documentation lined up in advance so that one, if we're not administering the program, if it's done through, you know, a third party that, you know, they're following the same processes that we have. So definitely before we start spending these funds, we're going to make sure we have those processes lined up and that everybody is recording and having that documentation of how those funds are going to be spent. And then two, the reporting requirements to make sure that those funds are meeting how they were intended for. Absolutely.
So, and I know, Ed Robert, on that note, I know with the approval of this item, it gives you all the authority to go ahead and do this, to put together these processes. I would ask that there is an element of input from community. I know you guys are already doing that, right, Jessica? You mentioned the Chambers of Commerce, but we did hear from, and Nicole, I know you're doing that as well. I've had direct conversations with some of the alliances that were mentioned today, but we really would like to see that officially as that money goes out. I know that those processes do not have to come to the council with the approval of this agenda item, but would like the ability to review them and make any notes, whether it's in the official capacity or not. So again, you know, I know we have some items on council tomorrow. I'm fine with moving ahead of this today, but there is some language in the resolution that presented by Representative Schwartzbein, Hernandez, and myself that I would like to see through this item, which does give us a little bit more. Again, not asking you to bring those processes to council, but allowing us to see them and make notes on them before they're officially put in place, if possible.
Okay.
My next, I don't know, Mr. Gonzalez, I don't know if you wanted to say something. I saw you just pop up, so.
Well, I think that if the council so votes to do that, we can do that. That's going to slow up the process to get the money to the needs. We could provide a report after the fact and show that to the council, and that could be a report that we give to y'all. Y'all have any adjustments or have any desire to make changes, we could make those changes on, you know, right after y'all review them at a council meeting. And we're happy to do that. We can provide those reports in writing on a weekly, well, I need to check the staff, but probably a bi-weekly or monthly basis for sure. Monthly for sure, and then I'll check with them if we can do it bi-weekly or do it even faster than that. But I would suggest that we be allowed to dole those out as quickly as possible so that we don't run up against the deadline and the money not being spent. And number one, and number two, that we don't hold up the need to those people that need it the most. We did follow all this criteria that we were laying out for you, but I think that the reporting process in terms of making that report and having council give us additional guidance and feedback, that would, I think, meet with your request. But we're happy to do it either way. I just don't want to
Well, and I don't
hold
want
up
to
the
slow
money.
anything down either. And I don't know if Mrs. Neiman even needs to comment on this, but is it possible to just do it through email instead of waiting 2 weeks for a council, right? You guys say, hey, we have this language, please review it if you have any comments.
We can definitely send email reports as quickly as possible. I don't think the council can be approving it by email, because then that's a vote, right?
Right.
So that would be the only difference. But I would, like, again, we'll defer to the council if y'all want to see it beforehand. But my only concern, just so y'all hear me, my only concern is that I just don't want to hold up the funding, because as you heard today, the funding is great. The criteria that we're using, we presented it ad nauseum to you today with detail. But I do understand the concern that the council has getting into the most neediest groups in our community. But as you can see, the need is prevalent. It's throughout. It's not like, but so we're prioritizing it with the basic needs. Obviously, food is a basic need. Having employment is a basic need. Those kinds of things, food and shelter, and then employment, I guess, would be in that order.
No, I agree. And I know community development, and Nicole is really great at steering committees. Love to see a member of council on one of those steering committees if possible. Don't want to set y'all down on that, because I don't know that economic development has the appetite to do something like that. But if steering committees do come out of this, would love to see council members to maybe avoid some of the delay. And so my next point, and I've kind of forgotten some of these a little bit. So Nicole, you just had a conversation with Representative Schwartzbein about kind of the community fund and the money that we're throwing through it, and the not purchasing, but the contract process that you will have for these dollars. I'm glad to hear that being really transparent, right? We don't have the capacity to do a lot of this outreach when it comes to these community development dollars. But I would like to see maybe more of these programs go through the One Fund. I think that committee was set up, the bylaws are in place. It's possible to go ahead and use that. And I would like to see, more of the dollars. We heard the Apartment Association mention a committee. I just think that sending the dollars through transparency, through a community fund like that is maybe the best way to go. And we've heard both the Pasadena Norte Health Foundation and the Community Foundation, who are both on the board of the One Fund, really talk about their need for involvement. And so I would just like to make my statement in support of that.
Thank you. Is that it?
Yeah, for now, that's it.
All right.
Oh, I'm sorry. I did have one more thing. I apologize, Mayor. And this is actually for Chief D'Agostino, if he's still on the line.
Yes, ma'am.
Chief, I've heard a lot of concern about tracing and tracking from people. I don't necessarily share the concerns where it comes to the city of El Paso, because there were agenda items put with language involving tracing, right? I've heard people reference what is happening in China. I know that we are not moving that way, but I wanted to know if you could just give a little bit of overview of what tracing and tracking looks like for El Paso, to maybe just address some of the concerns that people might have.
Okay, and as I was describing earlier, the tracing and tracking epidemiology begins when you get the positive test. So as they make a contact with a patient who's got a positive result, that's where the investigation starts in what kind of signs and symptoms are they having. Have they had medical care? They just go through the drive-through site. They take it from there. From there, they're also looking at who are these people in close contact with. So who is it that they possibly exposed? And as they drill down, they're prioritizing in a high, medium, or low capacity as who needs to be tested next, or who else we need to be contacting, so we can ensure that they're isolating themselves from additional public or from additional contact. From there, it goes into a kind of a monitoring state where they're actually keeping in contact, whether it's not the epidemiology, but it's either the monitoring or the trackers. They're actually communicating daily to check on their signs and symptoms, to follow up with them, to see if there's anything progressing, if they remember anything different about those who they've been in contact with, to make sure they've been isolating, if they have gone out, where to. I mean, we ask them to maintain at home, but some people are individuals. They might have to put a mask and go out and get something. So it's kind of to determine if they were able to stay home. If not, how far did they go, and where do we need where do we need to be looking at next?
So for clarification with some of the concerns I've heard, we're not using cell phone data to track people and the people they've interacted with.
No, we've heard, on the national level, we've heard about that all over the world, but we are not doing that locally. We are not. We are looking to bring those systems that we talked about with the state, and we're looking into several other programs on our own that we could possibly use that would help with some of that contact tracing. But ours is more of an app approach where we could give the code to scan into and monitor them from that point. Where instead of having to have daily calls, they can text and communicate us via that. They could show us where they've been via that same app, and we're looking at possible ideas like that we could bring on board here in the next.
Yeah. And so say that person uses the app and say, I tested positive and I just went to Walmart. We are not going to somehow trace everyone that went to Walmart, show up at their house and force them to quarantine.
That is exactly it. That's impossible for us to do at that scale.
But if I saw that someone at that Walmart did test positive, I could then go get tested myself voluntarily.
Excuse me?
If I saw that through this tracing process that I was somewhere where there was a hot spot, I then have the ability to contact someone and voluntarily say, hey, I was here, I would like to get tested.
Well, like I said, it goes based on the severity of the contact or the intensity of the contact. If it's just in passing, there's strict guidelines the CDC's put out, there's strict epidemiology tracking that we do, and it's looking at how close were you in proximity? Were you wearing a mask? Were you there for a prolonged period of time in a close confined space? That's what we're looking at to do that. Currently, we don't have open testing to anybody. So if you say, well, I was at the store, I want to get tested, it's not here. It's not here at a national level, and it's really not. We're lucky to announce today those 4 new testing sites, and they'll be opening anywhere from 4 to 7 sites per day for the foreseeable future. That's going to bring in over 100 tests per location on a daily basis, and those are wide open whether you have symptoms or not. So we do have some of that capability today. Some of this funding that we're looking at is expanding and going on into the future where we can hopefully offer that type of testing without the limitations of having to be symptomatic.
Okay, thank you.
Okay, Representative Rivera, Representative Rodriguez, and then Representative Hernandez. Did you want to say something, Tommy?
Well, I just wanted to make one comment. There was a report that we gave to the council from Alex Hoffman, if you recall, and that report talked about how the spending habits of people and how that could be tracked. Maybe that's what Ms. Anello was referring to. I'll make sure that Alex sends out an update to the council and just reminds the council what that report was about.
Representative Rivera.
Thank you, Mayor. Thank you, everyone, for that presentation. It's great. My questions, I also have plenty of questions, but I'll start out with Chief D'Agostino, if he's still around.
Yes, sir.
How you doing, Chief? This question's for you. I know you stated in your presentation that you based your slides on heat maps, the newly formed sites for testing, and being from the east side and having one of the largest population in zip code 36 and 38. I noticed that you only had two in the fact that one for that's going to be set up at Walmart is going to be on a part-time basis, Monday, Wednesday, and Friday. Yet 8 a.m. to 4 p.m. Yet we have a large number of people in this zip code, 36 and 38, where they're considered essential in one way or another, whether they be public servants, health workers, or essential workers such as the grocery store worker, postal service, delivery service, etc. My question is, are you going to include more testing in the zip code 29936 and 38?
That's exactly it, sir. And so the Walmart, they might be operating 3 days a week, but in communications with them, they're going to assess it based on the need and based on the demand. So that need and demand is what's going to set the precedence. As we go into partnerships with the school district that we talked about, that's where we're going to fill those other voids in that large area right there. There's hospital facilities, there's doctor clinics, there's the drive-through we set up. There's multiple avenues to get tested in those 2 zip codes, but that's where as we look at this heat map, that's where we're going to identify those school properties so we can fill that void in even more and give more options for the community going forward.
But do we have the highest reported cases of COVID-19 here in this zip code?
Yes, we do have some of them.
And those aren't taken into consideration?
They are taking into consideration. That's why we added that new Texas site we have today. That one's going up there. As they bring in additional resources, we'll be looking at setting additional sites up in that area as well.
Okay.
Along with the school district.
Okay. Also, during that presentation, there was no mention of testing sites in 79907 or 79915, which crosses 3 districts. And we do have a heavy population of vulnerable citizens, or senior citizens. And do you foresee some sites? We also have, do you foresee some sites being set up because we have the facilities to set them up?
That's exactly it, but the testing is just starting to expand. And so we're bringing them on board as we can, as quickly as we can, and as the system allows us. Setting up a drive-through operation, the drive-through operations we've had set up through the federal lane is a staffing demand of about 50 people for that site in one day. We're looking at other options. So these drive-through sites that we put up at a pool or a library, those are allowing us to use existing buildings. It's a different type of testing. As we go out to the schools, that'll actually allow us to fill in those voids a lot better as well, because that testing is where it's the patient actually self-swabs. So you'll pull up to a healthcare professional, they'll hand you the swab through the vehicle, you'll actually swab yourself, put it in the container, seal it in a bag, and then you drop it into another bag that the healthcare provider has. That's going to allow us to start putting up at those additional sites. The process we have currently at the other sites is more of a medically intensive, where we actually have to swab the patient. It takes a little bit longer. You can't get as many people through there. As we said, we hope that the use of these Walmart locations, the use of the new state assets that we have on the ground, that we'll see some good numbers out of them. Also, those locations we picked to fill in some of those voids as well, those are to monitor what kind of flow we have through them. If we're not meeting the demand in those neighborhoods, those are mobile forces. We can move them to where they are needed. And so, yes, as we build out, we hope to have, accessibility throughout the city.
Do you have an idea when that accessibility will be? Because I'm talking about an area from Alameda and Delta, District 3, all the way through crosses mine and ends at District 6, which is Alameda and the county line. So, I mean, do we have some sort of idea when these could go up?
Yes, they're on the plans right now, and they're scheduled in the communications we had with City Manager Gonzalez and the school districts. We talked about hoping to get these up and running in the next 7 to 10 days.
Okay. All right.
So, Mr. Rivera.
Yes, sir.
The chief is right. We just forged that agreement on Friday. And so in terms of that specific location, we can request that and in some cases direct the school district to open up in those specific areas. We spoke to all the school districts. They were all present. And I mean all of the ones inside the city limits and outside the city limits in our El Paso area. So we spoke to all of them, and they all agreed to have these sites. And so the chief is right. It's just a matter of getting those stood up, and they'll be stood up in the next week or so.
Okay. Thank you. Thank you for that. Now, regarding the tracers and all that, regarding people who have been tested or who have recovered, etc., are the current testing, is there current testing for first responders, healthcare workers, essential frontline workers, on their families, if they could be, to find out if they could be asymptomatic or pre-symptomatic, speaking of spreading the disease? Is there any kind of follow-up to that?
So what we've been working with so far and to date is having to follow the federal guidelines. I mean, these are assets that were given to us by the feds. And so very originally into this process, when we opened up, it was opened up to all first responders and medical care providers who were asymptomatic. The feds changed that on us and it went to symptomatic only. So we don't have full control on who we can test, but through our contract testing and our monitoring, we determined that same involvement. Was it a high risk, medium risk, or low risk? As of today, with these new state assets, we can test asymptomatic patients, but that's new. It's new to the community today. We barely got word of that late Friday evening. We solidified the plan Saturday evening. We had boots on the ground yesterday identifying the sites with the EPI team and the heat map and the state resources, and we have them up and live today. So that's how that transpired. As it goes forward, we hope to have more systems, more tests broken out that way. We're also doing the antibody tests that I talked about. That's getting that sample set. That's allowing firefighters and healthcare professionals. They're the first round of who we want to get tested, and we'll expand that as we go forward as well.
Thank you. And will that apply also to the antibody testing, which was started last Wednesday?
The antibody testing, yes. We're opening it up to different. Right now, it's healthcare professionals and first responders, and you don't have to be symptomatic. That's not a test to get when you're actively carrying the virus. It's just a test to get to see if you've had the virus.
Okay, but you will have that take place, correct?
If I understand you correctly, yes, we are offering that as of last Monday to healthcare providers and first responders.
Yeah, that's exactly my question.
Yes, sir.
In slide 12 and 13, I've got a couple of questions for you on that. First of all, thank you and I'll also thank staff there for putting out the press. But have you noticed on the press release that was placed yesterday, late in the afternoon, there's one essential thing missing for the people that depend on these things. Do you see that? It was a time of operations that wasn't listed. I know they mentioned to go to EP Strong, but I mean, do you think you can put that on in the future so they can have an idea?
Yes, sir. And part of this CARES funding is to have that media campaign so we can advertise it through all the mediums, including print, and so we can have testing dates and locations. Like I said, it was a quick development this weekend. We wanted to get it out there. We were hoping, we haven't, like it's you know, you want them to sign up ahead of time. We want people to sign up so we can orderly keep it, so we can keep social distancing. So, you know, even putting locations was new to us. And so now times, yes, we can clarify that.
Also, on slide 12, you mentioned the partnership with UTEP and other organizations. Has UTEP reached the CLIA certification so they can start testing?
That application's been submitted. We had to do some updates to it on what the involvement is. You know, that's the CLIA application. It's based on information they're requesting from us. We're in communications. We don't think there's going to be an issue getting it done, but it's still in progress right now.
And at first, during your presentation, you said 5,000, and then you said if UTEP joins in the school districts, you broke it down to 1,000 each. Is that correct? Or my understanding was that UTEP will do.
Yes, sir. When I was talking about 5,000, that was the antibody testing. Okay. That's completely separate. On these PCR testing, the partnership with the school districts, the lab we're utilizing for there, and the partnership with UTEP, I'm sorry, that's going to allow us to do a couple of thousand tests a day locally. So that's 2,000 each. That's going to bring us to those capabilities. Now that's still pending on the logistics of it. Do we have enough of the test kits? Do we have the swabs? Do we have the personnel to conduct the tests? Those are things we're working on, but there's federal demands and there's a backlog on everything. So we're constantly pushing. We have a logistics teams working on it full time, making sure we have the supplies and we don't run low, but that's constantly something we have to be cognizant about. Just because we can test 4,000 or 5,000 tests in our own labs here locally a day doesn't mean we have the supplies or the personnel to make it happen. Like I said, we've had these drive-through site open for quite a while now, and we barely started hitting the 250 mark last week.
And you mentioned personnel. What do we have on what is our staff comprised of? How many people do we have on staff?
As far as for the federal testing lane?
Testing, or the testing.
Just for the federal lane, it's about 50 persons a day. Now that's it's compromised between the border rack, WANDA, some medical professionals, the hospitals volunteering personnel every day. We've got fire, we've got police augmenting that, we've got public health, and we do have some other city employees who do staff the location as well as augment it.
Several things down here. Oh, okay. This next question is for Ms. Herrera. Thank you, Chief. Thank you.
Yes, sir.
Ms. Herrera?
Yes, sir.
Okay. Sorry.
Yes.
Okay, regarding that information you put on slide 25 regarding the LIFT fund, I understand Mayor Pro Tem and Representative Mayor Pro Tem Schwarzbein and Representative Anello have also heard complaints about the LIFT fund. I know firsthand there was a small business in my district had excellent ratings and was still turned down by the LIFT fund. I want to ask staff, specifically under the city and county program with the LIFT fund, what is the average credit score number approved by the LIFT fund under the this program with them?
So I'll get that information for you, sir. I definitely want to first verify, and I'll go ahead and send that information to you. But keep in mind that a lot of the way this system was set up, they were expecting a significant volume of applications the moment that we got all the funding in place. And so what happened was that this is a computer system that essentially just goes in, evaluates each of the applications, and many times does not give it that customer service, person interaction with that business owner. And so what happens is that they're doing it for efficiency, to make sure that business gets a quick review of that application and then gets a callback by a business specialist. And so there's a lot of different mechanisms that LIFT Fund had to navigate with, and this is not something that's just specific to LIFT Fund, sir. This is specific to many of our lenders. There's and the calls. I mean, you've seen even for unemployment filings, there was a huge delay and backlog, right? Right. So there's definitely that. But keep in mind that we've had a very, very good relationship with LIFT Fund, not just with regards to this pandemic, but we've actually been working with them with our revolving loan fund since 2014. And so their customer service approach, and I think your office was a testament to that. Their customer service approach has been really, excellent, and in my opinion, because there's never a time that we cannot get a hold of them so that they can reach out to that business owner, so that they can provide not only assistance with regards to those zero interest loans or the grants, but also Lupe Mares here, for example, has gone above and beyond and has also assisted with the PPP loans. And so they're really doing everything they can to take that extra step. But just keep in mind that the need is so overwhelming that it bogs down the system, and what's typically a one-day turnaround takes a few extra business days.
Okay. Do you think that you would be able to provide counsel with a breakdown of the zip code of credit, the breakdown between who applied by zip codes and turned down and how many were awarded?
Yes, sir, of course. Yes, we can definitely get the demographic and just orientate where the loans originated from, and provide that information to you all as well.
Okay. Thank you. Appreciate that. Thank you, Mr. Rivera. Appreciate it. My final question is for Ms. Kareem on slide.
Good morning, sir, or good afternoon.
Good afternoon. I was going to say the same thing. Good afternoon. How you doing?
Very good.
It was great. It was great. It was great to hear your presentation. It was really, it's an overwhelming issue that we're tackling here. But I've got also a question for you also, because it was one of my recommendations for yesterday's agenda. On the allocations for, let's go to slide 18, would be the rental assistance, utility assistance, and the mortgage assistance. And then you drop down to the expanded digital access. Is there any way to get a breakdown of that, or do you have the numbers, what they're going to get? I mean, and if it's, want to make sure that it's sufficient. If not, do we have sources, to look towards for additional funding if we need to?
So I can answer that question in part. So we have worked internally. We think we understand, based on the need that we heard, how the notice of funding availability will go out with different portions of that $11 million or so that I presented in the housing and basic needs category. We have a sense of how that will get deployed, and we can share that as a follow-up with you. What I can tell you is that what we all already know, which is it's not enough. I think that Mr. Jimenez mentioned, $12 million, and he mentioned that isn't enough. When you look out there, and I would point you all back to the housing needs assessment that we presented to council several months back, and what the need was prior to COVID. And so now, if you amplify that, we know it's not enough, but we have indeed allocated the most amount of funding to rental assistance, followed by utility and mortgage, and then followed by the other categories that you see there. And so I can share that with you after.
Okay, thank you. Now, the utility mortgage with this, under this rule, what I was told is only strictly for electricity, correct?
So the utility assistance that we've set aside would not be restricted to only electric. I will give you just a nugget of data, because we've been in contact with the utilities, and just with gas alone, we're seeing upwards of $14 million in arrears across 42,000 customers in our community. And so obviously, we're not going to be able to meet that need, and that's just gas, right? Electric would be higher because it's summer. And so utility assistance would be broadly deployed across any of the utilities that are required to meet basic needs.
Okay, great. And so you took the words out of my mouth regarding the electricity going to be a little bit higher, seeing how summer's coming around. So I guess the relief plan that I'm looking for is assure that these people, first of all, don't lose their homes or businesses. We don't need that. And then secondly, of course, that if they're renters, that they don't lose their rental property whatsoever, but also live what am I trying to say, comfortably with the heat coming around here pretty shortly.
Right. So when we talk about basic needs, that's why we refer to it that way, because it's shelter, food, and utilities, warmth, water, those things that we all, well, not all, but a lot of us take for granted regularly. Those are the things that are included under basic needs. And the other thing that I would suggest that we all should be thinking about is not just what's happening right now, but what may happen into the fall and winter. I just shared with you the gas numbers, and those are gas numbers over the course of the spring. So those gas numbers are going to be double that in the fall and winter. And so we need to be getting in front of some of those issues. And that's what we're trying to do when we say basic needs.
Basic needs. Okay. All right.
And Mr. Rivera,
yes, sir. Thank you, Mr.
Rivera. I would just add that what staff has talked about in terms of the next tranche of funding for the federal government, that's going to be very important. And the fact that we took action to recommend to you all that we use the money now for the community and not for the city so much, but put a lot of that really more into the community. We are listening, but I don't want that to send out a false positive to the community that there's not going to be people that do get impacted that we can't get to because there's not enough funding. Even with the recommendation that we have today, there's going to be more need out there. So we will be placing our priorities on what Nicole talked about, the basic needs, food, shelter. Those are the two basic things that we have to focus on. And then obviously employment would be the third. But those are the things that we have talked to staff about, and they're, as you can tell, they're fully motivated and focused on those areas.
Okay, and while I have you on there, while I have you on the screen there, Mr. Gonzalez, since some of the council members, including myself, have placed items on the agenda for tomorrow regarding the CARES Act funding for the implementation of special programs, do you think that we could somehow add it on to the action that we're taking today if we need to?
I think that I would have to defer to Carla Neiman on that. But I would say that the majority of everything that I read on y'all's resolutions is in the report that we're giving today. And by the way, we were already scheduled to do this. And I spoke to some of y'all about that and said that, I understand y'all wanted to put resolutions on, but that our report was very comprehensive and already addressed those things. But I wasn't, obviously can't limit council from putting items on the agenda if they choose to do so. But I do believe that our recommendations do take into account all of the concerns that the council had. If they don't, we're happy to discuss it further tomorrow.
Okay. All right. Well, thank you so much. Thank you, Mayor.
You bet. Representative Rodriguez and then Representative Hernandez.
Thank you, Mayor. My question is for Chief D'Agostino. Chief, I have a question. As far as the people that test positive for asymptomatic, how far back can that testing be traced? I know I have people that were asking, they thought they had it back in January. Does this testing prove that to be true or no?
I'm not exactly sure how far it goes back, but I do know it's supposed to go back if you've ever had the antibody in you. It's kind of like a titer we do for other diseases to see if you ever had chicken pox or something like that. So yes, that's what the antibody testing is. It's supposed to go back in time to see if you've ever had the COVID-19.
Okay, so to say January, that's still a pretty relatively early time to say that yes, you could test positive for it. Okay, and then also going back to the whole contact tracing, you all have been doing this, right? This isn't something new. This has been going on for several instances, including STDs, correct? This has been going. It's nothing new. My question is.
That's absolutely correct. While this is a much larger scale, they worked it through the 2009 H1N1, the 2014 when we had an exposure over 700 infants to TB, the 2014 as we were doing the Ebola planning and stuff like that. So the epidemiology is always working in the background. They're always looking there. There's reportable diseases that they have to report by law, and that's what they're there to track.
Okay, so since you all have already been doing this for some time, is it necessary for you all to receive further direction from council to continue doing that?
I don't think it's necessary. No, that's what epidemiology does.
Because it's already existed. Okay.
Yes, ma'am.
Okay, and then
we're expanding it definitely.
Okay, so as far as the expansion, that includes the app, correct?
Yes, that's part of the expansion, the build out.
Okay, and do you happen to know the name or the maker of the app?
I don't have that right in front of me, but I can get that back to you. Like I said, that is actually a state system that they're working on. And so I was just in communications with the state, was yesterday afternoon, and they were saying that they're thinking they're going to be about 2 weeks out on that. But I can look up the name and see what they're doing.
And then at that point, it's still a voluntary basis, right? It's not going to be like something that everybody has to download the app.
No, because we know in our community too, a lot of people don't use the apps. They don't have that smart technology on their phones. And so it'll be based on how we can use it best. When you look at as we're doing the antibody testing, we're going to see a lot more people who have been positive, but were asymptomatic. So they didn't even know it. And so that's where we're looking at. That's where we need to get the app as we expand our testing going forward. And as you can see, it's coming online rather quickly. As that testing expands, hopefully it's those 20 to 30-year-olds that are getting on that app, and those are the ones that we can, the the population who's actually uses those apps. Those are the ones we can kind of control, get a better picture of where they're at, where they work, who do we need to quarantine, who else do we need to test. That's going to help us in those aspects. So it's a multifaceted approach. It's going to be the old epidemiology, old tracing techniques compiled with the new part, and I think that's going to allow us to capture more of our community.
Okay, so with that said, I think it's a pretty obvious statement to say that with the more testing, there's obviously going to be more positives. Can we also say that, we shouldn't use that to alarm people, to also remind people that, 98% of the people that do come in contact with the virus, they're surviving it? Is it fair to say that?
Well, that's correct. I mean, if we look at who we've tested so far, out of everyone we've tested, they've all been symptomatic. Only 90% of those, 90%, not only, 90% of those have been negative. So it's a very small population set. So yes, you could. You're right.
My baby. Okay. Yeah, I guess just the point I'm trying to make is that I don't want people to be alarmed. Now people have that option to go get tested if they wish. They don't necessarily have to be showing symptoms where that was the case before. And I don't want people to be alarmed and think, okay, now we have X amount of testing, it's going to grow exponentially. And now we're going to have so many more people that are coming out positive. And now we have to further continue to close everything. I just want people to understand that this is all part of the process and that it's going to be okay.
And that's exactly it. The more you test, the more positives you're presumably going to get back. Like I said, we hadn't met the demand, so even those with symptoms, and I'll go back to only 10% of those are coming back positive. Now that it's more open and we get more asymptomatic people going through it, that's going to show a different picture. And yes, just because you see that increase, it doesn't mean it's been different than what it was, because we do have the additional testing.
Okay. So yeah, if you can just get me the information on those types of apps that are being presented from the state, I would really appreciate that.
Ms. Rodriguez?
Yes.
To your line of question, I don't know if this is where you're going with it, but I know that we have to be very sensitive to the health component piece and people's safety and people's lives. Obviously, people's lives matter, and it's very important that we do everything possible there. We have a tricky, complex situation, however, because there's a lot of need that has been talked about today from the community and from the council. And we have to have a way to pay for that need, to help with that need. And the economy is part of that. And we have to get it up and going safely, smartly, responsibly. But it's going to be vital for us to sustain not only what we do with police and fire and streets, but also with these very real needs that we have in the community that we have to find ways to pay for. And there's only a certain amount of money that we have. We don't print money like the federal government does. And it's something that, we have to have a balanced budget. So it's very important that we balance the health piece. And obviously that is paramount, but to balance that with the economy having to be stood up at some point responsibly and safely, obviously, but that's just a balancing act that we're going to have to tread lightly on. But that is something that's very real and something that is going to affect how much that we can do to help folks like the food bank and other places like that.
Right, and I completely understand that. I'm not trying to be insensitive to the fact that there's people that are being affected by this. My whole point is that there's a whole other number of people that are unemployed. We have over 51,000 people that are unemployed, and we need to kind of take those families into account also. And I understand there's no precedence for this, and it is a balancing act. So I just want the general public to understand that we can't be sorry. I want the general public just to understand that it's going to be a balancing act and that we have everyone's best interest in mind. And that's it.
Okay. And that's what the expansion of testing is going to do. And yes, it is going to show more positives in our community, but it's that tracking them and that's testing of our community that's going to allow us to continue opening up business in a responsible manner.
Right. So definitely the yeah, I just want to really let the families know, the economy know, the small businesses know that they're not forgotten about, and that it is a balancing act, and that this is absolutely unprecedented. So hopefully, you know, we will resolve this sooner rather than later.
Yes, ma'am.
Thank you. Thank you.
Representative Hernandez.
Thank you, Mayor. So a few questions. A lot of my questions have been addressed, but so I'm just going to kind of go over my questions related to compliance. And so I've heard a lot of dialogue regarding, you know, the need in the community. However, you know, my biggest concern, and I've been looking at TML briefings, I've been reading other communities and what they're doing. But, you know, I'm very concerned, given the limitations of how the funds could be used, how the item that's being presented today in the resolution and on for discussion and action, specifically related to the city manager designee be authorized to effectuate any budget transfers and execute any contracts and or related documents necessary to ensure the funds are properly expended for such purpose. And I get that we're in a pandemic, but I need to understand what kind of compliance are you all looking at? And if this authority means that council will not see where those funds are going in the next several weeks.
So by compliance goes back to what I was discussing earlier. So as a part of this, what we're doing is, one, coordinating our efforts with all of the city departments. So every single program that you've heard about, one, it'll go through a legal review. Two, we're going to make sure that we have the process in place to make sure that it meets the criteria, the guidance that has been given to us by the U.S. Treasury Department. And so I've talked about that in the past, where we're very proud of the last 4 years, no audit findings. And that speaks to our processes that we have in place through our grants division's done an excellent job. Elder Rodriguez down in our comptroller's office with her team, with all of the city staff, have really made a concerted effort to improve our grant compliance across the board. This is going to be no different than what we've already done. So ensuring that, yes, everything that we expend these funds on will be accounted for. We'll ensure that we'll have the documentation to support a future audit. But I mean, as far as what we put in the resolution, essentially the resolution states 3-pronged criteria, which is the main criteria of the main guidance given to us by the U.S. Treasury Department. So we'll make sure that all of the expenditures fall within that criteria.
Okay, so my question is you're describing the compliance to be a legal review and a department head review. So where is the checks and balance? At what point will council give authorization for such expenditures? We're talking about $118 million.
So again, no different than how we administer our grants now. I mean, we don't come to council for approval on every expenditure of all of our state and federal grants that we have now. We have strict guidance that we follow at both the federal and the state level. And it's ultimately mine and the city manager's responsibility to ensure that those funds are spent according to the guidelines that are provided to us. And so you've seen the presentation of where we're recommending to expend those funds. And it's not just going to be the legal review. Yes, the legal review is going to be very, very important. One of the things that I've had multiple discussions with just about all of our business managers is ensuring that if we're not administering the programs, which is going to be very difficult and challenging for us to do, we're going to have assistance from other organizations, is that it's very, very clear in the agreements that we have that they're following the criteria and that they're expending the funds according to the way that they've been distributed. So we'll have those processes in place, and as I mentioned, in advance of expending any of those funds.
Okay. With the funds that we receive, when there is a contract given, can you hear me okay? I'm not sure if that background noise is coming from me.
Yeah, it's a little fuzzy. I'm not sure where it's.
We can't hear you.
Okay. Okay. So when we get funds and we issue contracts, the contracts are approved by council. And so when we give, if we're planning on giving dollars to any nonprofits, usually like the only example I can think of is the way CDBG funds, which are federal grants, are distributed. There is like an action plan aligned to that. Today, what you have described in the presentation is a proposal of distributing those funds, allocations for funds, but I don't see any action from council, A, either approving the allocation of funds, B, looking at a very specific action from council that says X dollars are going to go to X organizations. And I understand that time is of the essence, which I think if we should be continuing this conversation, and it just shouldn't just be in one day. And I'm happy to have more conversations if a special council meeting is called for Monday or Friday, whenever the mayor feels it's appropriate. But there's a lot that you all have given to us today, and this blanket approval is essentially relinquishing all authority from council and handing that over to the city manager. That's the way I read it. And if I'm wrong, I'd like to understand where the discretion is from council so that there is a proper checks and balance system.
Sure, and of course, and just like everything that we do have those checks and balances. So in the presentation, you saw the different buckets, and so that's how the funding is going to be allocated. What we're asking for council to do is just approve the appropriation of the funds, the almost 19 million. And so what we've presented to you is, one, putting almost that 84.2 million towards the medical and public health. So that's going to be one bucket. There's going to be multiple parts to that. One of those is going to be an item we have an executive session as to how those funds will be expended, or some of those funds will be expended. So that's going to be one part of it. The other part is going to be the community development, the response programs that Nicole talked about. And so that's going to be one bucket, but we'll have multiple programs obviously under that will address the rental assistance, the food. And then finally, we have the economic development. So we will have the different buckets set up for each of those, which you've talked about, and the corresponding amounts that are going to fall within each of those areas. Okay. So it's not blanket. It's not a blanket approval. Like you said, we do have the allocations broken out. One of the things I think that's important, especially in the medical and public health area, Chief D'Agostino he's really taken on a lot with a lot of the ideas and a lot of things that he came up with. I was really appreciative that we were able to identify how we're going to use those funds to really help the community, not only now, but in the future. And so there's going to be a lot that's going to go into developing and actually flushing out those costs. I didn't want to show, I didn't think it'd be prudent for us to say, okay, we're going to spend X amount on this one minor piece. I mean, there's going to be a lot of different moving pieces with these programs. We're more than happy, obviously, and obviously with everything that we do our budget updates, we're here in front of you all every 2 weeks providing you an update, and we're going to continue to do that. And we're more than happy to continue to keep you all briefed on how those funds are being expended in the programs that we're creating. But we have presented, I think, I know that Jessica, Nicole Farini, Chief did a pretty thorough job on outlining how those funds are going to be spent.
Right. It's just not in the action. It's not in the resolution. It's not in the action. That's why I'm asking. At what point are those funds going to be flexible and fluid? Are they going to, will it go to public health? Will some funds be interchangeable from economic development to community development? There's also entitlement funds there. So, like I said, I was just expecting there to be like a clear outline of how the funds would be spent, and then clear guidance and direction in the form of a council approval. So the way it's drafted, it's 1, 2, 3 items, just so long as they're not accounted for. So the second item is, how do you distinguish, or how do you make the determination that some of these expenses proposed in the 84 million for community development and for economic development, how do you account that they were not already budgeted? And so what I really would like to see is, I want to make sure that there's no expenses that are unallowed, because who's going to be responsible to pay that back if these are expenses unallowed? And it appears that all of that oversight has been given to the city manager or city attorney, but you all have to think about your protections as well. And so if these costs are being spent without council approval, the city is responsible to pay those back to the federal government if they're unallowable costs. So that's what I'm looking for, is like that clear governance structure, that clear approval process. How other communities are doing it? Are they doing it like this, where it's just a full approval appropriation and the city manager has full discretion over? Well, that's where my thought process is going. I just want to make sure that there's a clear way that we're going to distribute those funds, that there's going to be clear contracts, there's going to be clear deliverables.
Sure.
No different than what you would see in CDBG funds with nonprofit recipients and other grantees that we work with.
Sure. So we did research. There have been other cities that have done very similar to what we're doing in order just to get the item in front of the council to keep them updated.
Right.
We've done, I think this is the 4th or 5th update that we've done related to this topic. And we'll continue to do the updates, as I mentioned. And so researching the actions that other councils have taken that other cities have asked for, we basically followed what they've done. And it's all been pretty general as far as the types of programs they want to administer. Some haven't even listed dollar amounts for each of the different items. I talked about the city of Phoenix, who took theirs last week and is setting aside some of those funds for future services or impacts on future services. So what we're asking for is not out of the norm. It's following, looking at what other cities have already done and implemented. And we do have those processes in place, the internal controls. We have not only through the FOAC, we've got other things that constantly come in and look at us as far as our internal procedures that we have in place. And we do have, as I mentioned, I keep talking about the cross-functional team, and the questions you're asking are really, really good, because it's the same thing that I've been asking for the last 2 months. The same thing city manager's been pressing on me to make sure that we have accounted for as we move forward, is to make sure that, and I've talked about it, I'll keep saying it over and over again, is ultimately we're responsible for making sure that these funds are spent according to the guidelines that we've been provided. And it's no different than any federal grant that we have currently, any state grant that we have currently. We have strong processes in place. Again, we talked about the 4 years of no audit findings. When they come in and do those thorough audits of our, and they're not just looking at those grants, they're looking at your processes. And we have those processes in place to ensure that funds are spent properly. And again, this will be no different than what we already have in place.
Okay. Well, like I said, I just wanted to be clear that, and I speak for myself, it's that there is an expectation that the way that we are distributing these funds are going to be, there are going to be safeguards in place to protect those federal dollars. But also, I share a lot of the sentiments from the speakers today that we should be focusing on the most vulnerable populations along with small business development. And how we get there, obviously, I think is it's a task that I think that community development and economic development are fully capable of doing. I do want to say that I very much appreciated Mrs. Fiorini presentation, how she was able to bring in like a qualitative approach and then really bring out this quantitative methodology on where those dollars should be earmarked. And so I think that's a really great model. And that's what people are asking for is community input. So there's community input that has been lacking. And so I'm not comfortable saying, yes, X amount of dollars goes to this association or nonprofit without there being a very holistic approach to determining where the dollars go. And I think that, Ms. Fiorini, on your presentation, you're headed in that direction as it relates to community response and relief for persons impacted by COVID.
Yeah, I think Nicole should speak to that, because she does have those processes in place on her end as well. And so it's not going to just be a matter of, okay, X, Y, and Z organization asking for money and we're going to give them those funds. It's going to be an application process. So Nicole, do you want to talk a little bit about that?
Absolutely. Thank you, Robert. And thank you, Representative. Absolutely. So community development is structured to do this. This is what we do every single year with the entitlement. Now we're being asked to do it in kind of crisis mode, but at the same time, we are leveraging the tools that we've built over time, again, to receive the community feedback. But without getting too academic about the answer, I will tell you that they're depending on which agency or market sector you're talking to, that agency or market sector will tell you that their need is the most critical. And so it's very important that we back check that, like I mentioned, with the qualitative analysis with UTEP, with our research partners, to understand how we can deploy the funds in the most effective way possible and to the right folks, right? So that we have an expanded impact. One of the things, for example, that we've talked about over and over with economic development is, the more we can support livelihood and employment and getting folks back to a place where they can survive on their own, under their own income, the more we can relieve the pressure on the need for things like rental assistance or utility assistance. And so making sure that we're tying those together is important. So when we put out applications, when I put out the notice of funding availability, as we do every year with the entitlement, we'll do that again with this funding. And we're going to be asking those agencies in those applications to articulate to us, how are you having a broad impact and what are those performance measures, right? And so looking at not only, okay, yes, the need is there and our heart tells us this is the right thing to do, but at the back end, using our head and saying, are we actually delivering for our community and for those in most need? And that, frankly, is what the federal government is going to be looking for from us. And so, like I said, community development is well positioned to do this. Our compliance team doesn't let go once the contracts are signed. We conduct monitoring on a regular basis. And the monitoring isn't about bringing a hammer down on agencies. It's about working with them to make sure that they stay in compliance, because at the end of the day, if they're not, we're not. And then that money has to go back. And so we're absolutely taking that forward. You will see an action plan regarding the entitlement funds. HUD requires that. And so that's going to be part of a forthcoming item just on the entitlement funds. But we're going to be deploying a similar process for all of the community programs that we're going to be deploying. And then just in terms of what's even in the notice of funding availability and what those requirements are, that comes out of the analysis that we did that I showed you, that sort of robust measurement looking at, okay, here was the need, but what drivers is it addressing? Does it do both basic needs and livelihood and employment? Because something that does both is going to take priority over something that only does one thing. Does that answer your question, Representative?
Yeah, it does, and I think that is a good strategy. Although these are emergency funds, if we do have that process in place for entitlement funds, I feel like it should be no different. Just to protect the city, because it is a really large amount, but also we need to be cognizant of the fact that there may be parties in the public that are not going to do so good things with funding, and so we need to be able to put as many safeguards in place, specifically related to checks and balances, making sure there's no direct financial interest. So those are the very specific things that I have in mind, which is why it gives me a lot of hesitation to say yes, go for it. Without seeing those safeguards in place. So I know there's a lot of faith and hope that we have to put in this process, and I do have that in you in your capacity as the director of this department. I really need to see that so that I can feel comfortable speaking to my constituents related to what safeguards we're putting into place to protect these dollars, and that there's not one organization that will have a direct financial interest with these dollars. So yes, you did answer my question. I'm sorry, Mrs. Neiman, did you?
Yeah, Representative. Well, I didn't want to.
Thank you. I was going on and on.
Carla, could I say something before you jump in?
Of course.
Ms. Hernandez, I would like to speak to that point that Robert made about the audits. We've had 0 findings the last 4 years, and that's not by accident. And so we take those things very seriously. And when we placed Nicole in this position, one of her priorities was to track all the different funds. And it went all the way back to the early 2000s in terms of some of the issues that the city had in the past. So the fact that we've got a very tried and true system, I can look you in the eye and tell you that we have one of the best systems probably in the state of Texas, if not the United States, with respect to how we monitor our funds and the team we have in place. So I have absolute confidence in what Nicole Farini has put in place. I have absolute confidence in what Margarita Munoz has put in place with the resources we've given them in order to effectuate these changes, and obviously what Robert Cortines and Nicole Cody have also overlaid that with the systems and processes that we have. So we would not be bringing this in front of council if this was not a tried and true process and system. And we very much appreciate your questions.
Thank you, Tommy.
Representative Hernandez, I wanted to address your question specifically as to how we're going about doing your repeated question about the systems and checks and balances. So currently, you're correct. Under the emergency ordinance, the city manager was granted authority to enter into goods and services over the $50,000 based on an emergency situation. That has been issued in the last couple of weeks, as you have seen with El Pasoans for Hunger, things of that sort. I understand your hesitation with giving a broad authority to the city manager to spend $119 million. What our office has been doing in the last several weeks, I've reached out to several groups within the state of Texas, like the same 6 cities that Nicole is meeting with, her counterparts. I've been doing the same. And we've been having some very in-depth conversations about the CARES Act and what other cities are doing. And we were privy to have the CFO of Dallas give us a recitation of the things that they were doing in terms of ensuring that the funds were being properly used. What we will be doing locally, and the way that the resolution was worded, is taken directly out of the directives that the Treasury Department put out. So we are using the same analysis and the same test that the Department of Treasury has set out for these funds. I think that there's a lot of gray areas, and I think a lot of us are having the same questions about how do you document the proper use of those funds. Our office will be working very closely with the city manager's office and the comptroller's office. We're very familiar with Nicole's system for grants. Several of the lawyers helped Nicole in that area. We are anticipating duplicating some of those systems of checks and balances across the organization to ensure that those funds are being used adequately. Obviously, I think that, and this has been my experience, and I don't think the city manager would disagree, anytime that we want, despite the fact that we may have authority, we very often bring it back to council anyway, because we want to tell you that it's happening, because we want your blessing, even though you already told us that it was okay. It gives you that additional reassurance. I don't believe that it's going to be any different in this instance. Obviously, we won't do it in a way that it's going to backlog the system, or if we're in a real need, right, that we will report. But it harkens back to what the city manager was saying, that we will create a reporting mechanism. And then there's also some other reassurance based on what Robert and the city manager were talking about in terms of our audit findings. One of the recommendations that I've heard from other cities is that they're using their external auditor to look at the proposed use of the funds and the systems, the checks and balances that we're proposing, and having our external auditor bless it beforehand. And that's something that I think will go even above and beyond to create that additional reassurance based on the parameters that we're seeing. Just last week, the CARES Act there's an additional set of recommendations that were issued, and we're following all that closely. So a lot of the cities are going through this, and we're talking to our counterparts across the state, and we're all thinking about these same things. So we're not going about doing it on our own. These are things that other cities are also doing. So if that provides you any more reassurance in terms of what we're doing at the city attorney's office to assist.
And if I may, let me just add just a greater context to what Robert keeps bringing up about visiting with the other top 6, the other 5 big cities, all 6 big cities. What we did is we reached out to all of them, all the city managers. We all got on a call together, and we did this about.
And they're starving. Can you get someone in there to get some formula?
I'm sorry, I think somebody was talking.
Tommy, if you could unmute yourself.
You're muted, Tommy. You're muted.
Okay, so I'll start all over again. My apologies. So what I was saying is that about a month ago, we started having a discussion and a dialogue with all the big city managers of cities, of big cities. And what we ended up doing, we also talked to Houston, even though they have a strong mayor form of government. We talked to one of their administrative people, their CFO. And what we ended up doing is coordinating all our actions at the CM level. And we made sure that all the CFOs were talking, and made sure all the city attorneys were talking. all the people in Nicole's position, whether they have resilience officer or a CDBG person, in order for us to all kind of cross-pollinate our responses. We did exactly what Ms. Hernandez is concerned about. We all were working to get on the same page so that we all had like minds on how we would be utilizing these funds, so that we would make sure that the federal government wouldn't come back and in their auditing that they would, pinpoint any one of us that, we weren't spending it appropriately. So what we wanted to do is all agree that these were expenditures that we all were doing in the big cities so that we can have strength in numbers. So that's just one more avenue of approach that we took in order to make sure that we're being extra careful, but also as expeditious as possible in how to spend these dollars, because we wanted to make sure that we had them all lined up to spend in the allotted time. We don't want to give any of it back to the federal government. We want all of it to go to our community in any form or fashion that we can make sure that it gets to them, because the need is great in our community here in El Paso.
Thank you. You've addressed a lot of my questions, and I do have other questions, but related to this item, Mr. Gonzalez, and I made no secret that I think that because council members have placed a number of CARES Act related items for tomorrow, that I would, respectfully ask that we take this action tomorrow. There's a lot of other things that are not included in this presentation that were covered, though, but from the perspective of the resolution, and to give the opportunity for council to talk about what they're proposing and why, I'm asking that we hold off on this action today, but tomorrow. I hear you're concerned about a delay. I don't think 1 day, 24 hours is going to be too much of a delay. I think that we're, for the most part, in agreement, but there are other things that we want to consider and talk about. So that's going to be my request. I know it's frustrating, but this is a lot of information that you have given us. I certainly want to study the presentation a little bit more closely and think about everything that was mentioned today, and then consider whether or not I have more questions tomorrow. But it's at the will of council if they're in agreement or not. So I would be making a motion to postpone this action tomorrow.
You mean postpone to tomorrow, right? Not postponing the one tomorrow. You're saying you would postpone this till tomorrow.
Yeah.
Correct. So postponing this action until tomorrow. So my motion is to postpone the action for this item for tomorrow.
Second.
Okay.
Second.
So let me just wrap up my thoughts really quick related to the testing. And so I've also talked to you about this, Mr. Gonzalez. So when we're thinking about looking at the data, it's taken about 60 days, you had mentioned, since the pandemic. So it's 7 to 8 weeks it has taken to reach about less than 2% of our population to have received some form of testing. I do understand that it's gone in phasing. Other communities across the country have gone to testing for asymptomatic persons. And I know that that's been a concern from other elected officials and other leaders in our community, that testing has not been as efficient and as quick. I have full faith that you're going to be able to do that. And I think the conversation that I want to have for tomorrow is to think about why it's taking so long, if there's additional funding or needs that you need. Really thinking about how do we get to that 5% as quick as possible. The estimates here are the end of June, but when you think about from the beginning of the pandemic to the end of June, you're already looking at about 4 months to hit 5% of your population. So I really just want to kind of get to the bottom of that, and you all have had some explanations, but is there a way that you can really focus on what are the limitations so that we can expedite that more, whether it's more staffing, whether it's utilizing furlough staff, whatever it may be? Because that has been the consistent concern I've heard across communities in Texas, is that the testing numbers are very low and it's taking too long.
Well, I do think that you hit the nail on the head. It's across the state of Texas, not just only in El Paso. And I know that early on that the federal government was giving priority to the areas that were hardest hit. So they were getting all the most latitude, most level of flexibility. If you remember at the very beginning of this pandemic, it took quite a bit to, you remember the presumptive cases that we would have. That's because we would do them locally, and then it had to be approved at the CDC. I don't know if you remember that far back, but that was the initial guidance by the CDC. So the federal guidelines have shifted and they've changed, and they've grown and they've evolved. And early on, it was just for first responders in terms of the testing, and then we had the drive-throughs. So it's come slower for places like El Paso. Now, what we have communicated to the governor's office, what we have communicated to the state, is that we're not seeing those dips like these other cities are seeing. That they're seeing these dips in the numbers, and we've also communicated our underlying health conditions that I mentioned earlier in our overview with regard to the health conditions that exist here in El Paso. And obviously that's different in every community based on the demographics. And so we've communicated that as well. So we want to make sure that we don't go too fast in the recovery process, that we base it on the data, and that we are basing it on the numbers and what we see. So we are now partnering and have been partnering, as I mentioned in the previous conversation, with the private sector, also with other entities, and we've shown and listed today how we're growing in those testing sites. So that's going to grow dramatically, and that was really an opportunity for us to take advantage of how the federal government has kind of opened up the testing opportunities that we have. So we brought in more partners to serve as these drive-through facilities. So really, we've been subjected quite a bit to what the federal guidelines have been. However, we've not been sitting back on that. I mentioned the UTEP example. That's something that we started several weeks ago. I want to say closer to 5, maybe 6 weeks ago that we started that discussion, and we started that discussion about the lab space and growing that, where we're going to have 500. It's going to be a matter of 24 hours when we're able to then share those results. So those are the kinds of things that we've been forward looking, and we have been partnering with our different entities that are not here locally, not just here locally, but externally. I know Emma Schwartz was very helpful in bringing in the private sector and in proposing something to us that would add value to what we're doing with Battelle. And so we have welcomed new partners. We have welcomed all the partners that are all of the stakeholder agencies that are in this community in order to increase the numbers. So you will see an exponential increase. I think that we want to make sure we're under promising and over delivering on those numbers with regard to the population being tested. We want to make sure we're realistic in those. We don't want to lead you on and give you information that we won't be able to follow through on. So even though, again, that we're subjected to some of the federal guidelines, we are not using that as an opportunity to not get something done. We're still showing varied partnerships in the community and the number of testing sites that we're going to be opening up in the very near future. And we've already opened up quite a bit already, but we're opening up a lot more in the very near future.
Thank you for bringing up the private partnerships like Battelle. That was a conversation I was hoping that we would have today on what those efforts are, and trying to really understand what value asset that they're providing to the community. Is Ms. Schwartz, is Emma on the line, or can somebody talk about a little bit more about that partnership? And if not today, tomorrow.
She talked about it earlier. I think she might still be on. Let's see if Dion has her on still. I know that she mentioned some things earlier in the conversation. We're happy to have her at the next council meeting, if not tomorrow.
Okay, no, that's fine. So, so Carla, Mrs. Neiman, and Mr. Gonzalez, you guys and Mrs. Fierni, you answered a lot of my questions that I've been having a lot of concerns with. And Mr. Gonzalez, I know that you have brought forward contracts or approvals during the pandemic after the fact, like the grant donations and the Project Lift. So I hope that we can continue that just for purposes of public input and transparency. And I, for one, know that I will be very interested in looking at how those distribution of funds are being given, and at least council be given notice on how those funds are being, who's receiving funds and how they're being distributed. So that's really my main focus and concern as part of this conversation and dialogue. So my motion stands, and I don't know if anyone else is ready to speak, but I'm complete. I'm done. Thank you.
Okay, before we get to Representative Mayor Pro Tem who wants to speak again, I want to make sure that there's not any other member of council, as we follow Robert's rules, who has not spoken would like to speak first. Okay, then I'll go to Mayor Pro Tem.
Thanks again, Mayor. So I guess, what is the current protocol that we have for testing? Or the one that we had last week when we were getting, when Mario, you were saying we were getting 250, 100 people showing up to be tested in a day.
So that's the same protocol we've had for the past week, for past few weeks, and it's opened up to anybody who has symptoms who wanted to get tested.
So now what's changed is, as of today, we're letting anybody who has symptoms or does not have symptoms to be able to test.
That is only at the new sites that we opened up. That's not at the federal lane.
So what is the rules at the federal lanes?
Same as it was last week when we were hitting the 250.
Because I'm seeing online that people are still being turned away, and there's a confusion about what are the protocols for each one. Also, something that's there as well, and I'd be remiss if I didn't bring this up. The third highest amount of cases in per zip code in the city is in 79912, which is pretty much most of the west side. There isn't any testing in that area going on, unless you want to correct me, because we've been inundated with people bringing up the concern that the closest testing site is Vinton.
I believe there was some clinics in the area that were doing testing. I'd have to look that up to be exact. I thought we did have some west side locations. The hospitals are also doing testing for those who go through the hospital system. Do we have mobile drive-through sites? No, we don't have that yet.
On the west side. Okay. And then in terms of these free testing sites, that was done based upon a heat map?
The location of them is being placed.
So I guess looking at, and I'm pretty sure almost all the council members have been seeing the same maps. 79912 is the third highest amount of cases in terms of just raw numbers. So I don't know, maybe the mayor can talk about the discussions he had with Austin about how they decided those sites.
Austin didn't decide those sites. We decided them. The Department of Public Health, the Office of Emergency Management, and our epidemiology team. It's based on the concentration. While the zip code might be showing a large number, whereas it's based on concentration within a smaller area with a smaller subset. So as you look at those bright heat map, the highlighted sections of the map, those are where we have more confirmed patients in one area. That's where we're trying to fill those voids as we go. Not spread out over a large area, but those that are in a real concentrated area. As we said, as these schools come on board, as we get additional testing sites coming up, that's how we'll start filling out going from there.
When are we going to have the testing protocols in place where we're allowing symptomatic or asymptomatic people to go at all testing sites?
Well, that as from the beginning and as the changes have been putting on us, the federal lane is dictated by the federal government. We have to follow their rules.
Was those the rules that we were following the first 2 months of this pandemic?
That's correct. They're the ones who are supplying those kits or the contract for those tests.
Okay. The thing about it is everybody wants to talk about reopening and needing to reopen and a balance between it. But let's talk about the people, us, who are going to actually be going to these businesses, hopefully going to these businesses again. People want to feel safe. People want to feel secure. And outside of social distancing, even Trump's own guidelines call for robust testing and contact tracing. So I'm at a loss why anybody would have any issue with wanting to have increased testing in our community or why anyone would have any issue with having more contact tracing. That is the only smart, educated, and safe way that we can reopen up our economy. I read an article that somebody compared it to not having testing and not having tracing in place. Essentially, you know, it'd be the same as in World War II when we stormed Normandy, but we had no armor, we had no guns. We just ran at the beach. And so we have an opportunity, this community, to make sure that we open and we look at a phased reopening as responsible in the safe way possible. And part of that is testing, and part of that is contract tracing. And I want to commend staff for making sure that that's central and part of how we look at allocating these funds moving forward.
Mayor Pro Tem, I did want to help Mario out on some of the locations that we talked about. There is one in the 79912. The Walmart is a testing site, and then there's another one in the 555, the one on North Mesa rather. There is one located there as well. So we will get a distribution of the locations out to the council, and we'll definitely make sure that's on the website, and so that people can see where they're located. And what I also will do, I'll make sure that the staff puts information in there to determine which ones are federal, which ones are the ones we've partnered, and which ones do symptomatic, asymptomatic, or both. So I'll make sure that that's clear to them, and also the hours of operation, so that they're aware, and phone numbers. I'll make sure that all that information can be found in one location on our website. I'll make sure the council gets it so that they can send it out via their distribution emails as well.
And I would suggest respectfully, if at all possible, you know, to work with the private sector to see if we could have a list or a map of the private sector testing labs as well. I think, again, that would go a long way. Now, again, if it's not possible, I don't want to volunteer. I understand that information, but again, trying to assuage the concerns of safety from the public would help to see as many testing facilities and their locations as possible.
Well, I am sorry if I didn't make that clear, but in order to ameliorate their concerns, we can definitely ensure that those are included as well. But that was my intention. I wasn't going, when I said these sites, because earlier when I presented all the different sites, I wasn't just talking about our sites. I was talking about ours, the federal, I was talking about the private sector. I was talking about all of them together. So we would not exclude any of the sites that are out there, and we would make sure that they knew if it was free of charge or if they have to pay, if it's private or public, and where they're located. We'll make sure that that's clear.
Okay.
And also, as a part of
some
the
of those,
presentation, if I can real quickly, sorry, Chief.
Yes, sir.
Just remember, there is 84.2 million that we're recommending to go towards public health and safety initiatives. So one of those big ones, obviously, is the testing to increase and expand. We have an executive session item on the agenda relating to real estate acquisitions that we are prepared to discuss as well. But I mean, I think the chief has touched on some of it. I think that once we get into executive session and we talk about how we're going to advance those efforts, would really be helpful for the council.
Yeah, I mean, public health as a whole obviously has shifted in its interest and importance in our community and our country over the last 3 months. So that should probably be reflected as well moving forward. I'm with a lot of the other members of council right now. I still have a number of questions, and I also think too, out of the fact that a number of us had placed items on the agenda for yesterday, that what would be the most responsible and appropriate thing to do is just to, postpone this item until tomorrow. It's a lot of decisions, a lot of questions. I think that some of us still have, and so I just wanted to echo the support from the other council members in terms of letting us sleep on this for the night before moving forward. So
what would be helpful for us as staff is if you do have additional questions or things that weren't touched on, to let us know what those are. The presentation was built around not only hearing from the council, but also from the community as far as what were those priorities, what were the key areas that they wanted to see these dollars go towards. And I think for the most part, I mean, just looking at the list of the items on the agenda for tomorrow, we've touched on those items.
Yeah, no, we have, but there were some that was also brought up by the in public comment as well. So yeah, I think that would be good. And then also, I just want to thank Mario and his.
Mayor Pro Tem, before you get too far along, it would be good that if y'all do decide to vote on it, if the votes are there to move it to tomorrow, I don't want to lose track of what Robert asked, that the entire council, they have questions for them to submit to us so that we can make sure that we're prepared to answer those, and you'll get a better answer. We can answer like we are today on the fly, I guess, but if you get it to us ahead of time, we'll make sure that we are as well prepared as we can be to give a comprehensive answer.
Yes, sir. And then I also want to thank, Mario, and y'all for working with Patel. I was hoping we get a more formal presentation, so maybe that's something that we can get from them in the not too distant future as well.
We had prepped them to do that, and so I think right now they're presenting to the county. So whether they do that later on today, or they can do it tomorrow or the next council meeting, they'll be prepared to do that in the future.
Yeah.
Representative Rivera.
Go ahead, Mayor. I was going to comment, but my questions were answered. I'm ready to take the vote. Thank you.
All right. Quite candidly, I don't think we've ever had a more thorough presentation, and I want to thank Mario and Nicole and everyone, Dion and everyone for all their presentation, Robert, et cetera. I don't think we can micromanage this process. The government's pretty well dictating it. And I would hope we would vote today and that you would turn down this particular motion, but let's move ahead.
Okay, Mayor, we do have a motion and a second to postpone item 2 until tomorrow. On that motion, Mayor Pro Tem Schwartzbein?
Yes.
Representative Anello?
Aye.
Hernandez?
Yes.
Morgan?
No.
Salcido?
Aye.
Rodriguez?
Yes.
Rivera?
Yes.
And Lizarraga?
No.
The motion passes with 6 affirmative votes. Representatives Morgan and Rivera voting nay. The motion does pass. We now go to item 3. And item 3.
That was Lizarraga who voted nay.
Thank you. Representatives Morgan and Lizarraga voting nay. The remainder of council voting aye. The motion does pass. The next item is number 3. This is the Animal Services COVID-19 Emergency Response Update.
Good afternoon, Mayor and Council. I'm just getting the presentation up. Good afternoon, this is Paula Powell from El Paso Animal Services, and we're gonna share with you some actually pretty good news about what's happened at El Paso Animal Services with COVID-19. And we call this now El Paso Animal Services the new normal. And what's great is that our vision, mission, and values stay unchanged throughout our response to COVID-19 and before and what we think will happen afterwards, along with our strategic goals. So let's get to what's happened. Before COVID-19, El Paso Animal Services, and you know this because we've presented a lot, was improving in all areas, and we were well on our way to our 2020 goals. But we still had a huge intake and huge inventory numbers, and it consumed most of our days just fighting to save all of the animals in our care. But during COVID, something amazing happened. We changed our operations to our emergency operations with the help from the fire department in changing all of our protocols. But what we found out is that the community demonstrated willingness to help, and they continue to help. And at El Paso Animal Services right now, we have less than 300 dogs, which has never happened since I've been there. So what we've seen is the community should continue to help us in ways that we have never thought of before. And in the future, we think together with this continued help from our community, our city will save more pets than it's ever saved before. And I'll go a little more detail on that. So to talk about what was happening before, again, I presented a lot. And I've shown you all of the amazing things that we've done. We've done a really good job. But the community still brought in any animal. The fosters were only the few that really wanted to work with us or had experience rescuing. The animal protection answered all of the calls for all the strays, healthy, sick, injured, everything. The shelter, it was full year-round. The shelter's been pretty much full since I've been director. And the disease in the shelter, we were in control of it. We had medical protocols that helped us treat it, but we still had disease in the shelter because we were getting so many animals. And the staff was only able to provide the basic care because we were relying on the help from volunteers to provide any additional attention because we had so many. And our community engagement was only educational. We had We Will rallies, we had different things, but it was not to the extent that we've had during COVID. But an amazing thing that we did was we developed together with the community and with your help a quality strategic plan. During our COVID emergency preparedness, the last 2 months, animal protection answered only high priority calls, serving the most in need, serving the injured, serving the sick, the traumas, and the dangerous animals that are out in our community. The community found ways to reunite strays, the community themselves. They didn't bring them into the shelter. They actually reunited them with our help. The community fostered over 1,200 pets, and I actually don't know any other community that has done so well. 1,200 pets, instead of being in a shelter, are in homes throughout El Paso. Our shelter was closed to the public, and our shelter is at a manageable capacity for the first time in years. Disease in the shelter dropped dramatically within a matter of weeks. We halted all unnecessary surgical procedures according to the CDC guidelines. And what happened was something amazing. The staff were motivated to try new things and make repairs to the facilities and upgrade programs. And the morale of the staff really, it's continued to be something that I haven't seen since I've been here. And again, the community engagement, it's everything. It was defined as total involvement from everything. We asked the community to help, and you'll see some stats in a minute that are going to be amazing. But the community came through for us big time. This El Paso community loves their pets, and you're going to see the numbers, and you're going to be amazed. But again, the strategic plan is unchanged. Only some of the performance metrics will change as we move forward. So in the future, with what we've learned over the last 2 months, is that we're going to further our community support program so that our community can continue doing what they're doing now and helping us find homes for strays. We're going to enhance that foster program to provide a support team like we're doing now to provide consistent customer-centric service. We're going to continue responding to calls by priority. We're going to strive to maintain our shelter population at 50% or lower than last year. We're going to have public access in some areas by appointment only. We're not just going to have a bunch of people walk up with 100 dogs per day. We're going to involve the community in everything, as they have been the solution. We're going to continue and enhance our virtual education program. We're going to update our performance metrics in our strategic plan. And we're going to provide a designated professional animal service community support team. They're going to be out in the community supporting. And I'll show you a video of us already doing that during COVID. But what we are going to do is we're going to save more pets than ever before. So kind of demonstrating this, we've got what I'm going to show you is our regional life-saving rate. And actually El Paso is leading this charge. Other cities across the country are looking at what we're doing today and actually watching this city council meeting, because this formula was demonstrated. It was put together by a team from all across the country, but our team is leading it. And what happened with the shelter live release rate is we demonstrated what was live leaving from the shelter, but we did not demonstrate what the community was doing. So we had to put together a lot of information to demonstrate the overall impact of a pet saved in the shelter and our community. So what we came up with, and I won't go into all the math for you, but the only change is that the community reunification rate, what's happening now is they're not bringing strays into the side door here at El Paso Animal Services. The community is finding ways to get the pets home. They're either keeping the pet, they're finding their owner, or they're giving their pet to someone else if they find a pet. And that's happening all across the city right now. And I'll show you that number here in a minute of our April numbers. So taking that into effect and what all of the community is doing with the foster program, we're going to tell you what the life-saving rate is for the community. This is basically how many animals are alive within our community. So here's April. The community reunification rate right there is astounding. In April, it's at the bottom of the list there, 1,672 animals the community didn't even bring into the shelter. They actually found homes for it. They either kept the animal or adopted it out themselves without even bringing the animal into the shelter and putting the animal at risk. And if you look at this, the number of fosters is there, the in-shelter foster and the in-foster, 1,236 in-foster at the end of April to come up with a regional life-saving rate. This is the formula that demonstrates the overall impact of pets saved in the shelter and the community of 97.16. It's amazing to see what our community can do together. I kind of got chills in my arms right now when I said that. So what's happened in shelters all across the country, and this is a graphic that I got from Dr. Mike Greenberg from Maddie's Fund, is shelter is being redefined all across the country, and we are no different in El Paso. So I only think different about this graphic is I put our star on it because I like our El Paso star. But what's happened is we fought and fought and fought on the left-hand side to get to our 90% by doing all these different things. And COVID did was it catapulted us over this mountain. It catapulted us onto the other side. Because now our intake is made up of hard cases, the ones that actually need our help, the sick, the injured, and dangerous. And so when that happens, we're actually going down the other side of the mountain, and I'll show you those numbers. But what does that mean for the community and their pets? If we look at what's happened, animal services will be the last resort for healthy and friendly pets. Pets truly in need will get the care they deserve. The pet population in the shelter will be happier and healthier. Finding your lost pet will be easier and closer to your home. We have new programs that our staff came up with to make this a lot easier. And the community is going to have the ability to be involved in all life-saving at all levels, not just, coming in here and walking dogs, but they're going to be able to help us rehome, foster, caring, volunteering, all of these things. When that happens, when our community does all of those, El Paso will be one of the most pet-friendly cities in America. So let's take a look at the data for April. This is for April. Our stray intake. Right there on the first graphic, 2,146 came in the side door here at El Paso Animal Services in April of last year. In 2020, 287. That means those animals that didn't come in the side door, they're being helped by our community. They're giving us calls. We're helping them rehome. We're doing all kinds of things to provide that extra community support, that virtual community support to help prevent the stray intake from coming in the side door. Our average daily inventory for the month of April, and it's going down a lot, was 366 animals in the shelter. Our calls for service, a lot of people think public safety's been at risk since we're only going for the priority calls, but we are handling the dangerous calls. We are handling the vicious calls. And this is the number of calls that are coming in. We are having less calls for service because community is helping out. They're not just, oh, okay, let's call animal services, there's a loose dog. They're going, oh, there's a loose dog in my neighborhood. Let me walk down the street and see if it belongs to anybody. And so they're solving a lot of problems themselves instead of automatically calling animal services. The other thing is the fosters, 1,236. That number is astounding. And it's actually going up as we speak. Every day we're delivering to fosters, and I'll show you a video of that. Our community is amazing, and what they've done in the last 2 months to help the animals of El Paso has been something that nobody can explain. So look at this data. Died in care, 27. Last year, 2019, 74. Remember, the died in care includes our foster care. So the 1,200 animals that we have out in homes, they're not dying because they're being cared for. They're being cared for. They're not being overlooked. They're not being crowded. Our community is coming forth and helping us save animals. The euthanasia, again, those numbers dropped dramatically in 2020. This is showing way less animals are dying in our shelter. The shelter live release rate, again, last April, 89.43. And I've told you that earlier that we've gone over the mountain and we're going on the other side of the mountain, and this is how I can explain it the best, 65.54. That's because the percentage of animals that we have coming in are those most in need. And we've been able to save a lot of those most in need that we never have been able to save before. We have parvo puppies that we're saving now. We have animals that got hit by cars that we're saving now. We are doing all that we can. And it's pretty amazing to see that those most needy are getting the help that they need, and they don't get lost in an overcrowded system now. And our regional life-saving rate, we did compare that same formula that I showed you earlier to 2019, 2020. Our community was already stepping up a bit. This is what this is showing me in 2019, and you guys know that from all of our previous presentations where we've shown that we were improving. But I'll tell you, when COVID hit and the community stepped forward, it really skyrocketed us. And you know, I can't thank the El Paso community enough for what they've done to save the animals, not only in our shelter, but in our community. And I wanted to show you a quick video. Let's see if I can do this. Ramon? It's not showing. Can't get it. There we go. Show you a quick video of how we do this safely to protect the community. Wait. And how we do it safely to protect our staff.
Paula, this is Laura Cruz. You may need to actually stop it and reshare your video because the audio, you need to make sure that the audio link is on. We can also show it. IT also has a copy of the video. We can show it. Miss Paula. We're going to stop the video. We're going to have IT show the video, if you'll allow it.
What happened?
IT is going to show the video. Give us a second.
Looks like IT is going to help me with the video.
Paula, if you could go ahead and take control again.
So some of the community feedback also, we've actually put out some surveys, and we got some good input from our community in reference to our fostering and also different volunteers that have come forth. Are really amazed at the work that not only that we've done in El Paso Animal Services, but again, I have to give credit to the community and the amazing team that we have here in El Paso. We really did some great work. And Mary from one of our fosters and a rescuer actually gave us some good ideas on the chip scanners outside. So we're actually following up on some teams for that. A lot of our team here at El Paso Animal Services is on some national committees helping to improve not only El Paso but our entire country. And some national leaders are actually have something to say about us here in El Paso. Oops. Mike Greenberg, he's the one that we worked with a lot with formula. Ellen Jefferson from American Pets Alive, and Julie Castle from Best Friends. Animal services across the country is changed with COVID, and we expect to take what we've learned from COVID and utilize that to improve life-saving throughout communities, not only El Paso, but across the country. And I also like to give thanks to a lot of other people that have helped us to this point get through this, and that's also the fire department, the Parks and Rec department. We have Parks and Rec staffers in here helping us walk dogs, and all of my amazing team. I cannot say that we could have done any of this because it was a lot of change. We've had to do a lot of things this last 2 months, and they've really stepped up. All of them have stepped up, and it's been something exciting because I think we figured this out now. We can only do this together. We've been saying it for a long time, and El Paso is doing it. And do you have any questions?
Representative Rivera has a question.
It's more of a statement. Thank you, Mayor. Ms. Powell, thank you for the great presentation you just made. Apparently, I have a close friend. Her and her husband apparently just fostered a dog, and they had nothing but praise for you and your staff. How you treated them like royalty and took care of the dog's needs, and eventually that dog was adopted by someone else. And I thank you for the work that you're doing. You and your staff are really stepping up to the plate. Thank you so much.
Thank you, sir.
Well, if there are no other questions, we'll move on to the next item.
The next item is number 4. This is a presentation on the Texas Disaster Act of 1975 as it pertains to local emergency declarations, directives, and ordinances in relation to COVID-19.
Good afternoon. This is Anna Schumacher from the City Attorney's Office, and Omar De La Rosa. If IT will please bring up our presentation.
IT is bringing up the presentation, Ms. Schumacher.
Thank you. Thank you. And Omar, I'll let you go ahead and get started.
Thank you, Anna. Hi, this is Omar De La Rosa for the record. Good afternoon, Council, City Manager, City Attorney.
We've got an echo.
Yeah, I can hear it too. Hello?
Omar, this is Laura Cruz. I'm going to mute everybody.
I can get started. I know it's been a long day, so I'll just...
Omar, I'm going to mute everybody. If you could unmute yourself once I mute everybody. Go ahead and unmute yourself.
They took him off the screen. I don't know why. He was on the screen.
So the purpose of this presentation is to go ahead and provide an overview of the legal issues that arise during a time of disaster, and also to provide a sort of an overview of what has happened at a local level in terms of the emergency directives that the city of El Paso has issued. Can we go to the next slide, please?
That's because we have the presentation as full screen.
So we have the Texas Disaster Act of 1975, which was enacted by the Texas legislature as a way to respond to the effects of natural and man-made disasters. And another important aspect of the Texas Disaster Act was that it was meant to clarify and to strengthen the roles of the governor, the state, and local governments in terms of how to prepare, respond, and recover from a disaster. Can we go to the next slide, please? So the Texas Disaster Act of 1975 defines a disaster as an imminent threat to injury, property, or life that results from any natural or man-made cause, such as fires, floods, earthquakes, which are the most common ones, and then, of course, in this instance, an epidemic. Can we go to the next slide, please? And just a very, very basic overview of how the Act works is it all starts by a declaration from the presiding officer of a local emergency. And under Chapter 418, the presiding officer would be the mayor for the city of El Paso. And we can see this under our city charter under 4.1. What a declaration of disaster does is that it automatically activates the city's emergency management plan. And it also allows for the use of all assistance under the plan. And separate and aside from that, it's also going to trigger certain powers on the presiding officer, which we'll discuss a little bit further. However, the declaration is only good for 7 days unless council agrees or the governing body agrees to extend that, which we'll see how that happened at the local level. Can we go to the next slide, please? And I'll say that the first declaration was issued by the mayor on March 13, 2020. So once the mayor issued that declaration, it automatically activated our emergency plan. Like I said, once a disaster is declared, there's certain powers of the mayor that are automatically instituted by operation of Chapter 418. And what Chapter 418 tells us is that the presiding officer also acts as the emergency management director for the locality. Again, under our city charter and our city code, that would be the mayor. And one of the important aspects of the emergency management director is that the emergency management director, which in this case is the mayor, now acts as the governor's agent in the locality and gets to exercise all the powers that are granted to the governor at a local level. So just to provide some few examples of what that means, the governor would have the power to suspend certain laws and rules, to use available local resources that are necessary to cope with the disaster. The next one, we see it more in instances of, natural disasters like hurricanes and earthquakes, where the mayor would get to control the ingress and egress from the disaster area, and also the restriction of alcohol. Can we go to the next slide, please? So again, I said once the declaration is issued, there's certain powers that are triggered that the mayor can exercise, and then the other aspect that the declaration does is it activates our emergency management plan. Under Chapter 418, every locality is tasked with preparing and keeping current an emergency management plan for the area that provides for disaster mitigation, preparedness, response, and recovery. So what this plan will do is it'll actually tell us who's responsible for all these areas. So for example, right, in our case, it would say which department is responsible for the testing and which entity is responsible for shelters, that sort of thing. So our emergency plan would already provide for all those things. A couple of important persons in the plan are the emergency management director, we just said is the presiding officer, the mayor, and the emergency management coordinator. In this case is Chief Jorge Rodriguez. And the emergency management coordinator under the emergency plan is really that person that coordinates all the efforts between all the agencies responsible under the plan for responding to the emergency. Can we go to the next slide, please?
Thank you, Omar. So as you all know, under the Texas Open Meetings Act, we have to provide at least 72 hours notice to the public before we have a meeting. However, there are two instances when we are exempt from that, and that's when there is an emergency or there is urgent public necessity. Now, the way that we know that that exists is twofold. One, when there's an imminent threat to public health and safety, or there's a reasonably unforeseeable situation. Now, just recently, due to Senate Bill 494, which took effect on September 1st, 2019, the term epidemic was added to unforeseeable situation, which is where we are now. Since all of this took place, which has been the last 2 months, we've called two urgent public necessity meetings, and the first one was on March 16th, 2020, and that's when the mayor called that meeting in order to discuss the emergency ordinances. The second was on March 26, 2020, and that was to discuss the amendment to the emergency ordinance. Next slide, please. Thank you. So under the emergency ordinances, this is governed by City Charter 3.10. The way that we pass these is to meet a public emergency affecting life, health, property, or the public peace. Now, unlike the 72 hours notice that is required by the Texas Open Meetings Act, this only requires 2 hours of public notice. It does, however, require the unanimous vote of the representatives present and voting and the consent of the mayor in order to be adopted. Now, per our city charter, these can only last for up to 30 days unless it's terminated before then or it's reenacted. However, either way, unless it's reenacted, this will automatically stand repealed on the 31st day. There are some exceptions in terms of what an emergency ordinance cannot do, and that is impose a tax or extend or grant a franchise agreement or convey real property. Next slide, please. So the way that all of these terms that have been used throughout the emergency tie together are as follows. So as Omar described, the mayor issued a disaster declaration. Those can only last for up to 7 days. And that's both per our city code and also per Chapter 418 of the Texas Government Code. Thereafter, in order to extend that, then City Council could adopt an emergency ordinance, right, which is governed by City Charter 3.10. That can be valid for up to 30 days, and it will stand, as we just said, automatically repealed on the 31st day. While there is an emergency ordinance extending that disaster declaration in place, the mayor can issue proclamations, regulations, or directives that are necessary for the protection of life and property in the city. And that's both per our city code as well as per state law. And so right now, for example, all of the directives that the mayor has issued are stemming from the power granted by the extension of the disaster declaration through an emergency ordinance. Next slide, please. So here is, we've been pretty busy over the course of the last two months. And so as Omar described earlier on, it all began whenever the mayor issued the emergency declaration, and that was back on March 13, 2020. That was the same day that the president had issued a national emergency. It was also the same day that Governor Abbott declared a state of disaster. It was the same day that the county declared a state of disaster. When we issued this that day, we didn't know, but we would have our very first presumptive COVID case that evening. Then on March 17th, 2020, since the declaration only lasts for 7 days, City Council acted by extending that disaster declaration through Emergency Ordinance 019035. That same day, we also adopted the Emergency Ordinance number 019036, which is the institution of the emergency measures. Now, if you all will recall, that was the same ordinance that suspends certain boards and commissions, except those required by state law. It instituted certain price controls. It restricted the movement of people and the occupancy of premises for bars, lounges, and restaurants. And it also stopped or limited gatherings of more than 50 people, with some exceptions. Then on March 24th, the mayor issued the local emergency directive, which is better known as the Stay Home, Work Safe directive. Now, at the time, the Governor Abbott said that because there were so few counties that were still impacted, that he didn't feel the need to issue a stay-at-home order at this place. So the city of El Paso was actually among the first cities to issue one of these directives. At the time, we then came out and limited gatherings of no more than 10 people outside of a single household. We also said that you shouldn't leave your home except for essential activities, essential businesses, and critical infrastructure. We also instituted social distancing through that directive. Then on March 30th, 2020, Emergency Ordinance 019045 amended the emergency ordinance that instituted emergency measures. And so in that ordinance, we limited gatherings to no more than 10 people. Also, at this point, we amended the ordinance to restrict people eating within a restaurant. The other thing that we did, as you all may recall, is we extended or expanded Section 7 with regards to utilities and residences to encourage landlords and tenants to work together on a payment plan, and also disallowed the disconnection of local utilities or evictions to commercial customers. Then on April 1st, 2020, the mayor issued his first amendment to the local emergency directive. At that point, Governor Abbott did go ahead and issue his stay-at-home order, which was Executive Order GA-14. And so we went ahead and integrated his executive order. On April 13, 2020, Emergency Ordinance 019050 reenacted Emergency Ordinance number 019035, which extended the disaster declaration. And that would run through May 13, 2020. So we're getting pretty close to where we are today. That same day, Council adopted Emergency Ordinance 019051, which reenacted Emergency Ordinance 019036, which is that Emergency Measures Ordinance. And through that, what you all did is you also suspended and modified City Code Section 12.56.020, which allowed the Director of International Bridges or his designee to suspend the parking meter fees that would enable convenient access for curbside pickup near essential businesses. Then moving along to April 23rd, the mayor issued his second amendment to the local emergency directive. At this point, we had 645 COVID cases within the city. Through that directive, we moved to incorporate the governor's executive order GA-16, which is what most people know as the move to reopen Texas, which is the retail to-go provisions. We also, through that directive, required face coverings. Then on April 29th, the mayor issued his third amendment to the local emergency directive. And through that, we integrated Executive Order GA-18, which added malls, movie theaters, and restaurants to be open at 25% occupancy. And it also added all of the governor's checklists from his Reopen Texas report. On April 30th, 2020, we made the amendment to the mayor's third amendment emergency directive, which still enforced face masks, or required face masks, I should say. It also said that there should be no social gatherings outside of a single household. That brings us then to May 7th, which was a second amendment to the mayor's third amendment emergency directive. And so that opened swimming pools with the exception of city pools. It also provided for weddings and wedding venues, and it opened nail salons and barber shops that opened just this past Friday. Now, why this all matters is because both of our emergency ordinances are set to expire on May 13, 2020, unless you all choose to reenact our current emergency ordinances. Historically, we have been doing that for the past, for 30 days, right, because they sunset on the 31st day. And so in order to continue both the emergency ordinances and the mayor's directive, the emergency ordinance extending the disaster declaration would need to be adopted. And thank you, and we'll take whatever questions you all may have.
Mayor Pro Tem has a question.
Yes, sir.
Yes, thanks again, Mayor. I'm just curious about a little bit more, if you could expand on part of the provision from the Disaster Act about the ability to control ingress and egress.
Sure. So it's actually under Chapter 418. That is one of both the mayor's powers, who acts as a local agent for the governor during a disaster. And we have also included that within the emergency ordinance that you all adopted. So it's something that stems from state law during a disaster.
And what are some examples of what would that mean about controlling ingress and egress?
Sure. So the way that the governor has actually cited to it in a lot of his executive orders is that you limit the people that come and go within certain buildings or facilities. But you all also could do it, for example, to limit the people that are coming in from other states, for example. Earlier on, maybe I think about a month ago, the state of Louisiana, for example, was a place of high levels of COVID. And so the governor at the time, right, said that certain people were going to be subject to quarantine for a certain amount of time. And so that's an example of how you could control ingress and egress.
Okay, thank you.
My pleasure.
I have no other questions, so I guess we can move on to 5.
Thank you.
Item number 5 is discussion and action on an emergency ordinance reenacting emergency ordinance number 019035, extending a disaster declaration due to a public health emergency. Is there a motion?
Motion to approve.
Second by Representative Vanilla.
We have a motion and a second. Is there any further discussion? Then let's vote.
Okay, there is a motion and a second to approve the emergency ordinance. Mayor Pro Tem Schwartzbein.
Aye.
Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido. Representative Salcido. You might be muted, ma'am. Representative Salcido is not present for this vote. Representative Rodriguez. Representative Rodriguez. Representative Rodriguez, you might be on mute, ma'am. Star 6. Representative Rodriguez is not present. Representative Rivera?
Yes.
Representative Lizarraga?
Aye.
Representative Salcido, are you there, ma'am? She's not present. Representative Rodriguez? I don't believe she's present either. Mayor, do you consent?
I consent.
Thank you.
Laura?
Yes.
Representative Salcido is available. We need to wait for her to vote because you require a unanimous vote of all of council.
Yes, I
And
need.
Representative Rodriguez, are you on, ma'am?
We need Representative Salcido and Representative Rodriguez. Representatives Salcido or Rodriguez, are you present?
She's telling me that she can't, that it's not letting her.
Star 6?
I don't know if she's on the phone or if she's on an iPad.
Can she,
Can she text you, Laura?
Representative Salcido just sent me a text and she says, no ma'am, I can't hear you, Representative Salcido.
Tell her to log, can you log back in?
Can you log out, Representatives Salcido and Rodriguez, and then log back in? Okay, Representative Rodriguez is logging back in. Representative Salcido is also logging back in. Representative Rodriguez, your vote,
Here.
ma'am. Do you approve item number 5, the emergency ordinance on item number 5?
Yes.
Thank you. We just need Representative Salcido. She's logging back in.
Laura, can she text you?
Let me try calling her, Mayor. Let me call her on the phone and see if I can get her vote over the phone. Is that okay, Carla?
Yes, we're actually, I was just asking that question. Yes, she can text her vote. She's technically present.
Okay, I'm calling her on the phone.
Hello, Laura?
Yes, Representative Salcido, I have you on speakerphone. Do you approve the emergency ordinance on number 5 of the agenda?
Aye.
Thank you. In the voting session, the motion passes unanimously and the mayor did consent. Item number 6. Oh, I just lost Representative Salcido. Okay, item number 6 is discussion and action on an emergency ordinance reenacting emergency ordinance number 019036 as amended by emergency ordinance number 019045 and as amended and reenacted by emergency ordinance number 019051 penalty as provided in Section 8. Is there a motion?
Move to approve.
Second.
We have a motion and a second. Let's vote.
There is a motion and a second to approve item number 6, the emergency ordinance. Mayor Pro Tem Schwartzbein,
Aye.
Representative Anello,
Aye.
Hernandez,
Yes.
Morgan,
Yes.
Salcido,
Aye.
Rodriguez,
Yes.
Rivera,
Aye.
Lizarraga.
Aye.
Mayor, do you consent?
Yes, I do.
Thank you. In the voting session, the motion passes unanimously. May we have a motion to retire into executive session?
Motion to
So
retire
moved.
to
Second.
executive.
There's a motion and a second to retire into executive session. All in favor?
Aye.
Aye.
Anyone opposed? And the City Council of the City of El Paso may retire into executive session pursuant to Section 3.5A of the El Paso City Charter and the Texas Government Code, Chapter 551, Subchapter D, to discuss any of the following. Executive session item 1, briefing on letter of intent regarding golf course operation and concession project under 551.071, 551.072, and 551.087. Executive session item 2, the City of El Paso through the El Paso Water Utilities Public Service Board versus Mesa Executive Park LP, pending in the 8th Court of Appeals under case number 08-18-00199-CV, matter number 19-1009-1032 under 551.071. Executive session item 3, claim of Pigram Qualian matter number 19-1050-3371 under 551.071. Executive session item 4, proposed strategic real estate acquisitions for facilities necessary for COVID-19 response under 551.071 and 551.072. And executive session item 5, discussion regarding the acquisition of real property along Edgemer Boulevard related to the development of the Montana Rapid Transit System under 551.071 and 551.072. These matters are taken into executive session under 551.071, consultation with attorney, 551.072, deliberation regarding real property, and 551.087, deliberation regarding economic development negotiations. The members of City Council will participate in executive session via video conference. It is 2:54 p.m. And Council, we will be calling you shortly so you can join the executive session meeting. Thank you. Yeah. Is this mic on? Do you know if Jose turned
You
it
want the
on?
motion to reconvene then?
Is there a second to reconvene?
So moved.
There is a motion and a second to reconvene, to come out of executive session. All in favor?
Aye.
Anyone
Aye.
opposed? The meeting is back in session at 4:11 PM. Mayor Pro Tem?
Yes, so I have a motion on EX2. So, motion made, seconded, and carried that the city attorney be authorized settlement authority to resolve this case entitled The City of El Paso through the El Paso Water Utilities Public Service Board versus Mesa Executive Park LP, pending in the 8th Court of Appeals under cause number 818-00199-CV. The city attorney, through outside counsel for the city of El Paso, is authorized to negotiate a settlement agreement and sign all necessary documents to effectuate this authority under matter number 19-1009-1032, as recommended by the city attorney, adopted this 11th day of this glorious May 2020.
Second.
There's a motion and a second to approve the action read into the record by Mayor Pro Tem Schwartzbein on EX2. On that motion, Mayor Pro Tem Schwartzbein.
Aye.
Representative Manello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Aye.
And Lizarraga.
Aye.
And that motion passes unanimously. And there's no action on EX1, correct?
No.
Thank you. EX3?
EX3, motion made, seconded, and carried that the city attorney's office be authorized to accept the settlement demand and sign all necessary settlement documents in the property damage claim of claimant Balyam Pigrum, pending in matter number 19-1050-3371. Approved this day, March 11th of 2020.
Is there a second?
Second.
Okay, let's vote.
There is a motion and a second read into the record by Mayor Pro Tem Schwartzbein. On that motion, Mayor Pro Tem Schwartzbein.
Nay.
Representative Anello.
No.
Hernandez.
No.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Yes.
And Lizarraga.
Aye.
The motion passes with 5 affirmative votes. Representatives Schwartzbein, Anello, Hernandez voting nay. Representatives Morgan, Salcido, Rodriguez, Rivera, and Lizarraga voting aye. The motion passes. EX4,
No action.
EX5.
No action.
Council, may we have a motion to recess this work session until tomorrow after the regular city council meeting?
So moved.
Second.
There's a motion and a second to recess the work session until tomorrow after the regular city council meeting. All in favor?
Aye.
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 Anyone opposed? And the work session for Monday, May 11th, 2020 is in recess at 4:15 p.m. and will reconvene tomorrow, Tuesday, May 12th, after the regular city council meeting. Thank you.
Let's move for adjournment.
We just recessed, Mayor, until
Oh,
tomorrow.
recess?
Yes, sir.
All right.
Thank you.
Okay, let's go. We're gone. Bye.
Bye.
Bye.